This is a test. This is a test. Test 1, 2. This is what's going to happen while we're talking. We're just talking. Check 1, 2. This is our plan. Check 1, 2.
So wait, what's that mean? We're gonna misbehave up front.
For the first semester.
Let's make sure everybody.
There we go. So you can go back and forth between the two tabs there. And
Okay, so she'll say, answer questions.
Yeah.
You can just tab, use your tabs to go back.
Can you just say, Mark, are you here?
Over here.
Okay.
Mark, are you here?
I can hear you.
Thank you. Good.
I can also hear quite an echo.
How's it going? Doing fine. You can eat. Stick it in your bag down there.
I'm sorry in advance.
It's too long. Who cares?
I got loaded down before I came in.
Here we go. Are we all ready? Good afternoon. Welcome and thank you everyone in the audience and on the YouTube joining us this afternoon. I call this meeting of Montgomery County School Board to order at 1:05 on July 21st, 2020. Please stand for the Pledge of Allegiance. Thank you. Before I motion the adoption of agenda, I have to remind all of us that we have to really talk to the microphone so the YouTube folks can follow, and so is Mr. Chabaka, which will be joining electronically. May I have a motion to adopt the agenda as presented?
So moved.
I have a motion and second. Any opposed? Oh, all those in favor, I should say, all right. All those in favor? Yes. Any opposed? We have an agenda. The next item is our motion to approve Mr. Chabaka's participation in the meeting electronically as he's out of town. I have a motion, Ms. Franklin, and second, Ms. Bond. Any discussions? All those in favor, please say aye. Aye. Any opposed? Mr. Chabaka is ready to join. The next item is Dr. Meyer's announcements.
Okay, thank you. And thanks for everyone being here this afternoon. I just want to say thank you to our administrative staff for the time, work, and effort they've put in over the past several weeks, and the plan that has been put forth with hopefully several options that the board will be able to choose from as we move forward. So, but thanks to our administrators who have done an excellent job in preparing this document with everyone in mind. So.
Thank you. Definitely, it's an incredible document. I don't think any divisions in the Commonwealth have 90 pages document with this many details in every area. So I appreciate all the work to put together this document. One thing I need to remind everyone that has 23 decision points, and we have to make sure that we reach a consensus on each point, and then we'll move forward to the second on and on until we finish all 23. And then we will approve the plan as regular when we approve with a motion and a second and all that discussion at the end. So with that, I think Ms. Whitaker?
Yes. Ms. Whitaker?
For a minute. I can't get into my board doc.
Oh. But let's make sure that Ms. Franklin can get in board doc. We'll wait a few minutes for Ms. Franklin and Ms. Cass will be having access. Sure.
I'll go ahead and start if you're ready. Okay,
Ms.
great.
Franklin, you're good? Yeah, we're ready. Thanks. Thanks
Great.
for waiting.
Well, good afternoon. Thank you so much for being here today. We wanted to start today with walking through the activity that will be used for when you all get to the decision points so that you have an opportunity to do a practice run on that. As a reminder, we have the decision points embedded throughout the presentation, and you'll have an opportunity to respond with your feeling on that decision point as you go through the presentation. You can either select it when the question comes up, or if you feel like you know, you can put your decision point in at any time, and you are able to change those. So say you thought something was a decision and then you hear some points and you need to change your feeling on that, then you can certainly always change and resubmit. So if you all would like to open that, we'll do the first activity, the
Okay,
first
so
two
I
questions.
have a comment about this.
Yes, ma'am.
So this is something that should have been bought for the board as to how we were going to be making decisions and what tools we were going to be using. And to now have this happen right at the beginning of the meeting without the board discussing it, I think it's wrong. This should have been a decision of the board if this is how we were going to operate today.
It is not affecting our decision. It is only how to collect the data in terms of, how many of us we responded and how many of us still don't know what to do about that decision point. So it is not going to affect our
And
decision
again,
making. It is just the tallying.
How
Practice.
we are operating as a board is a decision that the board should make. And no board members were made aware of this until this morning. This is a decision that the board should have made.
But I did not feel like it is not affecting board's decision process. It is just a tool for Ms. Drake to make sure we, answer each and every decision and we have a consensus to move on the next one. So it is simple tallying the points so that we know for decision one, we have a consensus of, 5-2, 4-3, whatever that might be, so that we can move on the second decision, so it won't hold us, raising hands or to figure out who responded what. So that's just a,
And again,
it's like using the available electronic tools to help the process moving forward.
I don't have a problem with that. My problem is the board should have made the decision, should have been told or asked if this is something we wanted to use. This is not the decision of the chair or the superintendent or anybody else. We as a board should be involved in how we make decisions, how we operate.
I understand, Ms. Franklin, what you're saying, but now moving forward, we have to have a mechanism of tallying those decisions to move. And I don't know what board wants to do moving forward to use that tool, or, somebody in the audience have to tally, make sure that every decision have more than 4 to move forward.
Actually,
That's
we
why
were
we have-
informed that we were going to be using a tool. We just didn't know which tool, because I know Ms. Drake was working with IT to determine that. So it was in one of our emails that we would be voting via a tool for each data point that was given to us.
Okay, so I don't remember seeing any email like that. And quite frankly, it should have been a phone call from the chair or the superintendent to say, hey, this is what we're looking at doing. What do you think? And then brought to the board so that we decide if, as a board, that's how we move forward.
Is there anyone else that has any problems with this tool right now?
And again, I make it clear, I don't have a problem with the tool. I have a problem with the way it was done.
Mr. Chewbacca, are you trying to say something? I thought I
yeah,
heard you.
I guess I'm hearing a terrible echo. I don't know if are you guys hearing that echo, or is it just on my side?
We don't, we hear you well.
Okay, great. So I guess my issue is, as you guys, I'm sure all of us, we've received a lot of emails in the last several days, and I do remember seeing something about a tool I don't have it in front of me, so I'm wondering, and I don't see it in board docs. So, number one, if we're going to use this tool, can Brenda or somebody please send it out, or just tell me the subject matter that I can search my email on. And number two, I mean, for me personally, I guess I don't understand why we can't just talk about these things one at a time when we get there and have a public discussion about it. I mean, I think for me, you know, there's a lot of people that are interested in this and are interested in each of these items that we're making a decision on. I don't have a problem using the tool in addition to other things, but I think that it would be good to, you know, to have these discussions on each of these points and come to a consensus. And if we don't come to a consensus or there's disagreement, then we can take a, you know, a vote or a straw vote or whatever you want to call it, right?
Yeah, tool meant to be not to avoid the discussion or move on without discussing any of the points. I mean, we're gonna give the equal value to each decision making. We're gonna discuss and we're gonna have a consensus before move on. It's just a matter of fact when you have the consensus for us to know, you know, how many of us felt which way. So that's the only reason that tool being used. Ms. Cassie,
Yeah, is my mic working? Okay, wasn't sure if I had it on or not. I just wanted to make sure that it didn't replace the discussion.
No.
no.
Because I think it's important that we have that conversation and, you know, voting on, and some of the, because I actually had some questions about the choices when I was reading through it, but I didn't ask because I figured we could just talk about it when we were here. So I just wanted to make sure there was still that opportunity and we weren't forced to pick something that was on here if we had a problem with that.
It's just for purposes of tallying. It's not to avoid any discussion on the questions or more questions from the questions or any of that.
At any point, if the board wants to change choices, then that's fine. It was not meant to stifle anyone's opinion or thoughts. We want everybody to talk about all of it. If you can, you know, the way we handled, if you can remember the calendar situation a few weeks ago when we were making individual changes and we sort of had to go around the room and ask, what do you think? What do you think? You know, and do that consensus tally. This is just keeping us from having to do the consensus tally as we're moving forward so we can continue to move forward. But anyone can say anything they want about any item and say why they obviously think what they think. So it's it.
And again, if we are not comfortable to, you know, move on with that tool, it's just okay to, you know, paper tally what we want, you know, what our consensus, who said what, but this way we can share publicly, we thought as well, so that, you know, public will know how we felt about each and every decision point, so.
So I'm gonna say this one more time, and that's my point, and then we can move on. When these types of decisions are made as to how we operate as a board, it should be in front of the board to have that discussion. Whether we agree with it or not, we should be having the discussion as to how we operate.
And I understand, I apologize, I did not perceive as a board decision-making, it's just a practical tool I thought will help all of us. So if we're ready, let's move forward because we have really important decisions to make. And I don't want to run out of time at the end of the day.
So if each of you have that up in front of you, the Slido with the questions, the first question that comes up for you, the first two are just practice for you. So I believe the first question is, what is the best school division? And I'm not sure if it says state or world or universe, but all of the above. So if you want to go ahead and make your selection on that, and we'll be able to make sure that that is working.
Actually, it says what public communication efforts? No, I'm sorry.
We are in the
I'm
test
not on the
questions.
practice one.
Yeah.
Yes,
Sorry.
I have a question,
Yes,
Annie.
ma'am.
I noticed that you can pick all three. Are we supposed to have that availability to pick all three? Yeah. I didn't know if you wanted it, that it was just one.
And once you select your options, you'll want to scroll down and hit send at the bottom. You can do it for just those two questions. You'll be able to hit edit and go back and see the full list of questions again. But in order for your responses to be pushed through, you hit that send button at the bottom.
But you can't pick multiple on all of them?
Yes, you may.
Right, okay. 'Cause that's a point that is good.
don't
I apologize
see
for
it.
not saying the submit. Yes, please scroll to the bottom and submit. And then anytime you want to share yours, you are able to submit and just keep doing that. You can go back again and change them as well.
Okay, so
I don't
we're
have
su-
a submit.
We have send.
Scroll all the way
but
to the
is
bottom and
send
send.
after each question? Or
Or
is
is
that
it
what
after-
you're asking us to do?
Right now, we're just going to practice that
Okay,
first
but-
one to make sure that it does register. And then Ms. Graham will let you
Gotcha.
know that she has received those. So you can just answer question 1 and then scroll to the bottom and hit send. And then we'll do question 2 as well.
Just don't want to mess up right off the bat.
It's technology,
okay.
so you know.
Oh,
I could have done my favorite color too.
So mine goes, I don't see it.
okay.
I've got to scroll through 23
Got it.
to get to the bottom.
Thank you.
So that allows you to go back, say you have one thought and then maybe we didn't come to a consensus and you wanted to change it. They're all on one page, so you can change those answers if you
As you
feel the
go.
need to do that.
So you can go back and forth and
Yes, ma'am.
Right. So for instance, right now, since I will be moderating when we get to consensus, we have 6 people that have voted and we are at a consensus. And so I would let us know that we're at a consensus so that we can then move to the next topic. This is, of course, after discussion on each one and voting.
Mr. Chewbacca, were you able to access that?
Yes, I was. Hopefully you saw my response.
Okay, great.
Plus, it shows in the right-hand corner the consensus as well too, right? How many people have voted up there at the top?
yeah,
Think
it
it
does.
does.
I
How
have
many
6 so far.
Participants are in the poll, not
Yeah.
necessarily how many people have voted for a specific question. Ms.
Gotcha.
Graham has a results screen that she can see.
Gotcha.
Right. Okay, so now if you do the edit button, you will get to question 2, which is what is your favorite color? Is everybody seeing that? And if you could go ahead and vote on what your favorite color is?
I think I was too quick, did both of them at the same time.
That's okay,
And then you do
So-
need to hit send again.
right? So right now we have 5 votes for blue. So blue is consensus.
Oh, my.
So we can move on to the next topic.
Now we are where we,
Okay, is everybody comfortable with that before we move on of how it works? Okay.
Great.
All
So
right.
today we will be presenting to you version 3 of our updated draft for return to schools planning. As we've discussed, there are lots of decision points for you throughout the document. And each of us who is presenting is happy to answer any questions that you may have or to address any concerns or things that you might want to talk about that may not be within the document or that you need further understanding on. So in an introduction to our plan, we're just going to go, the presentation will go directly through the book. So if you have your book there, you can certainly reference that, and then we'll go through the slides with you as well, which is verbatim what's in the book. So we had guiding principles when we sat down to develop our return to schools plan. The first of those was ensuring that our students and employees have safe work and learning environments. The second is maximizing family choice and student learning format. We wanted to make sure that we had a variety of options for our families to choose from so that they could choose the option that they were most comfortable with. So those included in-person instruction, 100% remote instruction, and then an opportunity for 100% virtual instruction for our secondary children as well. We will describe each of those in more detail to you as we go through the program. Number 3 was ensuring that all students receive instruction that meets state and federal standards and that they have the necessary supports to ensure that they are treated equitably. And so that's through access to technology and connectivity, through social and emotional wellness and health supports, and through additional supports to meet the needs of special student populations. The fourth was providing time, support, and flexibility to ensure that staff are prepared for school to open and for us to have a successful reopening. And then our fifth guiding principle is providing proactive, clear communication to all families and staff members. We've looked several times at the state guidance on reopening schools, and so I'll just real quickly give a review of that, with the big note there being a reminder that these are recommendations coming to us and guidance from the state, that it is up to the local school board to determine what reopening looks like and how instruction will look in our schools. So under the governor's orders, we have 3 phases: phase 1, phase 2, and phase 3. When we closed school at the end of last year under Executive Order 53, we were in phase 1. And phase 1 meant there was no face-to-face instruction. All instruction was remote. And at that time also out in public, we had very small limited gatherings, no more than 10 individuals in the same room. Phase 2 was mostly remote instruction under the governor's guidance, and that's looking at 6 feet of physical separation. And then out in the public, it was limits of no more than 50 individuals in large gatherings. Phase 3, it still looked at remote instruction, but had more in-person instruction in place. And those large gatherings at that time, he had not determined how large the capacity could be for those. And then the last was beyond phase 3, which means the new normal, when we return to school under whatever that new normal looks like. And so across all of those phases, the guidance was for us to follow CDC guidance for schools pertaining to social and physical distancing, hygiene, health, cleaning, and disinfecting. There were certain principles that they want us to look at in all of the phases. Those are daily health screenings for students and staff, online and teleworking for those who have qualified medical reasons to not be in school, cloth coverings for students and families encouraged as developmentally appropriate when 6-foot spatial distancing could not be maintained, and then encouraging staff and students to stay home when they were sick through having clear policies on absences. So as you know, we are required to submit our plan to the state. We have to submit the instructional plan to the Department of Education and the health plan to the health commissioner. These are submission only. They will be collecting them, but there's not necessarily a review process where they're going to tell us they've approved our plan, because what it looks like is up to the local school board. We're simply submitting it so they have on file what it is that we will be doing. So in order for us to provide a little bit more scaffolded view at looking what instruction might look like, within the response team, we've developed levels under each phase. And so in phase 1, level 1, all students will participate in asynchronous remote instruction. This means no face-to-face instruction will be provided. In order to ensure equity in the delivery model, we cannot provide synchronous remote instruction because not all students have access to the internet in their homes. New information would be provided to students in a method similar to how the school year, the 1920 school year ended. Students would be provided new information and assignments in chunks and would either upload their completed assignments through Google Classroom or by jump drive pickup and delivery, which would be done through our bus routes. We would not operate any child care services, and MCPS facilities would not be available for child care. You will see within each of the levels of our phases, since we are providing and partnering with other groups as well as providing child care, that we're going to tell you at each phase what that child care would look like under the draft. Level 2, all students will participate in synchronous remote instruction. Students without access to the internet through MCPS provided MiFi devices may attend school in order to access the internet and their content. Teachers at that time would be able to bring their children into the classroom while working. MCPS would not operate any child care services, and MCPS facilities would not be available for child care. Level 1, phase 1, level 3, students with disabilities may be offered in-person instruction based on the needs of their IEP. Students receive English language learner services, and students without access to the internet, this school provided MiFi devices may attend. Teachers would be able to bring their own children to the classroom while working, and all other students would participate in synchronous remote instruction. MCPS will not operate any child care services, and facilities would not be available for use for child care. In phase 1, level 4, students with disabilities would be offered in-person instruction based on the needs of their IEP. in addition to students who receive ELL services, students without access to the internet, and students of employees may attend school. All other children would participate in synchronous and remote instruction. MCPS would not operate any childcare services, and facilities would not be available for childcare. In Phase 3, Level 1, students with disabilities would be offered in-person instruction based upon the needs of their IEP. Those students who receive ELL, students without access to the internet through MCPS-provided MiFi devices, as well as students of employees, and 25% of students in grades PK3 would attend 2 half-days per week. All other students would participate in remote instruction, and MCPS would operate childcare facilities. Phase 2, Level 2, students with disabilities, as well as ELL students, students without access to the internet, students of employees, and 50% of students in grades PK3 will attend 2 half-days per week. All other students would participate in remote synchronous instruction, and childcare services would operate. Phase 3, Level 1, students with disabilities who are identified in their IEP, as well as students who receive ELL services, students without access to the internet through MCPS-provided MiFi, students of employees, 50% of students in grades PK5, and 25% of students in grades 6 through 12 would attend 2 half-days per week. MCPS would operate childcare. Phase 3, Level 2, students with disabilities may be offered in-person instruction based on the needs of their IEP. Students who receive ELL services, students without access to the internet, students of employees, and 50% of all students in grades PK12 will attend 4 half-days per week. MCPS will operate childcare services as provided in the plan. As a reminder, this was the phase that the board had last made a determination on, and the majority of this plan does speak to that phase. You will see that it provides lots of opportunity for flexibility and speaks to all of the different phases, but this document is written from the lens of Phase 3, Level 2, because that was the last decision. But again, everything here should speak to what we would be doing in all different phases, should you determine that you wanted to change that phase. Phase 3, Level 3, all students would attend school daily. Mitigation strategies would be in place. We would no longer operate childcare during the day because students would be in school all day long, but we would resume normal before and after school enrichment programs. And then beyond Phase 3, this says all students will attend school daily, and mitigation strategies would be determined at that time if there were to be mitigation strategies in place. You will have a decision point on this later in the presentation. It is decision point 14, which will come after we go through everything else. And so at that time, decision point 14 is going to ask you whether you want to remain in Phase 3, Level 2, or if the board's will is for us to move into a different phase at that time. Do you have any questions for me regarding those phases?
Any questions right now, board members?
Okay. Next, Jason Garrettson is going to speak to you about our health plan.
Good afternoon, Madam Chair,
Good
Dr. Meyer,
afternoon.
members of the board.
Good
Thank you for
afternoon.
your time today. We are pleased to discuss with you the plans that we are required to share with the Virginia Department of Education prior to reopening in the fall. Again, just to be very, very clear, there are actually 2 separate plans that we'll discuss today that actually do eventually go to 2 separate offices. There is the mitigation health plan that is primarily what I will present, and there is an instructional plan. Again, both plans have to be submitted. They are separate plans, but you will see there's a lot of overlap. So you will hear this afternoon and into this evening maybe some things that seem redundant. We don't mean to be redundant. We're just trying to speak to both plans completely. There will also be some times where perhaps I'll address some topics in the safety health plan, mitigation plan, and may say an additional speaker later will speak to that. That typically just means it's addressed more thoroughly in their portion of the plan. And of course, along the way, should you have any questions, please feel free to stop me. And also, as I use paper notes, if I fall behind on the slides, please feel free to remind me to advance the slide. Thank you. Certainly, as you see on page 10, I don't intend to read all of the material to you. You do have it available to you. I'll try to provide clarifications and summaries and mention key points. But certainly, you do see that we are required to submit the plans prior to our beginning of phase 3 operations. Presumably, right now, we're talking about the start of the school sometime in fall. It does say to us there in that third paragraph that we must plan for various contingencies to continue our operations in the event of an outbreak. So it does speak to being flexible, and I think you'll see that over and over and over again in our plans today as we share our ability to scale up and scale down based upon current conditions in our community and in our schools. It speaks to some of the guiding principles. Again, this is all straight from VDOE's guidance. This is not ours. This is their wording. It speaks to lowest risk through more risk into highest risk. And again, as we talk about near the bottom there, presuming to reopen in phase 3, and again, we put in our current school start date, August 13th, as a placeholder is kind of what we're aiming toward. Montgomery County Public Schools, under the current plan you've approved, would be operating somewhere between the more risk and the highest risk categories. And we're at that place because we are at more risk, because we are at smaller class sizes, but it bounces us up a little bit into the higher risk because we do intend to mix those classes at the secondary level. So it kind of puts us there in the middle. Again, all 3 of those levels are approved from VDOE. All 3 of those levels are available for your approval as a school division. The health mitigation plan has 8 sections that we'll go through this afternoon. Really only 1 through 7 apply to MCPS. The 8th section is for boarding schools, which also must submit a plan. So 8 does not apply to us. Section 1, speaking on planning to reopen. I'll give you a page number of page 11. It asks us to speak to some leadership teams and some school contacts at each school level. We feel that our COVID-19 division team, our division leadership team, would be the superintendent's leadership team. You can see the names listed there. This team has been operating together very, very closely since we started this way back in February, essentially on a daily basis. This team is operating at some level as your division leadership team. One point I would note here is that behind each one of these names as a director, you've got other people in the background working constantly and consistently as well. And also some advisory type teams that we're working with as well, such as I know Mr. Pauly, Dr. Wickham each have a parent advisory board that works with them. I know that I have a health and safety team, which also Mr. Krantz and Mr. Knott are on, working to pull in more input. And then additionally, for my department, specifically student services, that's where you have your lead nurse for the division. So Kelly Hager has worked very closely with us through this process as well. She and I speak very frequently, even this morning, in regards to some of our information. So you've got some names there, but ultimately you've got even bigger support and response behind it. And we want to recognize and thank all those others as well. We feel like your COVID-19 school contacts at each school should be your school principals. Once again, MCPS has kind of put forward the philosophy that principals are responsible for what happens in their building. And this would continue that guidance. It also speaks to the work that they've already been doing from the time that we closed schools back in March and went to all remote. It was the school principal who was carrying that weight as point of contact through the meal delivery programs. And now as we collect information on our students as they prepare to return to school, again, we feel like the school contact is most reasonably the school principal at each school. Page 12. It asked that we speak to our relationship with the health department, and interestingly, the plan wants us to be sure that we know the phone numbers and the contact information for the health department. And I'm pleased to say that we far exceed that expectation. We have a very close connection with our health department, and we actually did prior to COVID-19. I would certainly say it's much closer now because of the pandemic. But we work very closely with them. We are able to contact our director of the health department, Dr. Noelle Bissell, very easily. I can reach her by cell phone, text message, or email. I will say she has been amazing, incredibly responsive. We're certainly not her only school division, but she makes you feel like you're her only one. And I am pleased to say she'll join us later this evening at the meeting as we start after dinner. Also would note that we've been working very closely with the Regional Public Health Task Force. That task force stood up in early March, and we've been represented on that task force throughout. So very, very positive, useful relationship. It asks us to speak to our approach for monitoring absences during health-related or for health-related reasons. All of our COVID-19 absences are excused absences, just like any other illness, right? For employees or for students, just like you would have any other sickness, illness, something that would keep you home, that would be considered excused. Mr. Knott will speak more specifically to that for personnel, for staff, when he has his section tonight. We do monitor lots of things, flu, GI illness throughout the school year. We would plan to continue to monitor that information for COVID-19. That's a practice we already have with our school nurses. We would be able to see those numbers in real time. And then your leadership team could review that information and see if there are decisions that need to be made based upon those numbers being reported daily. The division has prepared and distributed travel, vacation guidance to help our employees assess their risks, respond appropriately before they return to work. Mr. Knott will speak specifically to that. I think he has that information as an attachment in his presentation. It asked us to speak to communication strategies for health-related information. Throughout the summer, we have been providing communication. We'll continue to provide that communication through all of our normal mechanisms: school messenger call system, social media, the website, and email. On the first day that we have students back in school in person, presuming that is the decision you make, we will have time dedicated to explaining mitigation strategies to students. We know we need to have some information that gets sent out this summer that tells them how to safely get to us. And then we need to have some more time in the beginning to speak to those specifics: bathroom breaks, lunch routine, those kinds of things. So we know there's a summer piece, and then there's that piece of once we have them with us, let's really make sure they understand what's expected in the school building. Ms. Drake, through public information, has been using mass communication methods, again, school messenger, social media, to ensure that our messages are being put out to families. We do ask that our school principals be responsible for monitoring that well and following up, just like the questionnaire that went out to parents several weeks ago. For those parents we didn't receive a response from, we asked the principals to follow up and try to reach out to those parents to get that key information. And again, we're trying to be very attuned to maybe some folks who would have more difficulty with communication, such as our non-English speaking families. Dr. Michael Meyer has been working to help get materials translated and set up those communication venues so that we are effectively speaking with our families. And of course, our division COVID-19 team would coordinate with the school principal at the building level and at the health department. If there was any concerns regarding a positive case detected at a school, that communication would happen kind of between those three parties, those groups of people: the health department, the school level, and the division level. And that brings us to school board decision point number 1. You can see the information in front of you. I'll go ahead and provide the overview and try my best to explain the options. As was mentioned earlier, these options are not meant to pin you into anything specific. Certainly, if the board has another option, you can pursue that. And certainly, if the board has a brilliant option that we didn't think of, we'd be happy to take that from you as well. But for decision point number 1, we want to talk about our communication efforts if and when there are positive cases. Now, I'll go ahead and give you the caveat. we know that if a student or a staff member tests positive, we're already going to be working with the health department. That just has to happen. That's already happening. That's not what we're talking about here. We know that the health department will help us and really take the lead in contact tracing, right? They would work with me if I tested positive, and we would talk about my contacts, and they would begin to build that spider web out of who's been around Jason and who do we need to talk to about testing. That's the health department's business. That's not ours either, other than to maybe assist them. So what we are talking about is those communication efforts beyond that. So if there's a positive case, contact tracing is happening, what else do we want to do in regards to communication? So the options that we would provide are option 1, no public communication. The health department will notify those contacts through contact tracing. Option 2, we would notify that particular classroom and that particular bus route if the student is a bus rider. Option 3, we would notify that entire school where there has been a positive case. Option 4, we would notify a classroom or bus route at a set number of positive cases. And we left that blank for the board to discuss. Would you say 5 cases would equal a contact, 7 cases, 10 cases? That would be up to the board's discretion. And again, that would be to contact that classroom or that bus route or that bus route. Option 5 would be the same idea. You set a number and you would notify the whole school. So perhaps, just for clarity's sake, you say at 10 cases in a school, we would notify the entire school. Again, that's up to the board. Those are 5 options we provide. Our leadership team did recommend option 1 of no public communication, allow the health department to do their work as far as contact tracing. I will also say that in my discussion with the health and safety team, that seemed to be their recommendation as well. So with that, I'll answer any questions in regards to the discussion point before you, and then I'll step back and let the board have their discussion.
Thank you. Thank you, Mr. Garrison. Now the option 1 is open for discussion, board members.
I have a question.
Sure. Ms. Cass.
Probably easier for you to understand me if I do that. For option 1, the health department will notify potential contacts through contact tracing. So help me understand how that works.
Their work would be at that point to identify other people who may be at risk, who may have been potentially exposed. So let's say, for example, a student, we get notified by the health department probably, or perhaps by a parent, hey, my child tested positive, or hey, my child has a pending test. The health department would already be working to determine who else has that student been around. So they would probably be reaching out to us saying, again, use Jason as an example. Jason tested positive, or Jason is in the testing process. Can you help us with a class list? Can you talk to us a little bit about who his teacher is? Can you talk to us a little bit about that classroom setting? What might it look like? Is he involved in any other, is Jason an athlete who's maybe doing some optional workouts with his team? So based on that information, just like any other person who has tested positive, they'll work to determine who all else might they consider is possibly exposed, reach out to that person, and then have conversations about should they proceed with testing there or not. It's the same thing they do for anyone, as we've done drive-through testing and other things like that. When there are positive cases, they try to see how many other people might have been exposed and how many of those can we contact. So the school would reasonably assist with that, of course.
So if we were to, so if we said option 2, would the health department still do all of those things?
Yes,
as
ma'am.
well as the classroom would be notified? That's, I want to make sure
Yes,
I'm
ma'am.
clear on.
Yes,
okay.
ma'am. None
So
of
for every option 1 happens no matter what.
Correct. Yes, ma'am. VDH contact tracing will happen regardless of what we do.
Okay.
Correct.
The only difference, Ms. Cass, in option 1 is that we are not first sending out that communication. we, and Mr. Garrison, please correct me if I'm wrong, but I believe that the health department, once they have a positive, will notify us and say, because the contact tracing happens very quickly. I know you guys can contain an outbreak in 2 days, or close to that, correct?
They can.
Yeah,
Yes, sir.
the
Yes,
task
ma'am.
force, the task force. So at that point, I would think they would say to us, I think you need to notify the classroom and the people on the bus route. I personally think we should be looking for their guidance on when it's time to notify, because we also don't want to create havoc. I mean, we don't want to spread, fear and anxiety among people when it may not even be necessary to do that.
This is a big question that we hear frequently and have seen frequently in the FAQs coming into all of our offices.
Right.
Is that idea of if and when a staff member or a student tests positive,
Mhm.
who are you going to tell?
Right.
Do you announce it to everybody? Do you announce it to the class? And I think that's an important consideration with option one
Mhm.
is put yourself in the situation of a parent. If an announcement is made that I don't think we're ever getting to the point that we name a name, right? Like
Right.
we've got some privacy things we have to protect here as
Exactly.
well. And, we have other illnesses, and I know COVID is a very different animal than most of the other illnesses we dealt with, but we don't have a common practice of mass notifications when
we have
someone
the normal
tests
flu
positive.
season, right.
Correct. So I do think, again, there's that piece of, I think there's a sense in all of us to say, well, sure, I'd like to know, but just knowing even on a general basis, does that just open up more questions that I want answered,
Right.
or not? And I think that's maybe what speaks to some of these different options is, do we take a position? Does the board take a position of we're going to let the health department do their work and support them in any way we can?
Mhm.
And that's where we'll draw the line, and otherwise we'll protect privacy. Or does the board feel like you have an obligation to notify your community and families at particular points? And if so,
Mhm.
what are those points? A single test, a certain number, like we even talk about in option 4 and 5.
Mhm.
Are you setting a number, 1, 5, or are you setting a percentage? Because at one of our smaller schools, Bellevue, for example, is a much different percentage, of course, than one at our larger schools. Picture Blacksburg High.
But
True.
what about, say a student has COVID, it's a positive test. Aren't there quarantining? Don't you have to quarantine at some point? Like aren't people going to know anyway because the student's going to have to quarantine, and is the teacher then have to quarantine? One thing I haven't seen in any of the points that we're going to talk about is how are we going to deal with when someone actually tests positive? What are we going to deal with? I mean, how are we going to handle teachers in the classroom, students who have it? I guess I'm wondering, how do you avoid not notifying a classroom or a bus route if somebody has it? I mean,
I think a lot of that is determined, and again, I never presume to speak for the health department, and you will have Dr. Bissell here later this evening, but I think they are seeing that every situation is very unique. And I think, and she can correct me later, but I think the health department's definition of exposure tends to be very different than maybe ours or the average person's definition of exposure. I mean, it speaks to duration, it speaks to distance, and it speaks to mitigation. And I don't know that they would go down the road of saying one positive case would necessitate closing a whole school. And I think that's where it opens up those discussions. And it is that piece of balancing safety, privacy. And then again, the health department is going to make recommendations. They're going to make recommendations, and they certainly may come to a point where they say, hey, you're going to need to cycle out that whole group of students for 14 days. And you're right. That's going to become very obvious. Or if me as the classroom teacher, if all of a sudden I'm absent for 14 days, it's very clear. And same kinds of things. We run into those situations with all other illnesses. And to be quite frank, it's very similar to student discipline as well. We'll never say a student's disciplinary assignment, but other students will look around and realize they're not there and can reasonably guess what has occurred.
Let's give another board member a chance to
Yes, ma'am.
join the discussion. Ms. Franklin.
Okay, so you hit on part of what I was going to bring up. So I work in a factory setting and have been dealing with this for several months now and the reactions of folks. And one of the things that I have urged the company and the health department too is to put out the guidelines that they use for contact, what that looks like as far as the time, distance, and how they do their tracing, okay? Because people just kind of freak out because they don't understand. Once you help folks understand what guidelines are being used to say, yes, there is contact, folks kind of calm down a little bit. So that's something we need to communicate very early on and very loudly is these are the guidelines for contact. This is what happens during tracing. So here's the piece that happens with the tracing that I've had to deal with. So the person communicates, these are the people I'm around, or in our case, the teacher or whoever would communicate, especially with younger children. They may forget some folks. So in my situation, I've had employees come to me and say, hey, wait a minute, that person, I was in contact because I know some of the guidelines. I help them understand. Tell me how you were in contact with the person. And I've had to contact management and say, wait a minute, there's a couple of people you have forgotten, or the person who was being tested or has tested positive didn't remember. And then they have to send those folks out of the building, but it may be 2 or 3 days later. So I'm going to say we need to let folks know what's going on. We need to help them understand what the guidelines are. So in case there is someone who was missed or forgotten, and to help keep down the panic, I think the more open we are and the more education that we can give to the community as to how things are being handled, the better off everyone's going to be, because everybody's going to know very quickly who the person is, very quickly.
Mr. Chabaka, do you have any comments? Make sure that you're still there and hearing us.
Yep, I'm hearing and
Good.
hearing you and even seeing you, although it's a little bit delayed on YouTube. I've got that muted. Yeah, so, my thoughts, and Jason alluded to this, some of these questions that we're dealing with are overlapping, and in some cases there's, for lack of a better word, just kind of a catch-22 on some of the logic and some of the thinking. But in general, I think that, I look at it from the point of view of a parent, and I think parents, from the point of view of the public, I think it's clear from the emails that I've received what the public wants us to do. And I think I agree with the public and I agree, if I understood Ms. Franklin correctly, I agree with her that we do need to be as transparent as possible and give information. I understand the concern on that might lead us to pick option one, because you don't want people to overreact, or you don't want people to be fearful and that kind of a thing. But I think, I guess my answer to that is by being transparent about what the processes are, and by people seeing how everything works, and people maybe get a better idea of the risks that are involved. Basically, by being transparent, I think that we do in a lot of ways help that kind of a thing along. And I think Ms. Cass also said something about, that people they're gonna find out anyway. So I don't see, as far as the contact tracing goes, we heard from at least one person who wrote to us, or I think they wrote to the whole board. It's hard to keep all the emails straight these days, but somebody who was a contact tracer with the health department and basically said that in a lot of cases in their work, you're trying to call somebody or talk to somebody and that there can be delays. So I'm probably all for option 3, and I don't think that there's anything really to hide on this. I think that if, we notify everybody, but certainly we can, I assume when I pick option 3, you notify a school, that we're also notifying, the classroom and the bus. But, and I may bring this up again later when we talk, but, one of the things that came out of the March closings that happened across the country and that we know is that, in places that were able to contain outbreaks better than others, that one of the common threads was how quickly a governor in that state, ordered schools to close. And so when you have a child in a classroom who has tested positive, I would probably say from a scientific point of view, the chances that you're going to have another, asymptomatic or pre-symptomatic child in that classroom or in that bus is probably high. And so to wait another day or 2 before letting people know so that we can take appropriate action, I think is quite frankly irresponsible. So, for me, I think option 3 is the way to go, barring some other information from the health department later.
Is option 3, to me, the catch-all one is option 2. What does option 3 mean? Notify a school? I guess that maybe we need clarity. of what the
Option 3 would
means.
mean, for example, you have a positive case in Mr. Garrettson's class. Instead of just notifying Mr. Garrettson's class, you tell the whole school. So it would be
Okay, see, I interpreted it that you tell the principal, and then it's up to the principal to determine whether they would communicate. So that's, I interpreted option 3 differently.
No, this speaks to option 2. Are you notifying a specific classroom? Mr. Garrettson, there was a positive test in Mr. Garrettson's classroom and the bus route that would correspond.
Okay.
Or option 3, Christiansburg Middle School, for example, we had a positive case at Christiansburg Middle School. The board could discuss specificity, but again, we very quickly run into some privacy issues because you're right. Everybody's right. People start to put the pieces together, and very quickly you're in a position now where have you put together enough pieces that you're beginning to rub up against somebody's right to privacy.
But no matter what option, you're going to do that. This is a small town.
100%.
Small
Yeah.
place.
of
Yes,
course.
ma'am.
Everybody
We'll
knows
find out.
everybody's business. And
Yes, ma'am.
even option 1, if it's the health department, people will know, people will find out. And then what the downside to that is that's when all the rumors start and people start pointing fingers. And in my mind, it's better to just be upfront and transparent and just see and go with it from there and let people know what's going on.
Any other board members like to pitch in?
I think
At
I
this time?
personally would defer to the health department as to when it should be time to notify, because they're the experts on this.
Well, like Mr. Chabaka said, I read the same email probably from the person that has been a contact tracer since April. And of course, the person's concern was, and I think that's her experience, that's what she says, that contact tracing sometimes imperfect, like Ms. Franklin mentioned, and sometimes they run into the phone numbers through Google, phone numbers, and the person did not respond because they think that it's a spam and or unknown number to. So there are some issues with contact tracing, as I understand, and take some time, even though I think our health department is probably the fastest in the area. But on the other flip of the coin, they never dealt with the school system and virus yet. So that's a new for them too, for this area at least. I'm sure they have an experience and they are following. I mean, I could be wrong too. You correct me. And the other thing is the CDC guideline says even for one case, you have to close the schools for 2 to 3 days. Did I read it wrong, or that's not the case?
I would have to verify that.
Okay,
There's
yeah. That's on the
thousands of pages.
CDC,
There's
that's on the
thousands of
CDC
pages of
page,
guidance
but
right now.
again, you know, we might be doing differently here. And I understand that because our numbers, you know, local numbers are not maybe comparable from other states that our numbers are so high, but that's, I guess, a general guideline. So I think I will like public, and then when this says public communication efforts, when I say classroom or when I read a classroom or a school, I'm assuming that's the parents of the kids in the classroom getting this information.
Yes,
And the
ma'am.
same thing when school is parents of the
Yes, ma'am.
that school community gets the information. But I think, you know, like everyone else said, I think it will be very obvious. And now that everybody's so focused and pretty much, you know, some in fear more than the others, they're going to notice whether it's a teacher or a student or more than one student. I think it will be wise if we have a plan to communicate. We can, obviously the first contact still the health department, so they can start as fast as you know, possible what they are doing. But I think in the meantime, parallel somehow, we have to at least let the public know that health department is working on whatever that is at that time, whether a positive case or just being tested or the contact tracing going on and whatever that might be. And they can guide us for that kind of a, whatever that write-up is going out. But I think we need to let public know.
Sure. And all I would mention is we do have later in the plan some decision points around they're all big decisions. So, but other big decisions about discontinuing in person or reducing in person and
Yeah.
closing schools. Again, I cannot speak specifically for the health department. They may very well give us recommendations for those things. For this decision point, we're talking about our own internal communication pieces,
Mhm.
how MCPS chooses to communicate positive cases. I'm not sure if the health department would weigh in on a recommendation such as that.
I see.
I
Yeah.
cannot speak for them.
And we can ask these, I'm sorry, we can ask these questions
Yes, ma'am.
later to Dr. Bissell
Yes,
too.
ma'am.
But
So I'm going to say again, because I have been dealing with this for months in a manufacturing facility where folks are touching products that people are just passing down lines. And if folks are educated as to how the virus is spread and repeatedly, the biggest point is here. It's not necessarily here. So that folks understand when we're talking about tracing and when we're talking about exposure, this is what that looks like. This is not what that looks like. That is key here, because if folks understand, they are less likely to get anxious, scared, just freaking out. I'm telling you, it is not a good thing to see when folks are just kind of going crazy because somebody sneezed.
The educational
and-
component
yeah.
is huge.
Yeah.
Yes, ma'am.
So I'd like to ask a point of clarification, if I could.
yes, Ms. Yes, Mark.
Mr. Garrison, so if we pick option 3 on this point, as an example, if let's say a child tested positive on, you know, in your classroom, so what the notification that would go out to the school would be, we had a positive test of a student in Mr. Garrison's classroom.
I think the
Something like
board,
that.
I'm sorry. I think the board would determine the specificity there. I think option 3 does say you won't just notify my classroom, you'll notify my entire school. And
Yeah.
and then you guys can determine, do you want to be specific enough to say a classroom or a grade? You know, do you say a 9th grader at Christiansburg High School? Do you specify a staff member versus a student? Do you, and I guess there's some other pieces there, a bus driver, for example, may drive to multiple schools.
Mhm.
So if the bus driver tests positive, does that now generate letters to 3 schools? Perhaps.
So I would.
Yeah, I mean, I
say-
think my preference on this is that within the bounds of what is legal, I think we should give maximum information. I could certainly see, if we didn't say it was Mr. Garrison's classroom, then I could see nobody showing up the next day, right? Which is probably overkill and an overreaction. So I think being as specific as we can be, you notify the bus route or the classroom, but you also, let the school know, which essentially is making it to some degree public.
I think it's important that we identify the school because folks will automatically, how this goes, you start saying it here, before you know it, it's in your living room, right? That we identify the building so that folks can go back and read and say, no, it was not MCPS, it was BMS, right? So that folks can see that and get the facts. We've got to be as transparent as possible. I don't think it needs to go to the classroom or the teacher. I think it needs to be said, if it was a child, a teacher, staff person, a driver, cafeteria, whoever. But we need to be as transparent and as drilled down, as far down as we can drill. Because if not, people just they get a little, I won't say crazy, but they get crazy. I will say crazy. They do. I've been watching it.
Do we have any legal liability? Like, for example, so we don't say we aren't transparent. We go with number 1. And a student has COVID and then somebody gets COVID from that student, they get contract. Does the school system have any legal liability as to if we do not tell people and then someone gets it and something happens to them?
I honestly don't know if we could technically have liability because how could they prove that they actually got it at school?
Mhm.
Because they're going several other places. I could be wrong. Mr. Garrison may know a better, but I don't know if we could actually be held liable for that.
Certainly not an attorney. But again,
I'm just wondering if anybody's looked at,
No, but-
considered that at all, because obviously if you keep information to yourself, you don't give out that information, and then something happens to the other person because you didn't give the information out. Not in a COVID, if this was just some other issue, then, that
Sure.
it would be your fault.
Right.
Sure.
If my stairs are broken and I don't tell anybody my stairs are broken, then you fall down my stairs, then I'm liable for that. So I'm just wondering, I have no idea, but I think it's something we should consider also.
Yeah, I think, liability, you can be liable for about anything and be challenged in terms of that. So
Just one.
I'm sure it will be settled in court somewhere at some point, sometime probably soon.
So being transparent helps avoid that is kind of what I'm thinking.
Board members, do we have consensus on
We do
that?
not have.
We do not have
We've only
consensus.
had one person vote so far.
Okay.
And then
Are
we're supposed to be
you
voting.
want to
Oh, do we?
discuss more or vote for how you feel for this option, if you will, if you're ready? And we
So-
can always come back and change after we talk to Dr. Bissell
Sure,
as well.
If we
So
if we hear,
different things and
if we,
yeah.
hear Dr. Vazell's comments this evening and we want to change that, we would have the option to do that, right?
Yes.
We're not sending it right now. We're just, or you want us to send it now?
Yeah.
You hit send and then you hit edit again the next time you want to go in.
Okay.
So,
And I think that is an important point. We still, of course, have to submit the plan.
That's
So you have all the way up till we submit the plan to make any changes or revisions you may make.
Yeah. And the things that, things are constantly changing as well, so definitely a fluid.
I think a big piece of today's meeting and decisions made today is so that the community is able to begin to really make some personal plans.
Sure.
What works for their family based on the decisions we make today. And you're exactly right. Tomorrow,
Who knows?
Could hold.
Or August 12th. We
Correct.
don't know.
yes, ma'am.
Okay, so for me, I'm not agreeing with any of these options because as far as I'm concerned, they don't go deep enough.
I couldn't hear Ms. Franklin.
I don't agree with
Any of
any of the options because I don't believe they go deep enough.
I mean, you,
I picked one because that's all I had to choose from, but I would,
well, you're free to suggest another option. I mean, we can definitely add options if we think there is a different wording has to be in the option,
What-
in the
what-
plan.
Yeah, what exactly additional information, Ms. Franklin, would you like?
So I would like it to identify the building, the position of the person, whether it was a student, bus driver, whoever.
And I-
And
yeah, I think that's all good, and that's fine. I think, maybe we make that another question. We can
make it
identify all
more
the
detailed.
details that will be given out. Yeah, that's fine.
that's what I think this lacks detail.
Well, I'm saying we can add another question, or we can get your thoughts as to the details as to what you want to
How
send
to
out.
communicate.
Yeah, I mean, I don't even know that's something that needs to be voted on, or have a consensus to. I mean, we can, because we would have to craft it and sort of put something together. And we could even bring that, a sample back at another meeting later on, at the next meeting, just a sample of what the communication would look like when someone, Ms. Drake, you're the communication expert. Can you help us out with this?
One thing we definitely want to make sure we do is work with the health department
Yeah,
and have them look at that communication as well before we bring it to you. But
sure.
what I hear you saying is that you want to share as much information as possible without revealing someone's name. Does that sound about right?
Yeah, I
I don't
think,
want to
yeah,
go into classrooms, just the building and what level the person is, their participation within the district.
Great.
Um,
Yeah.
I think that's a very good point. At this point, this question is at a higher level. And like they said, we could add an additional question
Well-
about details.
I think this question is, that I feel like we have consensus whether it should be communicated or no public communication outside the Department of Health contact tracing. So seems like agree we should communicate something, and the details of how that communication will put together will be another step. Am I right?
That's
Yeah.
what I'm hearing is, so Ms. Franklin, you said you haven't chosen, but I'm hearing that you do want to notify if there's a single case.
Yes.
And we can come back later
Mhm.
with some sample letters and some sample communications and run it past the health department to make sure it's in line with our privacy. And even,
Yeah.
we could even send it through our attorney.
Yes,
I think that would be a good thing too, is
Yeah,
sort of
absolutely.
create a form of what's communication going to look like, send it to Mr. King and
yeah,
his folks.
make sure that
his attorney.
HIPAA safe.
Right, so we can be consistent in our communication and be as detailed as we possibly
Yeah.
can. But what I'm hearing is everybody does want to make.
Yeah,
that
nobody
connection.
wants option one, seems like, as far as I can sense. So that tells that we have.
I mean,
to
ideally,
communicate.
I would pick option 2 and option 3. Notify the classroom in the bus route, but also notify the school. Now, we can, I'm fine discussing what those details look like.
Yeah, we'll work on the details
Yeah,
and we'll decide on that
yeah.
next.
We'll ask Mr. King too, because that's not hard to do, notify the school and then more specifics with the classroom. For instance, do we give a letter to the class and do a phone call to the entire school?
Yeah.
So
Yeah.
there's a lot of details in any
Yeah.
of this. This is a
It
big
is-
picture view that we're giving you.
Yeah.
Right.
We'll work out some details and run it past you at the next meeting. Is that okay, everyone?
Okay, so there's another piece of this, it's called quarantine because you've been in contact. So you're gonna have some of the same reactions if folks who have been in your building are now quarantined and you're waiting for their results too. What do you do?
It's addressed later in the plan
Okay.
that those absences would of course be excused absences. And for students, right, of course, if they are well enough, like, so maybe I feel well, but I'm waiting for results based on the beginnings of the plan you approved earlier, I could still work remotely, would not even be counted absent,
Right.
and continue trucking along. Staff, the same thing, although there's some pieces there in that not everybody can as easily work from home as others. And I think Mr. Knott speaks to that as
Yeah.
well.
So that's not what I'm speaking about.
I'm sorry.
I'm speaking about, we have no positive case in the building, but we have 6 people in the building who are out because they have to be quarantined because they are waiting to see if they are positive. Not positive, if someone they've been in contact with is
Yep.
positive.
They're waiting. Yes,
Yeah.
ma'am. Yes, ma'am.
So that,
So yeah, I think what Penny's asking is, so what's our notification process for that? So I'm a teacher and I find out that a student in my class is quarantining at home because he was exposed, his whole family has COVID. Or his whole family's quarantining because they went on a vacation and they were with people who had COVID. So do we tell that teacher? Do we tell those parents that there's a student?
So
Who's
you're asking,
quarantining?
do we notify before a positive test? That's what I'm hearing.
I think it ties back to this. Like, this question kind of was worded as a positive test.
right.
Do you follow the same line of thought if it's a quarantine situation? Is that the question you're asking,
Right.
Ms. Franklin?
Mhm.
The likelihood of people being quarantined hopefully will be more than people who will
Yeah.
have positive tests. So when people, and again, this is the education piece.
Mhm.
So when folks see that or understand that folks are out of the building, small towns, small schools, because they're quarantined, because they went to the beach, or because someone was positive that they were in contact with,
Mhm.
folks are going to automatically think, well, what about me? I was in contact with that person. So unless we have some level of education, so there's a stop for folks to understand at this point, we stop with the tracing and with how you are going to be, how you may have been infected. Education is key, but the quarantine piece is going to be another issue.
But I thought that with quarantine, they're quarantined before they go back to the building after they've been somewhere. And I understand that sometimes that happens after you've been in association with somebody that you didn't know. But if you've gone to the beach, you're quarantined before you go back to a building or before you go back to work. So there's really no reason for someone to be concerned because that happens before you're in contact with anybody else. You understand what I'm saying?
Yeah, but if folks don't know that, they just know this person is not here and they're in quarantine, right? It may come out, yeah, you were at the beach, but we can be in the situation where folks are exposed. Had a gentleman whose father was exposed. He came in the building and it was not a pretty day. Folks go out to be quarantined. Everybody's wondering, okay, did I come in contact with that person? Has that person come in contact with that person? So education is key here because the quarantine situation is going to be an issue.
And for purposes of the plan, right, for today, we presented this as a decision point based on positive tests. We can certainly write it to include quarantine situations if that's the board's pleasure. And again, tying on to where I think we're at, somewhere closest to option 2 and 3, but needing to see more detail in the specificity of what is communicated. We can draft that, vet it through the Department of Health and the attorney and bring it back to you.
What was the final vote?
I didn't.
We're not there yet. We still have 2 more people to vote to get a consensus.
Okay, so
Thank you for asking.
something wrong here. Let's see.
We now have consensus for option 3.
If it's the pleasure of the board, it's been a little over an hour since you started. Is anybody interested in taking a 5-minute break
We got through one question.
before we come back?
So,
I'm sorry.
So anybody needs a break or not? We're continuing? I guess we're good for,
Yeah,
thanks,
I'm good.
Ms. Drake.
but I have a concern that we're saying we now have consensus. If every board member hasn't voted or been given the opportunity
They
to
have
vote.
now. As soon as I see that every board member has voted, I will announce whether we have consensus or not.
Okay, could we
Every
announce
board
that?
member has voted and we have consensus on
Okay.
option 3.
Okay,
With the understanding, we'll bring you back. a
Which
draft
is, you know,
of that
which is
communication.
basically, we
For
want
detail.
communication
Yes,
and the
ma'am.
details still be worked on,
Yes, ma'am.
will be worked on.
I understand. Thank you. The next section of the plan speaks to how we will continue to participate in community response efforts. Of course, we will continue to represent the division on the New River Valley Public Health Task Force. Those meetings continue and we'll continue to be a part of those meetings. We'll also coordinate to make spaces available for public service response. Some examples of that we would include, again, talking about community response efforts. We have made some parking lots available for drive-through testing sites. We've made some parking lots available for points of distribution for meals programs. We would continue to do those as we have been, which does bring us to the second school board decision point. Again, I think everyone's aware and we pride ourselves on the fact that MCPS buildings are often used as community hubs. We make those available to the community for other activities and functions. Generally, the question we would ask you during this period of time in the fall as we begin to consider coming back to school, how do you want to address community requests for facilities use during this time? And again, we provide options for your consideration. Option 1, that you do not authorize use of facilities by outside agencies at this time. We do have that clarification of if you go down the road of childcare options organized through us, we are not including those in this part of the discussion, right? Otherwise, we would not authorize facility use. Option 2, we would handle those cases, those requests on a case-by-case basis, such as, is it outdoor versus indoor? Does the organization have to give us a mitigation plan? Like we would consider the information they give us and make a decision. Or option 3, we would continue to process all those requests as usual. So that's point 3. I'll take any questions. We did recommend option 1, that we don't make those facilities available at this time, except for our childcare options.
Can you give us any other examples of where that might come up? I know like the community band uses Blacksburg High School.
Sure.
And of course, they're not going to be getting together. So that we could take that out. But what other?
We have some opportunities where some churches meet in auditoriums. We have some opportunities where organizations like the Farm Bureau generally meets and has like an awards ceremony recognition. We have some scout groups who meet in buildings. We have all those types of things. Just we pride ourselves on making spaces available to the community, and that becomes a question during this time.
Okay.
And let me say, our team, has recommended that option 1, and it was after hearing from Tommy and his folks as well. It's gonna put a hardship on our custodial staff because we have
Yeah,
to
we
do extra
shouldn't do
cleaning
that.
for when any of these. We have to clean anyway when these groups, but with these outside groups coming in, we're going to have even more cleaning that will have to occur once they leave.
We actually have consensus on question number 2 for option 1.
Thank
I didn't
you.
even vote yet.
That's okay. As long
Oh,
as
I
we
thought
have
you
at
said
least 4 votes.
consensus meant that everybody had voted.
Right.
I mean, you all should vote, but
Yes.
yeah.
I thought you said that consensus meant everybody had voted.
No.
No, consensus helps to
means that
move
we
on.
have 4 votes.
but definitely we can all
4
vote.
votes for one option is consensus.
And this was, I think, the one of the easiest of the 23 that
Well,
I did not think twice.
I do feel like it might have been easier than the first one, but again, board, they're all important.
Yeah,
I mean, they're
they're
all
all
big
important.
decisions, but thank you for option 1 on decision point 2. Again, we're going to continue to try to make every effort to coordinate the meals program for students who are unable to attend in person. The participation in the program is dependent upon some rules and regulations from the USDA that we're still waiting for. Mr. Krantz he's the expert and will speak more to that in his part of the presentation. But again, those are the ways we intend to participate in community events during the pandemic. At the bottom of page 13, we are asked to speak a little bit to our school health services. Of course, we're blessed to have a school nurse at every school. Not every division can say that, so we plan to have our nurses in the schools while our students are there, just like always. We plan to have them, of course, trained up and advised of COVID-19 mitigation and response strategies. They've been real specialized experts for us anyway, all through the whole process. We do plan to isolate students who are ill while they wait for pickup in our clinics. We speak more to that later in this plan. Our operations department very wisely purchased latex gloves, surgical masks, and hand sanitizer in bulk back in the spring. So they made those purchases well in advance. They're closely monitored, and we reorder them when it's appropriate on page 14. Of course, our contact to the health department has helped make some things available to us whenever we've had a difficult time procuring them through the normal method. The health department has been very helpful there in tracking down those hard to supply items. And then, of course, we do plan to equip our nurses, again, through the operations office with N95 masks for their very specialized work with a student who may come to the clinic, or even an adult who may come to the clinic ill. We do want our nurses to contact our lead nurse, Kelly Hager, anytime they feel like they're getting low or needing supplies, and she'll work with me and Mr. Krantz to make sure those are re-equipped. Again, at the beginning of the school year, we would intend to operate our clinics just like always. We know there's still going to be a need for other illnesses, accidents that occur at school from time to time. Some students need administration of medications, those other normal routine tasks. We plan to still have that same reliable clinic available, even though we have these other responsibilities on us. We do intend at each school to have a sick area where we can isolate someone who we might feel might be at risk and maybe waiting to go home. They can be isolated in a different location. And again, we really want to try to safeguard our clinics from unnecessary visits. We want to try to educate in the beginning, speak to students, speak to teachers to make sure that we don't have those elementary school, we would call them miracle ice visits, where just ice makes everything feel better. We might try to reduce miracle ice visits. We might try to reduce going down to get a safety pin because you have a hole in your shirt. Basic Band-Aids. We feel like we can handle those things and kind of protect our clinics. So that's the educational component. The next section asks us to speak to mental health services. We offer mental health awareness components anyway. It's a big initiative that we started last year. We plan to continue that. Even with COVID, we understand there may even be an even heightened need for these services. So we want to continue the normal things we already had in place, plus some additions. We do intend to staff with our normal allotment of school counselors. Again, whichever configuration we may land on, we plan to have our school counselors in the building when the students are there to be able to provide that support. We do have a great partnership with New River Valley Community Services. We continue to work with them and talk with them about having their support staff available in our building. There may be some differences due to some staffing things they've experienced, but we still have that partnership and have made it clear we want that service available to our students. And again, we have a plan right now that speaks to no students in the building on Wednesday, and we plan to not lose that as a day. We plan to continue to pump out a lot of good programming, a lot of that geared toward school counseling type things, mental health support type things, opportunities to meet with groups or individuals, with counselors through online platforms as best we can. We had a great suggestion come at our last health and safety meeting for those families who determined that it's just not right for their child to return at this time, maybe due to a underlying condition. Can we build a support group for those guys who would come together all across the county and have that shared common experience? So lots of good ideas there and lots of plans to fill our Wednesdays. I think we've been very clear to say that that's not just necessarily an off day for our students. It's a different opportunity. That takes us to section 2 of the health and mitigation plan. At that point, we're asked to discuss promoting behaviors that reduce the spread of COVID-19. And again, you will see overlap, right? We've already spoken to some of that, but you'll still see overlap here. MCPS communicates this information again through our normal systems throughout the summer and leading back to the school year. We do talk about how when our employees come back, and we use the word in person there on page 14, we mean once we have staff coming back to us. We probably still using a lot of teleconferencing and distance learning, but when they're back with us under the roof on contract, we plan to do a lot of training for pre-service days. But again, when we talk about promoting behaviors that reduce the spread of COVID-19, one of the biggest issues in that discussion, of course, is masks, face coverings. And that brings us to school board decision point number 3 and 4 and 5. And I will tell you just a couple points up front. These are all interrelated decision points. The board may decide differently, but I feel like your decisions are going to connect across all 3 points. You have already voted and approved the plan to get more students on a school bus through the use of face coverings. Just a reminder, so we're not specifically talking to buses here unless the board is making a change in a prior decision. And we also understand, as Dr. Walker will speak during his portion, that we may have to make some adjustments here for students with disabilities, IEPs, or perhaps 504 plans who have some specific needs that may weigh on their ability to wear a face covering. Again, we would also point out that we talk masks and shields pretty much in the same vein here. And of course, there's lots of information out there, but in our conversations with the health department, we feel like our understanding is they are saying those are equivalent. And even as we have had some people speak to us about masks and face shields, of course, the idea was that if that's your preference, more is probably better, again, from the health department. So decision point number 3 speaks to face coverings for those students in grades PK to 2nd grade. So again, we are primarily speaking about students 10 and younger, our youngest guys. And this discussion had a lot to do with reading instruction in the youngest grades. It had a lot to do with speech development in the youngest grades. And it had a lot to do with our younger students and their ability to tolerate or effectively utilize the mask throughout the entire portion of their school day. So you'll see 3 options. You'll see option 1 for those students in grades PK through 2. They could wear a mask or shield optionally. If they wanted to wear one, or if mom or dad said, you're going to wear one, they could wear it. Option 2, they will be worn at all times, and the board would say that students could not attend in-person instruction without a face covering. Remember, you have authorized a plan that allows alternatives besides in-person. That doesn't mean they miss out on education. They're just in some remote version or virtual version. Well, I guess remote at PK2. Option 3, they will be worn whenever 6-foot physical distancing cannot be reasonably maintained. So, for example, in our meeting here today, if I was much closer to anyone else, I would put my mask on. When I'm up here at the mic to help with my conversation, my communication, I've removed my mask. So if classes were set up to maintain 6-foot physical spacing, a student could remove their mask at their desk or at their immediate area. So again, those are the options we provide, and you'll see those options over and over, but we are specifically talking about this group of our youngest students, pre-K through second grade, and the leadership team has recommended option 3, taking into account very much the parameters we mentioned earlier about these being our youngest guys and their specific needs.
Let me say this too, our leadership team made recommendations. We have 16 people on that team, and we sat around just like you and had 16 folks basically vote. And some of the recommendations were not my recommendations. Yeah, I didn't win every vote by no means as to what we thought, but we went with that. You'll see one that's coming up that we actually had an 8-8 tie in the room. So we didn't know what to do. So we're glad to let you all have it. But just that's what our recommendations came from.
Do we have a definition what mask should be? A N95 mask or a bandana that you can bring it from the house that can slip through your face? Are we going to specify when we are sending, school information that what mask we mean when we say mask?
My understanding with the leadership team all available to correct me, I believe we're talking about cloth face coverings or surgical type mask. Okay. There are provisions later in the plan where we talk about supplying a student who maybe doesn't have one, or maybe I got a nosebleed in the middle of class and now I need a new mask.
Yeah.
The one we would supply would be a surgical mask. The N95s we only speak to directly for nurses. Okay. So again, we have had some discussions about do we supply, do we make that an item for every student coming back to school? MCPS is going to supply you a mask, with a logo or whatever. And we've had some discussions about, just like as you look around the room, everybody has preferences. Yeah. And probably most of us has worn a different mask or two throughout the pandemic, and we have our favorites. Yeah. Right? So our intention would be, again, it comes up later, but in this conversation, I believe we are speaking to cloth face coverings, which could include the surgical mask. And when we talk about the shields, we are speaking very much to the example that Ms. Franklin is wearing.
Thank you.
And I would also add to Dr. Meyer's comment, I would also say that in our health and safety team meeting, the opinion of that group, or the recommendation or thought of that group, they would put it back into option 2. And again, we have very instructional based folks on the leadership team as well, who will speak to those specific needs of the younger guys. I just want to put that out there too, because I know I'm sure my team is watching me today, and they want to make sure I'm representing their thoughts and opinions.
So maybe
any board members?
Ms. Wickham could maybe give us some insight on what the challenges would be with pre-K through third for wearing masks.
Second.
Well, and while she's
enforcing
coming up
that.
here,
Yes.
has anybody seen a 4 or 5-year-old wearing one of those surgical masks? They're hanging on them. So unless they've got a child size, it's not going to do a whole lot of good. I mean, it's just having a business and having to have them come into our business, and they're literally, that type is hanging on them. It does no good. So,
That's an excellent point. And that very same point was
What's the
made this
point?
morning during the superintendent's conference. Each week, the state superintendent has a conference with superintendents across the state. And one of the points that was made this morning was that it really is next to impossible to keep the little ones in a mask. He specifically had asked a question of a daycare provider, and that's what she had shared throughout this since last spring, as daycare providers have been open for essential workers, that it really is a challenge, if not next to impossible, to keep that mask on the younger students. In addition to that, when teaching a child how to read, it's very important that you see the child's mouth. You need to see if they're not forming those letter sounds appropriately, so that you can give feedback and assistance if they don't have the right tongue placement or what have you. So seeing the mouth during some instructional times is very important for the little ones.
We need see-through masks.
Yeah. And they make smaller shields also.
Shield would allow them to be seen.
Whatever you decide, if student does not have we will supply it for them. If student doesn't have a mask or a shield and they need one.
And I think with the same token, very hard to keep that group of kids 6 foot apart also. I think that's also a challenge itself. I feel like, I don't know which one is more challenging, keeping the masks on or the 6 foot distance, but we got to.
I just worry that would also, Ms. Wickham, reduce the amount of instruction time because we're having to continually enforce the mask wearing.
That's an excellent point as well. That was something that we discussed with the team last week, that it would be very challenging for a teacher if there was a rule and that teacher thought that he or she had to enforce that rule when it's not age appropriate constantly. Well, to back that up, though, we do think it's important when children come to school that we start teaching those things. But obviously it becomes easier when it's an age appropriate rule or expectation.
Exactly. Age appropriate, I think, is the key word there.
Barbara, have we talked to teachers about this? Because I guess I'm wondering how the majority of our elementary school teachers feel about the idea of having, there's a few things on this one that I question. And I'm a proponent of everybody should be wearing masks all the time. So I might as well just say that right up front because it'll make it clear because that's what I think for 4 and 5. So now we're saying that this small group of children, that they don't have to wear them. So there's like this delineation. So in 2nd grade, you don't have to, 3rd grade, you do, but you're all in the hallways together. So the 3rd graders see the 2nd graders without masks on. And I realize that half of the pre-K through 2 will probably end up in the toilet or wherever. And that's why I think we probably have to have a supply of masks for them. But I worry about teachers. And have you had a lot of conversation with them about this? Do you have a consensus from teachers?
Yes, we've discussed that during our committee meetings, and there's as varied opinions as we all have in this room. There are some teachers who feel very strongly, pre-K through 2, especially the littles, that they need to see their mouth, again, especially for teaching reading. They feel very strongly about the struggles they would have to be able to implement something that just really is against the child's developmentally readiness stage. But then again, we do have some teachers, for example, specialty teachers who do not teach reading, who have asked questions about when would it be appropriate for a child to have on masks. So the opinions have been very, very different. Another example would be a speech pathologist, for example. It is very important that if you're struggling to make certain sounds, that someone's able to see that placement of your tongue, for example, to help give that guidance and how to correct that. So lots of different opinions on it we've discussed. I can't say that there's a consensus. I'd say it's probably more based on what you teach from what I've recognized.
Thank you.
But as long as the teacher has on a face mask, it shouldn't be a problem, correct?
Do you mean in terms of 6 feet of social distance?
Well, I mean, yeah, or anything. If the teacher is uncomfortable with it, as long as they're wearing a face covering, then it doesn't really matter if the 5-year-old has on one and they're 6 foot apart. I mean, correct?
That's a really good point, and that's something that teachers have said, that it's important to be able to wear a shield or a mask where you can see their mouth, but yes, they would still be able to wear a mask.
Right, because they're still going to be interacting with the other children. I think that's the biggest issue. So very early on in this conversation, there was a mentioning of like plexiglass dividers that could be placed at the tables because most of the time it's smaller, they're at tables. Did we look into that, or are there certain areas where we can, for reading, you go here, you can take the mask off?
Mr. Krantz can speak to that.
Ms. Franklin, we are putting the mental dividers on the areas between our administrative team and the general public. We're working with individual schools because we've seen products available that, for example, would allow us to take a table and basically create a cube within that meets the definition of social distancing. And there's other products that we've seen that we're working with each individual school with to provide that on an as-needed basis. But right now, we've got the plexiglass, we're putting our stands on, or our vendor is right now, we'll be installing them any day now.
Okay, so that would help with some of the concerns as far as being able to see the child for reading and for, whatever else they need to visualize.
What about see-through masks? I mean, there is such a thing. And they use it for students who are deaf so I'm just wondering.
We're working with our suppliers on age specific. We do have see-through masks. We've got on the table in the back, you can see the masks that we do currently have, which is the cloth specific mask generally right now for our students. We have the N95 mask back there, as well as the shields for our staff and students. We're working kind of with the schools. We've seen the sources out there. We've stayed current in the marketplace so that when schools or the administration gives us a specific request, we're able to jump on. So I can assure you that within the next 24 hours, we will be circulating around the type of mask for age-specific children, as well as with the clear that we've also seen on the mouth. And the academic team will have that to tell us which ones they want.
Tommy?
Yes, ma'am.
I'm on Mr. Garrison's health and safety group, more just for an informational purpose. I don't really give my thoughts, just for feedback, so it can help me make better decisions. One thing that was discussed was that at that age, they were really leaning towards shields, and the reason being, at that age, a lot of kids like to put on hats and kind of dress up, and the shields are kind of more seen like something more fun, so to speak, but it would still give you that protection, and you would have the see-through visibility that would be needed for the teachers to teach what they needed to. How do you know how most teachers or most people feel about that, and how much harder would it be for us to try to provide maybe shields for that age group rather than worry about the mask, something that we think they probably won't want to keep on or deal well with anyway?
We would have to try the shields that we have now. I'd have to try on a child because I haven't seen it. It's a shield though that is very flexible and gives you a lot of flexibility. Whether it's age specific, I'd have to try it out. We currently have right now over 60,000 pairs of masks on hand.
Okay.
We've brought in 500 shields, but I can easily procure, as many shields as are necessary. That's not a problem at all.
I was just trying to think of maybe a better way, something that they would, if it did come to where they did need to have something on, that the shields would probably work better.
By the
thinking
close of
maybe
business tomorrow,
possibly.
we will have tested it on age-specific children. I can tell you which age works out.
Okay, sounds good.
Yes, ma'am.
Thank you.
So there are also the face coverings that, kind of slip on. And there are a lot of people who prefer those. From what I've noticed, folks don't fidget with those as much. They're just on once they get used to them. And to Ms. Parton's comment about kids liking to dress up, that's kind of like a mask kind of thing.
Right.
Where it's maybe easier for them and then, remove.
Or like a neck up?
Yeah.
Yeah.
Yeah, and then to be able to remove that and go into a protected area when they need to be observed.
I'm very confident that anything on the mask and the shields, whether it's the neck up, a cloth mask, anything that we would be brought up, we wouldn't have a problem securing it. We've stayed that current with the marketplace and with our different vendors out there, that we could very comfortably provide that whatever the academic side wants. That's our job, is to give them the resources to be successful. And I think we can do that.
We are currently at 5 votes and we do not have consensus yet.
So I guess I'll make a comment on
Yes, Mark.
the next three questions really. So I wanted to share my understanding of the science, and this is something that I will probably bring up later and talk with Dr. Bissell about as well. But my understanding on there's a difference between droplets and aerosol when you're talking about the virus. And whenever you're talking about 6-foot physical distancing or whatever you're talking about face shields, that what we're talking about limiting is the spread of droplets. Pieces, or respiratory droplets, I guess, that are big enough that they will sink to the ground. They will fall on the ground or fall onto the surface by gravity. And anytime, I guess what a lot of the research that's been done in the last few months has figured out is that there's also this idea of aerosols. Think about it as when somebody's smoking a cigarette or something in the corner, and not all of the things that get exhaled out of their mouth is going to fall to the ground. Some of it just floats around in the air for a long time. And it's, my understanding is that mask use is more beneficial because it actually does also help a little bit anyway, to some degree, and I don't know to what degree, but it does help to some degree with catching some of those aerosols before they, go out from the sides of the mask and whatnot. So for that reason, I think whenever possible, we should mandate them. Now, I also understand from the science that what we talk about is also, as far as the spread of the virus, it has to do with probability, right? And, for how long are you, in the same room where somebody who, may be infected and not know it is out there breathing all of these aerosol particles into that room? How long are you sitting there talking to somebody who's, 6 feet or closer to you and that kind of a thing? And, the latest study that just came out, I think this week or in the last week, that many constituents sent to us, puts a number, I think, of about 50% on kids that are younger than 10. That kids younger than 10 tend to spread the virus through this means at about 50% of the rate that, middle, high school adults do as well. So from that point of view, I think we can reasonably make some adjustments to our younger students. But I don't know, for me, I'm about to send in I'm going to pick options 1 and 3. I think it's good to teach them to use them. I think it's, if they optionally want to wear them and can, and they have the appropriate size, I think that's fine to encourage that. And, so really, I don't see any problem with option 3, or I guess if we pick option 3, option 1 is automatically selected, is it not? I guess anybody can optionally wear the mask, right?
We
Thank
would,
you.
we would not stop anyone from wearing a mask. No,
Exactly.
sir.
Yeah, that's definitely. And I think we're going to have a lot of teachable moments as well.
Right.
And-
So we are one.
So I do think the option. I'm sorry.
Go ahead, Mr. Tawaka.
Sorry, I was just saying, I think options. I agree with this. I think option 2 with these kids is going to be tough to be enforcing it and even to be using them in certain educational situations. But I'd still like to see, to whatever degree we can. I would certainly like to encourage kids to use them, because I think it's unfortunately a life skill they may need right now, and I think that it's also it still does, the more kids that do it, even at a younger age, it just drives that probability down.
Okay, so we're currently at 6 votes. We still need another vote to be at consensus.
I just want to make one more.
All right. I'm sorry. We are now at consensus with 7 votes for option 3.
So onward for number 4.
Ms. Cass, you were going to say something.
Ms. Cass had a
It's
question?
irrelevant now.
Well, and again, a
No,
reminder
if
that
there's a comment.
I guess I still,
Yeah, nothing relevant.
I think that we should make to say this one special group doesn't have to wear, I think we should say everyone has to wear a mask, understanding that it's going to be harder to keep kindergarten through 2nd grade with a mask on or a face shield, understanding that will be a challenge. But to automatically from the get-go say they don't have to and they can take them off at 6 feet, I think that I don't understand why we would want to do that. Why we just don't say for everybody and understanding that, yeah, they will have difficulty. I gotta tell you, as much as little ones, and I'm sure Barbara knows this, as much as, I think she even said it, as much as they don't want to wear a mask, they also can't stay 6 feet apart from anybody. And they're always hugging and they're always on top of you and they're just, and on top of each other. And I don't, there's never going to be 6 feet of distance between anybody who's 6 and under. So,
And you will, again, you have voted to require them on school buses because
Right.
we understand and acknowledge 6 feet could
Can't
not be
happen.
the
maintained.
kids aren't going to understand the difference. Like, oh, okay, I have to wear it on the bus, but I don't have to wear it in school. Or wait, no, I have to wear it in school, but I don't wear it when I'm 6 feet away from. They're not going to understand the difference. It's like at that age, to me, it's yes, wear a mask, and then let the teachers kind of manage it in the classroom how they need to. but-
I'm okay with. I mean, I guess maybe I wasn't clear in what I was saying. I mean, maybe I'm saying the same thing that you are, Ms. Cass. That it's just going to be a lot harder to enforce, but I would like to see it encouraged. So I think maybe you and I are saying the same thing. It's
Yeah.
not quite the option 2 of students cannot attend in-person instruction without a face covering, but it's it's somewhere in between. And
Yeah, maybe
so
that's the
I'm
part
happy to go
that's-
along with that. I'd like to hear what the rest of the board thinks about
And-
that. If we have another 2 people that agree with that.
And if I may address that topic comes up later, I believe from Dr. Johnson, as he talks about any decision made around mask wearing in terms of addressing it with students. I think he will speak to, and I don't mean to take the carpet out from anybody, but I don't think we're looking to suspend anybody or do, big punishments. We're looking to try to get people to follow the guidelines you set forth. And if it is a situation of a mistake or an error, the point is education, right? I've gotten halfway to the grocery store out of my truck and realized I don't have a mask and have to turn around and go back and get it.
Yeah. And what happens if you have a family? So now you've got somebody who's in kindergarten, and somebody who's in 2nd, and somebody who's in 4th, and somebody who's in 6th. So how do you explain to your kids, okay, you 2 don't have to wear masks, but you 2 have to wear masks?
Well, Ms. Cass, I'll say this, what you
Is
said.
that your
may-
family?
No. Well, definitely. Well, what you said did make a difference because it's a change in consensus now, based on your
Yeah.
comments. That's why I think
Okay.
it's good
So,
to continue these conversations.
Well, but people can change their mind.
Exactly.
That's
And
right.
that is throughout the day. I mean,
Yeah,
that's
That's
fine
right.
too.
So we now have 7 votes for number 3, and it has now changed to option 2.
What?
And at any
So-
point during the day, if you want to go back to
Oh, the
anything,
consensus change?
yes,
ma'am.
it did. That's what I was saying.
That's
So
what he was
Oh,
saying.
I didn't
that's-
understand.
That's what I
I'm
was saying.
sorry.
What you said
Yeah,
did
you
make
can
a difference.
change it.
Ah,
And I
okay.
think the consistency part that I do agree with Ms. Cass. I think it's just a saying all the kids since we know that masks are the biggest protectors against what we're dealing with. I think to be consistent with our rules and then give the flexibility the people in the buildings, whether the student's mouth has to be seen or they're too far away or they're outside playing in the playground. They don't have to be maybe with the mask. I mean, those decisions can be dealt with.
Yeah, I don't think we gave that flexibility just now. When we said that,
At all.
that's
Yeah,
right.
so
There's no
that's
flexibility
exactly.
in that
That's my
vote.
problem with that because
Right.
I've sat here and watched, I don't know how many people fidgeting constantly with their face mask. Their hands are on their face continuously. And that's what's
Yeah, I
going to
see what
happen to
you're saying.
children. They're not, and most people don't keep it over their noses. Most people, and kids aren't going to either. And I just think that it's
I
a
see,
little
yeah.
bit, I don't even know what the word for it would be to expect that. And to think that children aren't smart enough to know that older kids and younger kids in different families can do different things in their family and their
Exactly.
livelihoods. I'm sorry, I just don't think that's right. So,
I just can't see trying to have a 4-year-old wearing a mask
Absolutely
all the
not.
time.
I
Yeah.
think it'll be
No.
hard. I
Can
totally
we
agree.
change-
It's going to be difficult. I didn't say it was easy. I just think that it's better to be consistent and then let the teachers, and maybe that we need to reword this so it gives that flexibility at that grade level.
It
I was
doesn't
going to
make
say,
any
can we reword this to specifically add that flexibility? And I think in all of these, I think, I think they should be worn at all times, indoors and at all times outdoors when 6 feet can't be maintained. But, scientifically, they're not really needed outdoors when you can maintain distance. But I don't know, to what degree we want to go there in parsing this, because most of the time we're dealing with, with indoor instruction.
And I might just remind the board, there are certainly other decisions to be made, many more decisions to be made. Right now, you're talking about a half day, right?
Yeah.
So again, when we talk about duration for students, you're talking about what we would really call a half day
Yeah.
as composed to compared to a full day, if that matters.
And right now, there is no flexibility in this. We can certainly change it, but that would require a different question with a different vote.
Yeah.
Okay,
And-
so I have a question. You said we went from consensus around 3 and it changed to 2.
That's right.
So are our votes being recorded so that folks can see how we're voting?
Yes.
Yes.
At the-
Brenda?
Okay.
Well,
At the conclusion of the meeting, I'll do an export of the data. That data will become a public document that shows how that's why you had to put a name when you signed in, and it'll show for each question what option or options you selected, because certainly more than one.
So the public will see who, okay.
Yes.
Well,
Okay.
it would be helpful for me as a board member
See it
to
now.
be able to see what we're doing while
Yeah.
we're making these decisions. And I can't see that
Why do you feel like you would need to see that, Ms. Franklin?
because I need to see that. We're a board. I want to see how the board is thinking, just like we always have with
So-
everything.
But we
So
share what
I
we
went
think,
from
already.
I went from option 3 to option 2, Ms. Franklin, but like I said, I don't think either of those options really captures where I think we should be on this. I think probably we should, write up a different option that's somewhere in between those.
Okay, so then I need to make sure I'm stating for here how I'm voting, because I can't see that. The other board members can't see that. So I voted for option 2 because everything says face coverings is what controls the virus. So as difficult as it may be, because this is no fun, even with the shield, trust me. I know I need to do this. And if I had little children, I would help them understand that too. And if that couldn't happen, then we would have to look at something different. Because what may happen with a 4-year-old and them being in contact or contracting the virus and not being protected by a mask heightens the probability that they may spread that to another child or the teacher or anyone else they come in contact with.
Okay, so I have a question. The 4-year-old that's in preschool or the 5-year-old that's in kindergarten, and mind you, I have a grandchild that's 5, okay? So with me saying this, what is going to happen to that 4-year-old that continuously takes his face mask off or continuously wants to leave it down and not pull it up, or constantly, what's going to happen? And does that mean the teacher is going to be constantly yelling at them all day or half the day? Are they going to be constantly reprimanding them? Are they constantly going to be in trouble? What's going to happen?
I think that's a fair question.
Mhm.
And, again, Dr. Johnson, it's a part of what he will speak to specifically. But again, our understanding and our commitment is that it comes from an educational standpoint. It comes, when you say, will he be getting yelled at all the time? We would hope he's never getting yelled at all the time, right? That's not the way we want to handle it.
Any teachers that are out there yelling.
Right,
I
but
didn't
you
say
make
yelling, I said reprimanding.
but you make the right point.
Right.
Reprimanding. Yes, ma'am. I do think that if this is the guideline set forward from the board, then we're going to ask our teachers to support it and endorse it. And there's that teaching piece where I do think that there would be constant reminders and constant, hey buddy, get your mask back on. Hey buddy, there's some educational components in this plan where we're going to be talking to all of our students about washing your hands more, sneezing or coughing into your elbow, using a tissue one time and throwing it away, being careful with shared items, right? Like markers and paintbrushes and such. So I think everybody's getting a good dose of the education, and any young person who would be having trouble with their mask, my expectation, my hope, and I believe the whole team, our desire would be that it's from that standpoint of trying to help you learn, trying to help you take care of yourself, trying to back up the guidelines of the board. No question, it's going to be tougher. And, you know, I don't mean to be gross, but, you know, little guys too, like, you got to stay after some of them to stop picking their nose.
Okay.
And you do that out of love, and you do that out of care. And you know, they may feel like, why is he always on me about picking my nose? You know, but we're trying to do it with love and care and concern. But you're right.
But you might not have a classroom full of
Correct.
everybody doing that same thing that teacher is going to constantly, I need you to do this, sweetie. I need you to pick up your mask, sweetie. Sweetie, you need to get your mask on. Okay, come on. We need to move to this. I need everybody to put their mask on. And then finally, well, let's take 5 minutes and teach. And then, well, honey, I need you to get your mask up. Hey, buddy, get your mask. Let's do that.
100%. And I think it's going to be really tough for the little guys if that's not an expectation at home, right? Like if they're not having to ever do that at home, if that's not a belief of their family, I think that gets tough on the kiddo too. But again, we've made that expectation for the buses as well. So in that situation, you're going to have a driver who's trying to maintain masks on students on the bus. So you're right. I mean, your point is 100%
And
valid.
I guess for me, the bus is a short time.
Yep.
A grocery store trip is a short time. A Walmart trip is a short time. A getting together at a family event, you're talking a short time. It's not, and even though we're only going half a day, you're talking consistently a 3-hour span there. It's a huge difference. It's a huge difference. And people can say it's not, but it is.
Yes, ma'am.
So.
Yes, ma'am.
But Jamie, if I could interject, that the same reasons that you just said is also the reason why we should be mandating the mask use, because spending 1, 2, 3 hours in the same room, you know, breathing those aerosols out is the reason, is also increases the likelihood of the virus spreading, and it's the number one way that it spreads, right? So, I mean, I think that argument works on both sides.
And I hear you, and I voted that they should be worn when they're not within 6 foot. So that's where the difference of where my argument is just in the sense of if they're closer, I agree 100%, but if they're keeping the 6 foot, that's where I don't see the need.
You know what, my experience in volunteering in kindergarten to 2nd grade, I never remember seeing them sitting 6 foot apart. They are always on the floor in small groups, playing with Legos or working with teacher or looking at books. So I think most of their 3 hours is going to be actually together.
But their desk will be 6 foot apart. Am I not correct?
And their carpets are marked
That's
as
right.
best as
So
possible.
they know. So they
sitting
will be
6 foot apart.
It's a little different than the way it used to be.
If we can
We're in a
teach them
whole
to be
different-
6 feet apart, then we can probably teach them to wear a mask.
We are already at consensus on this.
Oh,
If
let's
it
move on.
changes when we go back, I mean, if it changes later, we'll come back to it, but I think now we need to move on to number 4,
Sounds good to
please.
me.
I mean, I was one of the ones that, going back and forth, but, the consistency and the point that Ms. Franklin made, because it really saves lives. So that's, I see it's going to be tough. I see it's not practical, but just the consistency, I went back to option 2. Just want to make it clear to me.
Ms. Graham, that final was option 2 at this point.
We are now moving to option.
On number 3.
Yes, ma'am.
Option 2.
Yes.
Yes, ma'am.
What was chosen as consensus?
All
And
right.
so we're now at number 4.
Thank you, board. Decision point number 4 is the same question. We're talking about the older students, grades 3 to 12. Again, option 1, worn optionally. Option 2, worn at all times. Again, the conversation about having the choice of different instructional model if you weren't comfortable with a face covering. And option 3, worn whenever 6-foot physical distancing could not be reasonably maintained. Our team did recommend option 2 for the older students in grades 3 to 12. This recommendation was also echoed pretty loudly on the health and safety team.
All right, we are already at 6 votes and we have consensus for option 2. Does anyone want to have any discussion on this, or did we cover most of it in the previous discussion? Okay,
I think we're good.
Okay, so again, I'm going to say, just because we get to consensus and every board member hasn't voted, we need to wait till every board member votes.
we are now at all board members at 7, and we have consensus for option 2. But we can also have consensus with all board members voting with not 100% on one.
What?
I just announced the number of board members voting so that if you haven't voted, then you know you need to.
Right, but you said we are at consensus and we have 6 board members voting. So
We hit consensus when we have at least 4 participants that vote 100% for one option.
I understand that, but I believe it should be when all board members have voted that you announce when we have consensus.
Okay, I will change that. I apologize. Okay, we can move on to option number 5.
Thank you,
I
board.
mean, question number 5.
Yes, ma'am. School board decision, point number 5, page 15. Similar question, face coverings. Again, we are talking about shields or masks required to be worn by staff. Option 1, worn optionally. Option 2, worn at all times when in the presence of students. Or option 3, worn whenever 6-foot physical distancing could not be reasonably maintained. This is the one that Dr. Meyer mentioned earlier, where our leadership team kind of split 50-50 on this one. There was a discussion at that meeting where we had some comments or conversation around, I'm a teacher at school and I have a period of time where I don't have any students in my room and I want to take my mask off and sit in my room by myself with my mask off.
Well, this is in presence of students too.
Right, I know, but that was part of our discussion. That was part of our discussion that changed it from the other 2 decision points a little bit where we went down the road. So option 2, where we did land, was when you're with your students, you will wear a mask, versus option 3, where we talk about 6-foot physical distancing, or option 1 which was worn optionally. And I'm available for questions on that one or there for your consideration.
So I don't understand if we're telling our students, you need to wear a mask at all times, but we as adults, we don't have to.
We didn't know how you would vote on the first 2.
Yeah, well, also, you're saying to students, what about staff members? What about custodians? What about cafeteria workers? What about anybody?
This
In
says staff.
Option 2, it just says when in the presence of students.
Understand.
It should be in the presence of anybody. The only time I could see taking it off and when I would, if you're in your classroom and you close your classroom door and you're working by yourself during your break time, maybe?
That was part of our discussion. I
Well,
mean,
yeah, in part, it's just like we're sitting here right now. We're in a staff meeting. If we create a social distancing space, like we've done now, I mean, I don't have a mask on. A couple folks do not have a mask on.
Well, maybe you should.
Well, I don't think I should. That's my personal choice and opinion. So
Exactly.
exactly. So, you got to remember, staff members are going to be there 8 hours a day sometimes, and then we've got workers too, who are working in our operations department, who will not be around other people, who will need to take mask off to actually do their job.
But we have
And
to
so-
be respectful whether, because if I'm a staff member, I'm another teacher, and I really feel strongly that people should have masks on, or I'm compromised, I feel I'm immunocompromised, whatever. then I think that somebody should respect that and they should be wearing their mask. When I come into their classroom or they come into my classroom, they should have a mask on.
Sure. And that's, in our office, that's what we do. When we're sitting in our office, we do not wear a mask. If someone comes in our office, if you go visit someone else in their office, you're expected to wear a mask into their office to respect their space. And so I guess I'm saying the same with teachers. If a teacher's in their classroom by themselves and then another teacher comes and visits them, then yeah, that's fine.
We are currently.
So are we?
So we're
So are
currently
we?
at 5 votes.
So
I think the wording on number 2 needs to be changed.
So you want an option, staff members wear a mask all the time.
When they're in the presence of others, parents come in for parent-teacher conferences and there's staff meetings. Yeah, I do.
I mean, I think, Dr. Meyer, I think that personally, I think we're ignoring some of the science on this. I mean, again, I said this earlier, I'll say it again. I don't know, what everybody's understanding is of this, but, the 6-foot idea and the idea that I can take my mask off when there's nobody around is certainly, it's better if nobody's around and I take my mask off, because the effect of the respiratory droplets is not a factor, but the effect of me breathing freely into the air is what is adding to the viral load that is in that classroom and in that building as the air gets recirculated. In this, I'm going to have some questions for Tommy on this, when we get a little further along, and I'll have questions for the health staff later about this and to the degree, but that's a factor. That's a scientific fact. So this idea that I don't have to wear a mask because I'm not in the presence of somebody else when I'm indoors I think is not capturing the full science on this. And so, for me personally, I picked option 2, that they should be worn at all times in the presence of students. But I agree with Ms. Katz that I think it should be the same as the students. It should just be worn at all times when you're indoors.
One of my other thoughts is with teachers too, because we have some that chose within 6 feet of students, is when you're speaking to students and talking to students in a classroom, just like Mr. Garrettson has, all of our speakers that come to the mic tonight or today with their mask off because it's easier to talk. And so actually speaking to students, that's why some chose in our leadership team option 3. Right? Yeah. For staff members, because they are actually speaking pretty often to students during the day. And if a teacher, the high school, it's not uncommon for there to be a lecture, if they could keep the students away while they're doing it. That was some folks who have high school experience and who will be doing a lot of talking in class, just like our speakers are today, who felt that was the 6 foot rule would be better for teachers. And so,
yeah, and thanks for bringing that up, Dr. Meyer. And I meant to say this too, is that in addition to, on the one hand, I'd like to see it all the time and not just when around students, but importantly, the caveat there is also that I understand that there are times, when lecturing and whatnot, especially that maybe they need to be pulled down or taken off or something like that, as long as there's another mitigation. I mean, this all comes back to, this is kind of it's a probabilities situation, right? And, I don't know that we're increasing the risk that much when just the teacher is, during the time that the teacher is teaching or lecturing, that they may not wear one. I'm okay being reasonable about some of this stuff, but, but when you're just sitting there breathing, I think you should have one on. I mean, that's what the science says.
We're still at 5 votes. Sorry.
So I'm torn between 2 and 3 because I think neither one of them goes far enough. I agree with Mark. The science is saying these particles stay, smaller particles stay airborne. There needs to be some kind of protection that a teacher is able to communicate with their students and give some type of protection. So if that means that we have a plexiglass shield or containment that the teacher stands behind or sits behind while or they are communicating with the students, but there needs to be some type of protection. So I can't go with any of these.
And we did add an option 4 during the discussion. I'm hoping that that loaded seamlsly for you on your screens. The option 4 being they will be worn at all times when in the presence of others.
Yeah, just option 4, just edit.
So we added an option
Yeah.
I did,
based on your
based
request.
on the discussion of the board. I'm hoping
Oh, I
that that
see.
was
You added
seamless.
one.
Mhm.
Yeah, I was thinking if we can ask the teachers wear face shields while they're lecturing because that was talking in the Virginia Tech classrooms too recently, since my husband was debating whether he has to wear a mask or a shield. So that's the same thing. But of course, when you look at the breathing the air point of view, obviously the shield is not necessarily as effective as the mask. But unless, of course, somebody comes next to you and you are talking to that student and, they, sneeze, and they don't have a mask, then of course shield is very protective compared to not having anything. So this is one of the things, and I can see, of course, having with the mask and talking to the class, the hearing is going to be an issue in the classrooms. So I really don't know what the perfect solution on that. The longer you stay in the room, depending on how much fresh air we can, which we are coming to those questions too, I think later on, how much fresh air we have in the classrooms. If you stay in the same place and breathing in and out, probably, all day long is one thing. But if there's a fresh air circulation and if you, close your mouth while, there are people around you close by, it's another thing. So this is tough to, but it's the same, of course, mask question and valid for students too. So it's no different than the earlier ones.
Right.
So what you're saying, I see that. I think there's a consensus. So what you're saying is we need to put our mask on now, based on your decision.
I mean, to stay consistent, I stay with, I picked the option 4, because we asked the same thing for our students to do. So, but in reality, while they're teaching, can they teach with the mask on? I'm still not sure. But having a shield on to teach, is that protective for what you're breathing the air? That's answer no to that too, I think, scientifically.
Well, and I will add, just as we're up here having the discussion, and Doug may have to chime in on this one, I think several years ago, we outfitted all the classrooms with sound amplification systems. So I should have in my classroom a neck microphone that allows me to be
Talking with
louder
the mask on.
than
Yeah.
everyone else without having to be loud.
Microphone goes down here,
Okay.
so it would, I'm sure it would.
So
would
I don't
amplify.
think sound is going to be
The issue.
our
Okay,
issue.
That's what I
Although
wanted to hear.
without it, it would be a concern.
Yeah.
And there's very few teachers who just stand in front of a classroom and lecture. And that is not, I hope that's not what we have. No one I know that teaches that way. So you're moving around the classroom. You're not standing in one spot far away. I mean, unless we're saying we need to do that, that teachers now need to stay in front of the classroom.
So I'm asking now. I'm asking a really realistic question. If we move forward with this, I'm going to ask our folks to put their mask on, and then our speaker is going to they're going to put their mask on. Is that what we want right now? That we're staff.
I was sitting
I
in
think-
the
I think
mask on,
from-
but
I
had
think
to
from-
drink,
from-
so take your time.
I mean, from my point of view, I think option 4 should say they will be worn at all times. I don't think it should say when in the presence of others. They should just be worn all times inside.
That's an
And
option
to
too.
your,
I'm sorry.
And to your, sorry, and to your question, Dr. Meyer, I mean, I think, again, I think that the science is there that when you're in an enclosed space inside with other people, that you should have them on. Now, again, it's an issue of probabilities. And so from that point of view, I'm okay with some practical exceptions. You know, if you're, you know, in the situation that you guys are in right now, if you want to pull your mask down to speak or something like that, I think that that's reasonable. That's not, you know, that, you know, from a statistical point of view, you're probably not affecting things very much. I mean, because you're maintaining 6 foot distance.
Yeah, and there's not one
but
class.
yeah, if you're gonna,
I'm sorry, Mark, go ahead.
What does the health
yeah, so,
department
but if you're
say,
gonna sit, if you're
Jason?
gonna sit in a room for an
What's the
hour and a
recommendation of the
half,
health
and-
department, Jason?
my
That's the,
Again, I can never speak for the health department, but I believe they would say you could have your mask down when 6 foot physical distancing could be maintained.
Right. And
That is what I
And
believe.
what size
You-
of a room
they would
though?
say.
And with what kind of ventilation system? Because that's a whole nother issue
Yeah.
too. You know, this room here is way bigger than any classroom I've ever taught in.
Right.
And
Jason, do we
if
have
I look at the number of
numbers
people,
for-
that's about, these people out here would be about half of my class.
Have-
1,
have
2,
we
3,
heard
4,
any-
5, 6, 7. Yeah. But so if I was teaching, this would be half of my class, except we would be in an area that's not even a quarter, it's smaller than a quarter of this. So that's a lot different than saying, yeah, you're not wearing your mask now over there because we're in this big giant room with a really good ventilation system. But, you know, go in a Beeks classroom or a GLE classroom that's small and has horrible ventilation, and it's a whole nother story.
all right. So this says staff. It doesn't say teachers. So, Mr. Krantz, how does this affect your folks?
But can I say,
Tommy,
to
you
me,
can-
that's not the question. The question is whether you should wear the mask when you're alone or not. I mean, I think it's a given to wear your mask when you're around somebody and can't be 6 foot apart, but it's the question was whether you should keep it on continuously. And that's where, to me, this question isn't good. I mean, I agree that faculty should wear it of all when they are around someone, when they're around students, and they can't be 6 foot apart in a room with people. But when they're by themselves,
I don't think any of us
And-
are saying they have to have it on when they're by themselves.
oh, no,
That's what
I
the
agree.
question-
I disagree. I've heard some comments that said, and I think from you as well, you need to have a mask on at all
No, I
times.
didn't. I specifically said if a teacher is sitting in the room by themselves, close their door, they're alone, I don't have a problem with them taking it off. Dr. Meyer, what we were debating right now is Dr. Meyer is saying, do you think I should have, being him, my mask on now in this room? That's what we're debating.
And I know when I spoke with Chief Wilson yesterday and I asked this specific question, he said, regardless of whether it's students or teachers or staff, that if they could not keep the 6 foot distancing, the social distancing, then they needed to have on a mask. Otherwise, they did not. And that comes from the COVID task force. Am I correct, Ms. Martin, in what you've heard from that as well?
Yes, ma'am.
That's option 3 is what you're describing, correct?
Yes.
But for me, that doesn't speak for in a classroom. Option 3, that's my question. If there, and I guess you would have to pick 2, but how would that work if you're in a classroom with students and you are 6 foot apart?
Then you would not need to, that's what he was saying.
But we're requiring students to wear them. That's where I have a
True.
problem,
True.
okay?
I see that point.
That's the problem I have with that.
I see that
We're
point.
requiring students, but we're not requiring faculties, even though in a different setting, I get it. But if they're with students, if students have to wear them,
Yeah, they should have. to wear them.
faculty should have to wear them.
Absolutely.
Right. Well, and I guess I feel like it should be 6 foot apart regardless. I mean, of all students and faculty.
And I did too, but that didn't pass.
I know.
So
I know.
we have to go with what passed.
But a teacher would have to make sure that they stood in one spot where they knew they were 6 feet away from every student in that room at all times. And like Sue said, most people don't teach standing.
Right.
If they're walking and they
Sure.
even come within 5 feet, they've already messed up because they're not.
There's
wearing
no
a mask and
classroom
they're-
that we have in this school system that you could walk around comfortably without coming within 6 foot of somebody, even if we're spread out, I mean, unless there's like one kid in the class. But I mean, they're all, it's a, you know, there's classrooms. They're not made to be everybody to be 6 foot apart, even when you wander the class.
I mean, do we need to separate this question in terms of classrooms versus other places? I mean, because, you know, do we need to wear a mask here? You know, Mr. Krantz has folks that work in operations who are not around students, and they're sometimes not around other folks at all. I don't know. What, Mr. Krantz, any?
It'll be primarily on our facility side. So if we're in a boiler room and we're taking a boiler apart, if we're taking large HVAC systems, air handlers and things of that out, many of those situations, when you put a mask on, could impede their ability to perform their jobs. The other thing that we encounter is once a mask, according to the science, gets soiled, so the sweat, the effectiveness of the mask is eliminated. So, for example, if my grounds team, who's out right now in the heat of the day, if we're going to say that all staff has to wear a mask, their mask will get soiled very quickly. Or if I'm in some of the large behind the scenes with our HVAC systems, which Ms. Cass is correct, that's a huge concern. When they're in those environments, it could become a dangerous situation for us to wear a mask to perform our jobs.
Okay, so for me, I think, Dr. Meyer, you're right. I think we may need to separate this from classroom to other spaces.
Okay.
But again, I think Mark brought this up, maybe Sue too. There's a ventilation component to where you're at, even in a big room. If the ventilation is not good, then that is an issue as to how the virus can spread. So we most definitely need to separate this.
May I
in some
suggest
way.
a break, and I can get those questions separated out for you, and that'll give you guys a little
The
bit
day.
of time, and then when you come back, I'll have it, if that's the pleasure of the board, of course.
That's a great idea.
Good idea.
A break, is that what I heard?
And, you know, we have to be careful about staying in classroom also, because if the kids are in the hallway passing each other, you want them wearing masks also.
Yeah, there's no 6 foot distance
Yeah.
in the hall.
Because that shouldn't be like you can't wear the hats in the classroom, but you can wear your hats in the hallway
Why don't-
situation.
Why don't we let Ms.
Sure,
Drake
yeah.
try to break that out for us and
And now we'll be
take a
back.
break? Is that okay with everybody on the board?
I think break is good.
Okay.
4 o'clock.
Need to use the restroom.
No, 4 o'clock and first and 5.
It's right back. Okay, so question 5 has been updated to a part A and B.
Yeah.
So if everybody can make sure they refresh, or it might refresh
It
automatically.
automatically did, I think.
Okay.
Yeah, there's 5A has now 2 options and the 5B has actually 6 options.
Do we pick an option on each or just one?
Pick one on 5A and one on 5B.
Okay.
Yes,
That's
yeah.
that's what I was asking. Thank you.
Yeah. And don't forget the send. And I want to clear, I think one of our YouTube watchers have a comment that we confuse the public in terms of consensus versus voting. I think the plan needs to be voted at the end by the board, but each item we are moving on, if we have consensus, that means 4 or more board members agrees in decision points, we are moving on the next.
Right.
But we are, of course, expecting everyone to, make a decision, which we have been doing it that too. But I want to make that differentiate between consensus of the points, decision points versus voting the whole plan moving forward.
Which will be at the very end of the day.
Very end, yes.
So right now we're at 5A, which is when in the presence of children should staff wear mask. And so far we have 3 votes.
I think B is going to be hard. There's too many options. Well, I don't think it's how we're going to come up with a consensus.
Let's, start with A, that question.
I sorry, I jumped ahead.
5A, right?
We are at
I don't
5A,
have a
yes.
question in front of me, Dr. Meyer. Sorry.
I'm sorry, Ms. Graham does.
5A, when in the presence of children should staff wear mask.
The options are,
Option A is staff should always wear a mask when students are required to wear masks. Option B is staff should wear masks when 6 feet distance cannot be maintained. We now have 4 votes.
Just checking, Mr. Chabaka, you are on, all right?
Yes, I am.
Okay, thank you. I want to make sure.
Still at 4 votes.
Okay, I have a question. 5A and some of the ones on 5B kind of conflict. Like on 5A, staff should wear a mask when students are required to wear a mask. Staff should wear masks when 6 feet distance cannot be maintained. Those are 2 options, but on the lower, staff should wear a mask when in presence of others inside and 6 feet. To me, that kind of oversees 5A. So I kind of really wouldn't even want to vote and just vote
Ms.
the
Whitaker
one.
can,
Or it's like
or Ms.
supersedes it.
Draper.
Thank you. Oh, and of course the screen. Okay. We worked very quickly on these. So what 5B should say is when not in the presence of students. So 5A would speak to when students are there. So anything you decided for students would already be in place. The second question, 5B, is only when kids aren't around. So if students were around, if you chose A, staff should wear them when students do, and students are always wearing them, then staff would always wear them when students are around because that would be the hierarchy. Then the B is when students weren't there, say it was 6 feet distance, that's what that 6 feet would speak to.
Okay.
But if that student question would supersede it, because if students were required and that was the vote, then they would always wear them around kids. But say it's the situation where they're in the bus shop, there's no children there, then that's when, 6 feet, that's where that would come in because kids wouldn't be in their presence.
Okay, one question that that did come up was what about when they're remote teaching? Wearing a mask, how does that work? And not being able to hear. So, I'm a
So
little
do you mean in the
concerned there.
presence of
They're in the
students?
presence of students, but they're remote teaching. And that makes a lot of sense that how can, you speak to a computer if you can't even?
Mr. Wickham, can you speak to that as to any issues that may cause?
Just a question.
Okay. So that is something that we had talked about,
Mhm.
is that it would make it hard to project your voice through a mask if you were doing the lecturing part for your remote students so that they could hear you. Our plan for the remote students, which I'll talk later about in the presentation, is that we will use the Chromebooks. The teacher Chromebooks will deliver the audio and video feed so that they can take that with them as they travel around the room. But they'll have to set it down if they're going to be doing teaching at their smart board or on the whiteboard to be able to set that down. Having the microphone systems, which we do have in several of our classrooms, that's a teacher choice whether they use those or not, will have sound then come out through the speaker in the room, which may cause a feedback when you have your microphone open on your laptop as well. So that's a concern that we have. We would have to test that. So that would be a concern if you were wearing a mask when you were delivering
So
your remote
I
content.
guess to me, and not that we need any more options, I don't mean to make that, but to me, that option would be where students are present, unless you're in a teaching remote
Yeah.
time, and you can be 6 foot. To me, I think that's a common sense kind of thing, but if we're looking for verbiage on everything, then to me, that would be the perfect option.
So make what you're saying is make the exception when it's when a
Exactly.
teacher's talking to the computer.
And
Yeah.
they
For
are
that
able
voice.
to be 6 foot, then at least that remote, I mean, why do it if we can't do it right?
So, I mean, that's, that's something we could, do we have to spell it out in this right here? Or could we just say to teachers, when you're talking to the computer during the remote teaching, make sure everyone's 6 feet away,
Right.
And then you,
but so the folks on the other end can hear you. It's okay not to wear a mask while talking at the computer. Is that?
So it's fine with me as long as they have that clarification, because I know a lot of times, sometimes speaking with teachers, oh, well, I don't know, I didn't, somebody told me, I'm not sure, I don't want to get in trouble. So as long as we have that clarification and they know that, that's fine.
Do we need to
We're
have a
still-
consensus on that?
We have a consensus thus far, but we're waiting on 2 more votes.
For which one?
this is 5B.
5A.
5A.
Or A.
5A.
All right, very 5A, sorry.
Hang on, I'm coming. I'm getting down there.
Okay, we're waiting on 1 more vote on 5A.
Okay, that might be me because I forget to go down and do send.
On 5B, we have 4 votes currently. Okay, now we're on 5A. We have 7 votes, and the consensus is option A.
All right, can I clarify something, maybe even by a show of hands? Do I have a consensus that it's okay for a teacher to remove their mask while speaking into the computer for our remote learners? Okay, thank you.
I would agree with that. Did we, and I don't want to overcomplicate this, but did we also want to make any other mitigating allowances for teachers? For example, I thought Ms. Franklin brought up if a teacher is wearing a plexiglass shield, a face shield, or if a teacher is behind plexiglass that may be erected in the classroom, that they could also do that. Is that also the will of the board?
If we get to the point, so what you're saying is if we get to the point where we're able to erect some type of shield for the teacher to be behind while giving instruction, is it okay?
I think discussion on that teachers don't really stand still behind the shields very often on a day-to-day basis. That's why probably, and breathing the same air behind the shields regardless. So I think if we're saying the students are wearing the mask, I think the kids should be wearing the masks. I mean, the teachers shouldn't be wearing the masks, all right?
Yeah, only thing I've heard now, except when they're talking to the computer.
Yes,
remote.
yeah, I mean, that's,
All right, at
Okay.
5A, we have,
That's, I mean,
That's sort of a what if situation because we don't have shields for teachers at
okay.
this point.
I guess what I'm saying, and I'll repeat, I said this before and I'll say it again, and I don't think that I don't think this captures it. I don't think 5A and 5B captures where I was going, and that's okay if the board doesn't agree with me. I don't want to, I want to do the right thing from a health point of view, but I don't want to overburden the teachers while they're teaching. And so what I'm saying is I think when we were talking about question 5 and we're talking about all staff, yes, all staff should wear their masks indoors at all times, but I think that we should make exceptions for teachers when there can be another mitigating factor. So in other words, if you're a teacher and you're speaking to the class, you're lecturing, and okay, so let's take away the plexiglass shields, but maybe a face shield as opposed to a stationary one, or if you choose to wear a mask, or if you choose to maintain your 6-foot distance, or maybe 10-foot distance while you're lecturing, would be even better. Those to me would be mitigating factors that I think, from a statistical point of view, you're probably not changing, the risk of transmission too much by doing that. So I'm just saying that I'm okay with further mitigations for the teachers, but I don't know how the rest of the board feels about that.
okay, so back again at 5A, we are at 7 votes. So we have consensus for option A, which is staff should always wear a mask when students are required to wear a mask. And we had a consensus vote that Dr. Meyer requested that if they are teaching remotely, they do not have to wear a mask. All right, 5B, we are still waiting on 1 vote. We have 6 votes currently.
Okay, so I thought we could do 2 options. Or can we only choose 1?
Did I not update that correctly? That's my fault.
What's the matter?
Let me fix it.
Are we supposed to be able to do 2?
Look.
I think she's correcting it now. It's just we were writing it on the fly. That was my interpretation.
It'll take just a few seconds to show up, and then you should be able to select multiple options.
I'm not sure if this speaks to the prior point or not, but
is it, we're
If-
talking about 5B options or
5B,
Yeah, we're on 5B. That's right.
right. And I was just going back in the meantime while Ms. Drake worked. As far as shields, when you decided on decision point 3 and 4, you included masks and shields together.
Oh, that's true.
So in
Right.
5, I think if it's the board's desire, you were talking cloth masks or face shields, if that would
As
be
well, yeah.
an option for the teacher.
Yeah, good point. I'm consistent with.
okay, now we have 7 votes on 5B, and the consensus is option E.
Is that option B?
Option E?
E as in
E, as
elephant.
an egg.
I'm telling you, losing baskets. Tricky.
That's proof right there.
Okay, so we're ready
And-
now to
and
move on
Would you
to,
read option E?
we're now ready to move on to number 6.
You want to read
She
the
said
option E?
it's hard
Did
to
you
hear.
want that to be read out loud, Ms. Franklin? Did I hear you
Yes.
properly?
Yeah.
I'm happy to do that for you. Option E is staff should wear a mask when in the presence of others inside and 6 feet distance cannot be maintained. As a reminder, the question was, when not in the presence of students, when should staff wear masks?
Okay, so I voted for E and F, and F is the same as E, except it's outside and 6 feet can't be maintained.
Okay.
Okay.
Right. Okay.
Okay, now we're ready to move on to question number 6.
Okay, we've got a little bit of presentation before the decision point. As we talk about our approaches to promoting healthy hygiene, our operations center ensures that we have an ample supply of hand soap and cleaning supplies at each school location. Our custodians are regularly checking staff and student restrooms to ensure that soap dispensers and paper towels are filled and ready. Each classroom will be supplied with tissues and hand sanitizer. And again, MCPS will assist in supplying PPE to staff and students as needed. Mr. Krantz will speak more directly to that in his presentation. Healthy hygiene signs will be posted on each bus, in each classroom, in each restroom, and throughout the school. And then we're also going to try to make this conversation, this communication about promoting healthy hygiene just in all of our regular, normal communications. And some examples there would be morning announcements where the principal might continue to remind students of good, safe practices. And also in some of Ms. Drake's communications with School Messenger, again, as has been the norm, just kind of closing out with reminders about hand washing. And I think even going back to before we closed schools, we had some communications about things like for the kiddo who has that favorite sweatshirt they wear every day, we got to get those things washed sometimes. So those are our thoughts there. When we talk about our promotion of physical distancing, we're going to continue to promote that as much as we can. Again, we've measured our school spaces and tried to provide a maximum occupancy for COVID-19. Our bus capacity was being determined to coordinate social distancing. Again, you already made that decision that we could get a few more students on a bus if we wore masks as a mitigating strategy. Our students are planning to eat their meals in the classroom rather than using the large cafeteria areas. That is guidance virtually direct from VDOE. Grab and go meals will be provided as much as available in terms of when a student arrives at school. If they're coming for the PM shift, the first thing they're going to do is come in and pick up that meal and go eat that meal in the cafeteria. We're going to be paying attention to try to reduce any kind of lines or waits, those kinds of things. Again, Mr. Krantz speaks more directly to that in his portion. We're also going to minimize those gathered events that we often associate with school, things like open houses, assemblies, pep rallies. We're just not going to have much available for that right now. Any gathering larger than classroom size will have to be coordinated through the Student Services Office. They'll send that to me and kind of make their request with all their mitigating strategies in place. And I can either say, yep, you've got a great plan here, move forward, or say, no, this plan isn't going to work, or here's what you need to do instead, or even just say, yeah, this is not something we need to be trying to do right now. I mean, we associate many of these activities with school, but right now, some of these just do not seem feasible. We will use our VHSL guidelines for reopening sports. Right now, specifically conducting kind of sports practices or conditioning. Mr. Knott will speak more directly to that, but VHSL has done a good job providing guidance for all of our athletics and other competition teams.
Jason, I have a
Ma'am.
question about the lunches.
Yes, ma'am.
So students are going to be eating in the classroom.
Yes, ma'am. That's the plan.
Okay. So they're going to be taking the masks off in the classroom and eating.
Yes, ma'am. And that ties back to the need for 6 foot social distancing in the room. Okay. All right. Section 3 of the health mitigation plan speaks to maintaining healthy environments. This does take you to another important decision point. We are required under the plan to conduct daily screenings, and beginning on page 15, carrying over to page 16, we'd like your input on how you would like us to conduct those daily screenings. Again, the requirement speaks to we will conduct daily health screenings and does not elaborate much beyond that. So we provide you 3 options there. Again, we're speaking to students here. Option 1, acceptance that if the student is sent to the school by the parent is verifying that child's fitness to attend. Basically, if the parent brings the child or puts the child at the stop, that parent is saying to us, they meet the criteria, they're well enough to attend. Option 2, this one does speak to staff because they're able to use this option as well. Parents and staff will complete a safety commitment form at the beginning of the year. It's kind of similar to our code of conduct, indicating that they will conduct a health screening at home prior to going to work or sending their children to school. The document asks the parent or staff member to ensure that each day they are following or meeting the obligations of the commitment. That was given to you as an attachment, Appendix B in the back of the document. Option 3, some form of written or other verification upon arriving at school. There was a discussion about, is that something that could be done on a Chromebook? When the child gets to school and opens the Chromebook to use the Chromebook, there's questions. Or possibly a cell phone app. There's some apps available out there. We recommend option 2. We feel like it's very similar to other standards of when we communicate expectations and guidance to families. They basically read it, acknowledge they understand it, and agree to abide by it. Option 3 has some difficulties for us, particularly in that the student would already be at school. So there's questions about exposure on the bus, exposure at the school. And there's also some questions as to the ability of our youngest students to be able to speak to, have I had a fever? Have I, had any of these travel experiences? We think it's difficult for a younger student to really speak to that. So our recommendation would be option 2, and I'm open to answer questions as you discuss.
Any
I
discussions?
think 2 and 3 are both mental. One, folks are going to put their kids on the bus like they do every day. And as we know, every day, folks put their kids on the bus or drop them off and they're already sick because they don't have childcare or they can't afford childcare because they have to go to work. I think that whole situation is just problematic. It's going to be an issue. And I'll just say right now, as we go through all of these, I still don't believe we need to be opening school in August, maybe not even after Labor Day. And as far as face-to-face, and we may need to wait till January. That's where I'm at with it. So this whole scenario here, I think, it's not going to happen.
I'm going to speak to what Kenny just said because I was just thinking about it during the break that these questions are kind of in the wrong order because it would have probably been better to start at the end where, are we really going to go back on August 13th as we go through all of these decision-making things? And what are we going to do for those students who can't need their, I guess I'll use the word vulnerable students, the ones who need to be in school. And so what are we going to do to accommodate them if we don't go back on at all, if we start out in a virtual world? But assuming here that that's not going to happen, but I think that's a conversation we really need to have. And I don't know, maybe it is, we should flip-flop the order of the questions because we're going through a lot of stuff here that will it be relevant if we decide that we are going to go back virtual first? So
That's a good
that's
point.
one thought. I mean, we're sitting here going through all of these.
Well, let me say this.
And I know we need to do them anyway. I get that.
Yeah,
So
let me-
I understand.
Right. We talked about that in our leadership team, and we went back and forth too. What do we answer first? We decided to put the question of going back at the end because first we want to answer a lot of questions about if we do go back, what it looks like, and make sure we're all educated in terms of that to make a good decision. And to basically let you know what we've done to protect staff and students if we do decide to go back, and make sure that those questions were answered prior to making that ultimate final decision as to what it's going to look like and when, kind of a thing. But yeah, but I understand, but we still need to sort of answer these questions for.
And I understand that. And this particular question, I think making an assumption there's equity, which we know there's not. I think option 1 and 2 does nothing. I mean, that's not a screening. That's just I dropped my kid off, so that means they're okay, or I filled out a form at the beginning of the year, like you mentioned the code of conduct form, which, yeah, parents, I don't even know if they know what they're signing when they sign it. And some parents read it and are really clear on it. And I think most people, they sign it and forget, they've signed it every year and forget what's even in there. I know I did. But I think really, if you want to hold people accountable, that you need to make them do something every day. If you really want to hold people accountable for sending their child to school healthy, that they need to do something on a daily basis. But that's a lot of work. I get that. I understand that, and might be hard to coordinate it. But I think the other two, and you can do them, but they're not gonna. They have. What are you gonna? That doesn't really.
Well,
help.
and Sue, I think the problem with the first one, or the problem with what you're saying, the third one, is that if you start doing it every day, it also kind of becomes automatic. So I don't know that any of these,
Yeah.
are really going to do a whole lot. And so from that point of view, I just want to make it easy for everyone, right? And just get that commitment from families at the beginning.
Yeah.
And
guess
Mr.
you're right.
Garrett, let them know who's requiring us to do this.
It's a requirement from the state. We
Yeah, it's a
have to speak in the plan that we do daily screenings, and they really don't.
But how are the first two daily screenings?
Okay, but what is that daily screening?
It doesn't.
Because they're not
So
saying
it's
they're not
like
saying
when
who
I
has
go
to
and
do the
pick
daily
up my
screening.
aunt from the nursing home, they take my temperature and ask me if I've been out of town.
It speaks to symptoms, and it speaks to possible exposures. It does not address temperature directly. There is, I will say, from my conversations with lots of stakeholders, there is a sense or an opinion that this has to be temperature, but that's not addressed in there anywhere in the requirement. I have also heard very clearly, what have we done if we take temperatures when someone is at school and they now have a fever? They're already with us. They've already been on the bus. They've already been in the school.
Right.
And it does start to create some other questions and concerns. And I think Mr. Krantz addresses some of these in his section again, where are we talking about the screening taking place? Is it at a bus stop? Is it once they arrive at the school? If it's at the bus stop, now do you have the potential of leaving a student at the bus stop? Now are you putting that responsibility on a bus driver to be doing screenings? So there are lots of complex problems
Right.
associated with the expectation that we do daily screenings.
Well, and then there's the thermometers that you use. Some of them are not easy to calibrate. They would have to be calibrated often to be consistent. Some thermometers work better than others. Questionnaires, young children aren't going to be able to answer the questions. And secondary likely would say, oh yeah, I've been somewhere, just so they could do virtual at home. I just think there's a lot of holes in that cheese.
And I think you can bring the virus without having a fever. So checking the fever is not, 100%
Sure.
guarantee
And-
way of protecting rest of the crowd anyway.
And again, in our conversation on the health and safety team, and again, I don't mean to go down the road of trying to stand in for the health department, because I can't and I shouldn't, but we did have the epidemiologist on the call with us. And in terms of temperature checks, he was saying it's only going to give you something like 10% anyway. So,
And
you
I
know.
agree, because when we first thought we may have to as a business, for one thing, I couldn't find one. And the one I did buy and find didn't work. So, and so I'm not an opponent of that. I'm just was asking
Sure.
if what, we were looking
And-
at as far what they require.
And Dr. Meyer's point is well taken, right? Like, this is a component we bring to you for a decision that has to be included in the plan, right? We have to, this isn't something kind of we cooked up or we said, hey, this is a strategy we're going to put in place. If we submit the plan without speaking to this, then we have missed a component.
Sure.
And, and it is an issue that, at least in Virginia, every school division is having to decide. And just like in all of these pieces, as you see other plans being rolled out from our neighbors and even those in other parts of the state, we're all wrestling with the same issues.
And I think answering this question right now is regardless whether we can go back on the 13 or not, because even if we say we go back later, I think we still have to have this because the virus is, not going to go away. It seems like this is going to be routine, not like maybe code of conduct, but something like that, hopefully the parents will, take some responsibility. Obviously, our staff will be that at least they will be honest about it if we want to work together and make this work. They have to collaborate too, at least be honest about that they were somewhere crowded that virus was. I don't know, but at least they should be
Yes,
honest
ma'am.
about it.
Yeah.
Yes,
We-
ma'am.
We
And
currently have 5 votes, and we're at a consensus on one of the options, so I'm just waiting on the other 2 votes.
Okay, so I'm not going to vote on this because I think that's a joke. There's no way that 1, 2, or 3 will work, and that folks will be as honest as they should be and comply, because there's so many other aspects that go with this,
Absolutely.
and childcare is a huge one.
Yeah, again, we just have to get this, unfortunately, in the plan.
For them to put something like this in the plan and
I
then
know.
put some kind of resource there to make it happen, that was a
Well,
joke too.
The resource is a big, manpower and the resource is a big option in so many areas of what they're expecting us to do. So I completely understand. Since Ms. Franklin is not voting on this, we currently have 6 votes. And so we have consensus for option 2.
thank you, board.
So we can move on to question 7.
Yes, ma'am. Continuing on, our custodial manager, Mr. David Hodge, will create cleaning protocols for COVID-19 response. We'll provide a training to his staff. Our schedules, of course, allow for Wednesday as a deep cleaning day. And again, I think you guys made the point well, right? Like we have operated and written the bones of the plan based upon the partial days, 4 days a week for students with the deep cleaning Wednesday. That is where the bones of this comes from. School principals provide oversight of cleaning practices as they do always, particularly on those Wednesday days where we're saying these are our deep cleaning days. We want and need our principals to really make sure it's happening the way that it's been trained and is expected. And of course, as always, David, our custodial manager, is always available as a resource to any of our schools. If we have a question as principals, you reach out to David for help. Operations staff ensure that appropriate supplies are available. I feel like we've discussed that already. Facility staff has inspected all major systems prior to the opening of school to ensure that they're working properly. That is requested verbatim from the guidance that we are supposed to, with schools being closed, go back and make sure everything works. Our operations staff does that anyway. In regards to some of the air systems and HVAC systems, Mr. Krantz has shared that our systems are set to allow for the greatest circulation of outdoor air as the manufacturer recommends. So he's more the expert and can speak to it in his portion, but based upon the company that made it, his settings are such that they are bringing in as much outdoor air as they can. We also want our principals to speak with facility staff at those locations where we potentially open windows. We want those principals to work with facilities to make sure we're not messing up the humidity levels and kind of hurting ourselves by trying to do the right thing. And we also would need to then share with families, if you have a child with seasonal allergies, obviously if we're cranking more windows, we just want you to be prepared for that, right? Water fountains, they're going to be used by students only to fill drinking cups or water bottles. We'll allow students to bring water bottles from home to have with them. We'll also provide disposable drinking cups. That way we do have water available to students, which we feel is important, but everybody's not sharing that common drinking surface. Of course, we know those sites are still going to be cleaned more, but that was just one that we felt like using a cup or a bottle would be preferable. That takes us to section 4 of the plan, maintaining healthy operations. Our human resources office will continue to encourage staff to share with us if they are at higher risk. Mr. Knott will speak to that, but we have to make those provisions, but we have to first know that a person has a concern, right? They have to share with us that, hey, I'm really worried about this because of a particular condition. Of course, we'll continue to make arrangements to mitigate their risks, either through PPE, teleworking, or an alternative duty assignment. This is exactly what we did through the spring, those last 3 months of school. Continue to communicate with parents. If they have a student who is at higher risk for severe illness, that will come through our office in student services, where we'll work with them to try to select an instructional model that best meets the needs of their child. Again, we talked about the school minimizing gathered events. We've already discussed that point, that those will either be eliminated or mitigated and approved through the student services office. Likewise, we're going to mitigate those gathered staff events, right? Coming back to school, a lot of times we bring all our faculty and staff together. You guys are certainly familiar with last year's picnic at Christiansburg High School, kind of a little different welcome back. We enjoyed and we're excited about that change. We're going to have to be very careful with those kinds of things this year, and we'll have to try to continue PD and staff meetings through teleconferences or in really big spaces that really allow for that social distancing. At this time, we do not intend to authorize field trips. Danny will talk a little bit more about how sporting activities might play into that. But again, generally speaking, the common field trip right now doesn't seem really available to us, particularly from all the other precautions and mitigation, but also from the standpoint of the number of bus runs we have to make anyway. We probably just don't even have buses for them. And that does take us to school board decision number 7. This speaks to volunteers. I'm going to go ahead and I guess say up front that this question came up a couple times. We don't mean student teachers. We don't mean blocking students, those folks who have really been vetted and who are coming and are going to be with us every day. They are not included in this conversation, just for clarity. But for other volunteers, we asked the question, how would you like us to address volunteers? Option 1, we wouldn't allow any other volunteers into the building at this time. Option 2, volunteers who could commit to a regular schedule. And what we mean by that is just not kind of like a one and done visit, right? Mm-hmm. Somebody who would say, I can be there every Tuesday, or I can come 3 days a week. A person who's making an arrangement or a commitment with us, then we would go ahead and vet and train them in our mitigation strategies. And of course, they would follow the same health and mitigation standards that we would put on our other adults. We would then allow those folks. That's actually what we recommend. Option 3, we would say, okay, if a volunteer can meet the health screening piece, right? Like we talked about similarly with students and staff, if they can meet the criteria and will follow mitigation, then we would allow them to come volunteer. Otherwise, we recommend 2 that has a little bit more longevity to it, mm-hmm. and some training pieces to it.
And I know from speaking with Chief Wilson, volunteers in the community at this point in time would make such a difference. We already know the difference that volunteers make in our schools in general. And whether they be offering to clean a school bus on their way home from work one day, or coming in to help the teachers during the hour break, clean their rooms, those things would be extremely beneficial, because it goes back to the whole manpower issue. We just don't have enough resources to do all this mitigation without totally wearing out our folks.
So you said with option 2, so student teachers, because that question has come up.
This does not include student teachers.
Right. Student teachers are already going through that process. We don't really include them as volunteers per se.
What process are they going through?
They are working with their university and our guidelines. Dr. Wickham may be able to speak to that a little more specifically.
I think that's really important. There's a lot of teachers who are concerned. I mean, we're talking about students coming back our concerns about students coming back to begin with. And now we're going to be bringing student teachers into the schools who are now living in the environment that all of us are concerned about. And I know that there are teachers who do not like the idea of
Right.
student teachers coming into the schools.
And I think that the COVID task force, when they come this evening, can also address that. They know what Virginia Tech and Radford are doing and have committed to.
Okay.
So I think they can help with,
Well, I'm familiar
with
with
those
they're
concerns.
committed to, but whether you can actually accomplish it or not, I mean, there's a lot they plan on doing at Virginia Tech, but you're never going, if you tell me that every student is going to follow the guidelines that President Sands has laid out, and that those students who live in apartments all around Blacksburg are going to quarantine once they've gone and hung out at
Yeah,
Tots all night long, and then
we all
they're
know
gonna
that's not
quarantine for the
reality.
next 2 weeks. I don't think that's going to happen. And so you can tell me that these are all the things that are out there, but that's a real tough one to convince people, parents and teachers, to allow college students into the classroom.
I work with placing student teachers throughout the division, and colleges and universities have reached out to us to ask us not just what they're requiring, but what specific things are we going to require. One of the things that we talked about before allowing them to start would be that they would have to stay in the area, be quarantined in the area for 14 days before they start it. But additionally, they are reaching out to make sure that we're aware of their guidelines and what it is that we want them to do as well. So we're hoping after the meeting tonight, we'll have some greater clarity around it, because the bare minimum would be what we expect of our employees, as Mr. Knight's going to speak to.
I also would like to think that the maturity level there for the age group that would be doing that would have a little bit of caring of what they're doing and what they're putting themselves into. I do some student teaching college students, and it is a different level than your average freshman college student or sophomore college student. There is a difference. And I think teachers are going to want that help from what I've heard.
That's an excellent point. We do a student teacher orientation each fall and spring before they start. And one of the things that we talk to them about, especially HR, is that you really have to treat this like a job. No more going out partying on Thursday night. You have to treat this like a real job, because teaching requires a different level of dedication every single day. Additionally, we do have some teachers who have shown interest in keeping their student teacher. We have had a couple of teachers who indicated that at this time they're not comfortable. When they indicate that they're not comfortable, we find them a new placement.
So teachers get to choose
Yes, sir.
if they have a student teacher or not.
And I think for those students, it's required that they have to come and do student teaching. So that's part of their graduation. So I'm assuming they won't take it lightly.
And if we have a teacher shortage, we sure don't want to not encourage that
Exactly.
by all means,
Exactly.
from what I'm understanding.
We are currently on number 7, and we have 7 votes with a consensus for option 2. We can move on to operations now.
So
Yes, Ms. Franklin?
still with the issue of student teachers and their requirements for teaching. All across this country, there are a lot of places that are going to be doing virtual. That's going to be it. So how we plug those teachers into that system is something that's going to be looked at across the country, so that they're not going to lose. We get them 4 or 5 years of education, and then all of a sudden, I can't do my student teaching, can't get my certifications, right? That's not going to happen. That's going to get figured out, how that works out through the virtual system. That's a huge concern for me and a lot of families, because it'll have gotten a lot of that question. Having students, and I don't care how mature they may be and how safe they may try to be, there are people who are going to be around them who may not, and that's a concern.
Yeah, I agree. I mean, my daughter just graduated from Tech. As careful as she may have been, there's roommates and there's other people they're in contact with, and it's just, I'm not saying I don't know how I feel about it, because I do think that's a concern, and also the whole, I worked with graduate students last year who Yeah, they didn't get to do their student teaching because of COVID, and that's just what happened. And the university came up with things for them to do to fill in for that student teaching. It's a loss. We're all taking a big loss. Everybody's taking a loss right now. There isn't anybody in this country who isn't taking some kind of a loss. And sure, I want to help out student teachers. And yes, there's a teacher shortage. And yes, our teachers could use the help in the classroom. But I also think it's something we need to really think hard about and really feel comfortable that the students we bring, same with volunteers. I mean, I disagree with option 2. I mean, I really believe there shouldn't be any volunteers in the school. I mean, that's my belief, is that, you know, we should keep as many people right now out of the schools as necessary. I mean, we're trying to do, we're trying to make a normal world in an abnormal world right now. Life is not normal, and it's not going to be normal for a while. And to think that we can just have people come into our schools because we vetted them and they said they're going to do all these things, I just think we should try to protect our students and our teachers as much as possible. So I thought I voted for number 1, and we don't have the student teacher issue as even a question, and maybe
Well,
it should be one.
Yeah, I was going to ask that. Would you all like for us to add right now? And it sounds like you would with all the discussion. We could make a 7B in terms of us accepting student teachers and students for internships also, because see, they're required also to
Blocking
come in
students.
and do what do they call it,
Blocking students, yeah.
as well. So can we go ahead
I
and
think,
give you
yeah,
all that
that would be
question
nice
now?
to have that option.
And that's fine. I'm okay with that. But I have to say this, you know, I disagree with the bulking every college student together. I have a college student as a daughter, and she is who has helped us get our business through all of this with a face mask on and respect. And she's going into tech as a junior. And I'm sorry, not every college student out there acts the way
I didn't
you're
say they
assuming.
did. Did I
No.
say every student?
I'm talking.
Okay.
Thank you. Thank you. I'm just saying I disagree with that thought process. There's a lot of good college students out there, and I would hate to think that we would close our mind and our door to that possibility. There's a lot of good ones.
So
I agree.
think-
There is a lot of good college students. I
So
don't
Ms.
disagree with that.
Yeah,
but-
Ms. Whitaker, is it going to add that as a
Ms. Edding or-
7B
Yeah.
question about student interns
Interns, Black students
yeah, from colleges
from colleges.
and student teachers?
Okay. So
Okay.
we'll just
So-
tell us when it's there and we can
Yeah, we'll let you know when it's
put the
there.
votes in.
If Scarrett's, you know,
Yes, sir. I can continue.
Okay.
So board, if I'm not mistaken,
We're now at operations.
I don't have any more
You're
decision
done.
points. So it's presentation,
survived.
unless there's a portion you'd like to speak to, of course. So closing out that last section, MCPS does intend to follow our VHSL guidelines for sports. That takes us to our practices for COVID-19 illness. It talks about employees coordinating with our HR office, again, if they need to take leave or if they are self-isolating, the leave not being counted toward their allocated sick leave. Mr. Knott will speak more specifically to that in his plan. Again, student absences are excused, just like any other excused absence. Again, we want to make the point that if the student is at home well enough or at home awaiting results, they can still participate in our remote program, and that will not even be considered an absence.
Right.
Dr. J will speak a little more to that during his section. The division COVID-19 team will identify key staff and assign backups, right? So if one of us gets ill, there'll be a backup to stand in for us. We are each required to train our own backup once that person has been appointed. And again, also school principals will help us identify key staff within their building to train as backup, as we do consider shortages with personnel. And again, Mr. Knott speaks more directly to that. In section 5, we talk about, again, protecting vulnerable individuals. Again, we talk about mitigating employee risk through PPE, teleworking, or alternative duty assignments, carrying us to page 18. Again, you can coordinate with the HR office if you need to take leave or self-isolate as directed by the physician or the health department. Again, we talk about the students and again, their ability to work from home in the remote model if they're well enough to do so and need to be away from school. We talk about employees and students returning to school after a 14-day isolation with no symptoms, a negative COVID test, or a release from a physician or the health department. That takes us to section 6, preparing for when someone gets sick. This is again a portion of the plan that we must address. Again, we have our nurses assigned that will help us manage sick areas. Employees who present symptoms during the day should notify their employer, their direct supervisor, and make arrangements to leave the school. They should follow up with their healthcare provider or the health department. School nurses are responsible for following up with any parents of students who are sent home during the school day. So if Jason comes to school and before it's time for me to go home, I'm in the clinic not doing well, and I get sent home, I get picked up, our nurse is responsible to follow up before that next school day and say, hey, what was the resolution of that? Hey, where did that play out? How did that stand? The same is true for our employees. If an employee leaves during the school day, their supervisor is responsible to call them before that next work day, just so we know and can plan and prepare, so there's no unanswered questions. Again, it asks us to address this specifically. This is one that's pretty straightforward. An ill student should be picked up by their parent or guardian or an emergency contact. Generally speaking, an ill adult can transport themselves home or to their doctor. And of course, if there was a life-threatening situation, difficulty breathing, any competent adult should call 911, of course. Our custodian manager will designate proper cleaning procedures and disinfection for areas used by potentially ill students and employees. We realize that a student may have to wait for a little bit for mom or dad to come get them, and that area is going to need special cleaning, more thorough cleaning. If we send somebody home, the school principal is going to help identify all those areas that would need to be cleaned, right? So like my first period class, my second period class, they would help their custodian to identify these are all the locations that really, really need that special treatment and that special disinfecting. Again, it speaks to our relationship with our health department. You have heard those pieces already, but it's asked for again in the report, the plan. And that takes us all the way to section 7. Section 7 is our plan to close down schools if necessary due to severe conditions. And it asks us how we will, page 19. And it asks us how we would handle a reduction of in-person classes. So fewer kids in front of the school or in front of the teachers at the school. And it asks us how we would address a complete school closure. And on both of those, our answer is the same. If and when the health department recommends to us that we need to reduce our in-person time, or when we need to close for some period of time, the superintendent will contact you, the board, and seek your consensus on how we move forward based upon the health department's decision or recommendation. Based upon the health department's recommendation.
And the health department says that we have to close. As a board, do you really need the consensus? I mean, we have to sit and discuss whether we need to close. If they say we need to close.
The health department will recommend, again, you'll have Dr. Bissell tonight. I don't think she will tell you, you must close. I think she will tell you, I recommend you close, or I recommend you scale back.
Sure. I know that, protocol wise, obviously
Sure.
that's too bad. I just don't want to have time gap if it is such an urgent thing.
And we spent a lot of time on this portion. Like at one point we were making some options and ifs, ands, and buts, but it very well could be a school principal, or perhaps me, or perhaps Dr. Meyer directly gets a call one evening at 6:30. And it could be Dr. Bissell at the health department saying, hey, you've got a real spike here and you've got some contact tracing that I'm really worried about. And I recommend, and so he needs the ability to reach out and get your approval, because unless I'm mistaken, Dr. Meyer, I think ultimately it's the board who will decide
Yes, absolutely.
that we scale back or that we close. I don't think Dr. Bissell will ever try to say you must.
Right, she's just going to give recommendations.
But she will recommend, and then he needs to be able, again, the most likely example is late one evening. reach out to you guys and say, hey, as we discussed in our plan, as we shared with the state, I'm following the protocol of sharing a health department recommendation with you, and I need a consensus on what you would like to do as a board.
So we all set our phones with a special alarm.
Yes.
Open alarm.
We
Seriously.
need to
And-
have a little
and
phone
you hit
tree
the
like
button,
old days.
And we all know this is an emergency. We need to respond right now.
Yeah,
The red phone.
Time will be important. Yes,
Yeah.
ma'am.
yeah, because I don't want, Dr. Meyer, wait on us that we will see our message or we
Mhm.
see our phone call, in an emergency. Yeah, almost like a good old days, we had emergency phone trees.
Mm.
Who will call the next and who will call
The-
the next kind of thing.
And of course, the next step is based upon your decision. It's the leadership team, particularly Ms. Drake, crafting that message
Mhm.
and getting it out. I mean, it is a snow day times 10.
Yeah.
Yeah,
So-
absolutely.
Okay, question 7A is now available for everyone to weigh in on. Will we allow student teachers to complete their student teaching requirements in the MCPS schools?
Jason, are you going to talk about substitutes or is that Danny?
I think Danny has a section. Yes, ma'am.
Okay, thanks.
So I want to still have a conversation about a possible shutdown. If we get a recommendation, we know what we're going to do. So can we put something in place now so that if Dr. Bissell says, I recommend, that we're saying, yeah, if she recommends, we,
There may be various degrees of recommendation too, based on our
Whatever she
phases and
recommends.
levels. And so we have all the phases and levels. And so what I would do is, and she's seen those, and so she would probably use those to make that recommendation.
Very likely. Yes, sir. Sorry.
I mean, and so you probably need to wait till the end, maybe talk to her.
Mhm.
The last I've heard, her recommendation is for us to go 50% back, but
Mhm.
I don't know that that's what we're going to do.
Mhm.
So, the question is, we don't, always know if we're going to follow the health department's recommendation or not. And so, but yeah, I'd recommend we talk to her and then we have different levels and she'd probably say, she'll look at our levels and give recommendations on the levels. She's like there's been a recommendation for opening of school now. And so,
so for me, it's the recommendation. I believe you need to shut down the whole system or a building. That's the one I'm talking about.
right.
Yeah,
And for you to have the ability to say, yes, the board has already said, if this recommendation comes across, we put a plan in action and we shut it down. You should not have to contact 7
Yeah.
people.
that's how I.
That
felt
is a
too.
good
Yeah.
point. If we
Yeah.
spell that out and it's like in July, this is July is an exception,
Right.
but normally in July, if the personnel report comes across and we're not having meetings,
Sure.
we have given you that ability to approve the personnel report.
Mhm.
So to me, it's the same situation. If we, if her recommendations are A, B, and C, then you react on those and you have our approval. Once we
Okay.
outline
So,
those.
Ms. Franklin, you're saying if it's, looking at our phases, shut back all the way down, like to,
Yeah, if she says, I'm recommending that you shut down a building or the system.
Mhm.
Those are the only 2 things without you talking to us that we already have it in place.
okay.
You shut it down and don't worry about calling me.
I mean, that's
And you
fine.
could even add that as a
That's up to
question on
you.
here. to the end, and we can answer that as part of our approval of the plan.
That's
If
fine.
the board is okay with that.
Okay, for the total shutdown of a building or a division,
Yes.
that I would be able to do that based on health department's recommendation immediately.
Of course, you'll let us know that you did it.
I'll
but
let you.
Yeah.
you don't have to
Yeah, I
wait
know
for
everyone's
you to
phone
do
number
it.
up there, that's for sure. You all know
Yeah.
that. so.
I think that's a great idea, Ms. Franklin. That
Right.
really gets rid of some red tape.
And on CDC page, there is the school's decision tree. So when you have a confirmed case in the building, you assess the risk. Obviously, the health department helps in the process. And then, you decide whether it needs to be closed or not. But, something like that, we will have a school decision tree and where we need to be saying, yes, go and shut down. I think if we know ahead of time,
Right.
that will
Okay.
be good. That will just save time. feel.
I think our intention was to just make sure the information was shared with the board and to provide you the opportunity to make the decision.
Yeah,
If the board is
I think we can
comfortable.
do that ahead of time.
Yeah.
Question 7A, we're still waiting on the 7th vote. We do have consensus, but we only have 6 votes.
I don't know if I did it or not. Let me see. I think I did it. Did I miss? Did I push that?
That seventh vote would be me. I'm not sure what to do on this one. It's not one, I guess, that I'd given a whole lot of thought to. I mean, I gave some thought. I thought it was maybe included in the volunteer situation and kind of wanted to hear, and now that we're breaking it out on our needs, is that something Barbara can answer or Carl on our needs for the student teacher as opposed to, the needs of the teachers to get certifications and things like that?
I'm not sure if we've heard anything from of course, the Department of Education. They're the ones that make the ultimate decision as to who they're going to give a license to,
Mhm.
and what requirements that have been completed. I don't know if the universities have spoken to the Department of Education or not in terms of that. And yeah, that's true. It's not just the DOE, it would be legislation would have to be changed because it's actually legislation that controls what a student has to do to actually obtain a teaching license. So that actually have to go through the General Assembly. So we don't allow them, we would not be allowing them to get a license to teach at this point.
During last year, during the spring semester, they did remote work. Some student teachers did remote work, and they did relax the number of hours that they had to have. So, but I think maybe Mark might be talking about our teachers need, because you get points for having student teacher. That's big numbers. Having a student teacher gives you, what is it, 45 points?
It's 90,
Yeah.
I think.
Having
Or
a
90?
student
Yeah.
teacher for a full semester does give you 90
90,
recertification points. And as Dr. Meyer alluded to earlier, we did survey, and we always survey our teachers to find out who wants a student teacher. So we did survey last spring at the beginning of May, I think it was. And so we did complete the survey, and we based placements on those survey results. But yes, teachers do receive 90 recertification points for hosting a student teacher for a full semester.
It's like 45 for a blocking student, right? Yeah.
And we also have to remember, a lot of these student teachers stay in our county, and we need to nurture that because we need teachers.
I agree, Marty. I mean, I think it's a wonderful place to find good, strong teachers, but I also think we have to balance that with the health concerns of bringing students into the environment. That's all I don't disagree that it's a wonderful place to groom future teachers. But I'm balancing that with the risks.
Okay, on option 7A, we are at all 7 votes, and the consensus is option 1,
Which is,
the 14-day quarantine.
To allow student teachers with the 14-day
Yes.
quarantine. Okay.
So we're ready for operations and to move on with.
Right. The last piece I would add, and you're going to see this from a number of the speakers, you see some of our stakeholder input. You see our health and safety team. You see list of meetings and dates and times. We've actually had an additional meeting since then. You see the dates of the Public Health Task Force. Certainly want to thank everybody involved in putting the plan together. And many thanks to the board. These are hard decisions, and I appreciate your time and effort. Thank you.
I'm going to go quickly because mine's fairly simple. On the operations, we broke it down into 4 components: cleaning, facilities, school nutrition, and transportation. And one thing to keep in mind as we talk about these plans is that in all of our cases, they're very fluid. We continue to monitor what's out there. We can continue to talk to any and all vendors and ensure that what we're doing fits the best practices that are out there to address this particular situation. On the cleaning side, the first thing we started with was our chemicals. Everything that we use to clean our buildings are chemicals. They qualified as a chemical. As such, we made certain that when they came out, that our chemicals that we use throughout our buildings met EPA, were on the EPA recommended list. They were on the CDC recommended list. And subsequently, the health department came out because it's a chemical, because it's associated with employees. They do check what we use in our cleaning process. And they also found that what we were using met any and all regulations that are out there, and it's on every approved list. And we will continue to upgrade that. The second thing we did is once you know the chemical and it's correct and it does what it's supposed to do, which 2 things are: cleaning and disinfecting of the surfaces that we do. You'll hear it called high touch points. Those are where the droplets remain, and that's where the virus is most likely going to be picked up. The second thing is how we deliver those chemicals to the cleaning surface. That's the equipment. We have top-notch equipment. If you want to see, we've set up a table in the back. You can see the type of equipment we use and the type of products we use each and every day. But we went, checked it. We ensured that all the equipment that was in our room to repair is repairable, that everything's fully functional, and that we are giving our staff the resources necessary to clean our buildings and clean them well. As we got into making sure we had the chemicals and equipment, we ensure that we're doing things correctly as we work on the plans with each school is through our inspections. Typically, we inspect our schools 4 times a year. During the pandemic, we'll continue to do it on a monthly basis, not at the detail level that we do, obviously, 4 times a year, but ensure that we're keeping our buildings clean and we're doing everything we can. An area, though, that has been addressed is do not have things for children to touch. So we've gone out and made certain that all of our trash cans are touchless. We've also made certain that you will have in every restaurant soap and a way to dry your hands. That soap will meet all the guidelines that's out there. And there's 2 sets of guidelines, one for K through 2 and then one for 3 through 12. The K through 2 uses more of a hand type of soap. The higher grades are able to use more of a sanitizer in how we just clean ourselves. As we looked at,
Can I
our-
get you to explain that?
ma'am,
Explain that to me. I don't.
it's the chemicals that are in it. You know, when you wash your hands and you take your soap, the way that you get rid of a bacteria, any bacteria will grow between 40 to 140 degrees. So the warmer the water, the more effective it's going to be. But you can't put your hands under 150 degree temperatures. You'll scorch them. So then it becomes a combination of the chemical I'm using and the hot water. Asking a child at pre-K to 3rd grade to put their hands on the hot is very difficult. But the older I am, the more likely I am, 1, to wash my hands correctly, to take it, go through as much as I need to, go between the fingers, do all the things I need to do, make sure I'm doing it for 20 seconds, and then putting it under the hot water and making certain that I'm rinsing my hands completely, and that then I dry it. I don't do this. I turn around and I wipe it on my pants. Okay? Or I wash it and I do this, then I turn around and I go touch the door handle. There's a chance I may not have gotten rid of the virus. Once I touch that door handle, guess what?
Got it back.
Now I've got it available for anybody to touch.
Right, but you were saying for the younger kids.
We use a hand soap. That's what's recommended by CDC, that it's a
Okay.
more effective product and it's easier for children to properly wash,
So
to
a hand-
disperse it on their hands and then wash it. Ma'am?
I don't know. I'm just confused about soap, I guess.
Hand soap is considered a better product than the sanitizer / cleaners for adults.
Okay, so what is the hand sanitizer play?
The hand sanitizer is a product that the older population is encouraged to use, that I spray, I wipe throughout, just like I would a soap. but it's got the alcohol in it, so it's going to have a more effective kill rate on anything that I may have on side of my hand. Then I put it under hot water, wash it off,
Okay,
and I've got a cleaner surface.
okay,
Okay.
thank you.
As we reviewed our standards and reviewed what we did, one of the decisions we made was two things. One, inside our buildings, right now today, in almost all our buildings, we have one custodian for 8 hours a day custodian, they're called. That's not enough for us to do the things we need to do when we're in the buildings. We need to be cleaning our high-touch surface areas as much as possible. We need to be ensuring that our restrooms are clean and that they're properly stocked. So we've gone forward and we can fund this out of our CARES Act funds, as well as we've made a claim under FEMA for some of the dollars we've incurred. We've been advised by FEMA that we do qualify, and that's an 8-hour position per day during COVID only. It is not a full-time position. It's not one that is intended to have a financial impact on the budget. It's one that's intended to address the situation we're in today. But at the time that this goes away, that position, potentially, that'll be up to the superintendent and obviously the school board, but that position could go away.
So that's for every building?
Yes, ma'am. All buildings.
And of course, we'll talk to you later on, later in the agenda regarding a shortage we have in custodians and how we need to address that immediately.
Yes, sir.
That will be later this evening.
Second thing we did is during that time period in between the morning session of the school in the summer and the afternoon session of school, we have to get into as many of the high touch surface areas as we possibly can. We have sprays that are very effective, but there's a backpack spray that allows us to have more solution with us and also spray in a more effective manner. We've gone ahead and bought one per school. The backpacks cost us right at $47,000. We'll determine how effective they are. They will be a tool that we can use forever. So it's not just for this event. They're there for everything. And if we need it, as we look at the financial situation, we could be making a recommendation to the superintendent for additional equipment. But we want to see how we do, and we have a
Can we cover that with the CARES money or
Yes, ma'am.
the cost of those?
Yes, ma'am. During the school day, you'll see us refer to routine cleaning and deep cleaning. We've put in attachment C, a breakdown of what's meant between routine and deep cleaning. So I'm not going to go through that. But the things that we will have at every school, providing mobile hand sanitizers at every primary ingress and egress points. 340 mobile units have been built. They're sitting in the warehouse and will start being delivered tomorrow. In addition to the mobile units, we will have masks at all of these stations. We will also have minimum of at least once per hour. We'll go through our restrooms. The restrooms are an area that has the highest potential, particularly in our elementary schools, for where things will be, and we want to make sure it's clean, and we want to make sure it's properly stocked. Throughout the school day, our custodian teams will be constantly wiping those high touch point surfaces. So that's door handles. It's going to be the desk in front of the divider where I'm coming into the school. I'm dealing with the administration. Those are the type of surfaces we want to be wiping down on a regular basis and doing the things we can to address the challenges. As it was mentioned earlier, we'll have the disposable cups by the water fountains. Those will be going up. We have the equipment. We'll be putting them up here in the next couple of days. You can see we will attempt, and we're going to get to a decision point here, but in that time period between the morning session and the afternoon session, the goal should be to try to clean as much of the high touch point surface areas as we can. So that's classroom desks, that's door handles, that's restrooms. The challenge that we will come upon is we only have 2 custodians. And if you look at a Blacksburg, for example, there's 85 classrooms. There's no way that I can, no matter what the equipment is, we can do it.
Mr. Grant, Scott mentioned one.
Yes, sir.
thing, too. One of the biggest challenges will be, but with the middle and high secondary schedules,
is students are going to 2 classes in the morning, then 2 in the afternoon. It's the time between those 2 morning classes when they flip, there's only going to be 5. We might extend that a little longer, but it's no way that custodians can clean in 5 to 10 minutes.
Yeah.
Correct. There's
That's,
no way.
that's going to be the challenge, and that's why that question is coming up. Okay.
So as Dr. Meyer said, we come to this question. When we have that break in the class, okay? So we have 10, and we've done a capacity per each school building. In computing the capacity, because every room is a little bit different, we use, which pretty much is out there recommended, 65 square feet per student. Now, the guidelines on a 6x6 says 36 square feet, but then I get into how much of the wall and how far out the wall do I give to the teacher? Okay? If the area is a 30 by 10, all of a sudden there's 300 square feet I'm taking out. So we've done the capacity, we put that on all the walls. We've looked at how many desks will be utilized. And the question becomes, will secondary teachers, because the elementary schools are not changing classes, the teachers are changing. So will secondary teachers spray the desk between class changes? Option 1, teachers will not sanitize the desk. So under that, we would be saying that the custodial team will do it. That'll be a challenge with 2 custodians in a Blacksburg High School in 85 classrooms. Option 2, teachers will spray the desk, which is the recommendation of the administration team.
Mr. Kranz, it's a spray too. It's not, they don't wipe.
No,
spraying and
it's an actual
wiping?
spray. We're not wiping.
So it's just spray.
It's a spray
no
because
wipe.
that's our
And it's
quickest
self-drying.
delivery of the product.
Right.
Right.
How long does it take to dry?
It'll dry within 2 minutes.
And something else too that that we'll do is you got to remember at the 50% plan, there are only half the students in the class, but all the desks are still. We're not taking desks out of the rooms and storing them somewhere.
Right.
So what we're going to ask teachers to do is to actually assign desks where the second group doesn't set the same desk that the first group did in the morning, but still think it's necessary to spray the desk that the previous students had been in. So that's one more level of mitigation that we'll actually use.
20 desks, we believe you can clean in about 2 minutes or a little bit less.
Well, unfortunately, I hate to put more on our teachers, but it seems like it's the only option. And again, this is where volunteers would come in very handy, especially in elementary.
You know, I think elementary teachers have been doing this for a long time because they ask for Clorox wipes all the time.
Yeah.
And so I think they're used to cleaning desks and cleaning
But
areas.
it also gives them a control of knowing how clean their environment is as well.
And in elementary, I think when different groups comes, AM and PM, we have enough time to be able to clean, all right, custodial wise?
You're talking
No.
about fewer classes, so you're going to be typically 20 to about 35 classes, but
And I think
you
there's a
still,
2-hour time frame between AM and PM.
No, just an
no
hour.
ma'am,
No,
there's less than an
just an
hour
hour.
because we'll leave at 12 o'clock. We're bringing them students back at 12:45 to
The more time-
12:50. So
Yeah.
it's
And the
tight.
custodians
thinking
are
that-
already working on the touch points when kids leave, so they're not going to have time to do class.
I guess the question is, we are asking secondary teachers and we are expecting elementary to do naturally because it doesn't say both elementary and secondary.
Well, the difference is this, the elementary, the schedule for elementary schools is an AM group and a PM group. Okay. And so, of course, elementary schools are a lot smaller too. There's no class change between different groups
In elementary.
in the morning period. So there's time between the AM and then the PM group where custodians can get
So that's what I was trying to
to
ask.
those classes. Yeah, that should be able to work, correct, Mr. Krantz? Is that right?
We believe it does.
Yeah.
We believe it does.
Now, we can still supply the, and I'm sure elementary teachers will want this actually.
Sure.
The bottles they can spray themselves
Correct.
as well.
Correct.
The more, the better. So,
Yeah.
yeah.
Okay, so we're still waiting on 2 more votes?
One more thing I
And
would
number
like
8?
to ask you, Mr. Kranz. I know all the places that needs to be clean listed there. How about the playground equipments?
Right now, playgrounds are not they're not something that is recommended to be used. at this point in time.
Okay.
We honestly do not have the man hours
Mhm.
that we can maintain. We will do pre-K
Mhm.
because they will be, but honestly, that's and that's something CDC at this still point is still not recommending
Okay.
that children use playgrounds.
Well, I mean, the reason I ask, I think we want them to get some recess time, outdoor air,
Right.
as much as possible. So teachers are not going to let the kids go and run around whatever the equipment is there. Okay, yeah, I just want to clarify that.
So on number 8, we have 7 votes, and the consensus is teachers will spray the desk. So we can move on to the next question.
Okay, so I do have a question about the cleaning of touch points.
Mhm.
So our custodians are going around wiping things down. So what materials are they using? Are they using disposable cloths where they can wipe an area, get rid of that? Are they constantly using the same rag or cloth to clean all over?
The most that any item should be used in a cleaning process is no more than 3 desks. If you're using a rag, let's call it microfiber rag,
Mhm.
the most you should use is 3. Once you've used it 3 times, you need to dispose it and then take a new rag out.
Okay, so when we're doing door handles and.
During the
regular
school
stuff like
day,
that,
we're primarily going to be doing spraying and we'll be using disposable rags like this.
Okay.
It's going to be as quick as we can. Now, when we go from day to night, which is our routine cleaning, at that point, we're using the microfiber rag towels and we're hand cleaning as we normally do, which is a spray and wipe because that's the most effective manner.
Okay, we're just not
Can I?
excessively using one rag.
Yeah, we won't be. We'll be
Okay.
using during the day as quickly this because it's about hitting as much as we can.
Okay.
What if there's a teacher that's immune compromised and doesn't want to be cleaning desks? Is there an option to, especially at the secondary level, to maybe, if a student wants to do it or to have somebody volunteer to help them, or what do we, there are some teachers who are fearful of that, and I
Right.
think we need to
Mhm.
make sure that we honor that.
We have procedures for our teachers who do have those issues, and Mr. Nutt will talk about that later.
Okay.
But I don't, yeah, that might be a situation where they shouldn't even be in the classroom because of a health issue. If they're able to be in if their health allows them to be in the classroom, then, they should be able to spray the desk.
Well, I'm gonna disagree with that because
I'm sorry.
with my system being in a classroom where things are being sprayed,
Right, that's an allergy, right, because you have an allergy issue. Yeah, sure.
but
Right.
once it's done and
It's okay.
things are, cleared out somewhat, I can go into the situation.
Correct. And so Ms. Cass asked about the immune, but obviously if there's a situation with allergies where the spray could affect you, then we'll obviously work with our folks with
We'll
that.
find a way to get that done.
Yeah, absolutely. Yeah,
There
good point.
was something that got brought up during Mr. Garrison's meeting that we had with the health and safety, and that was brought up was an idea to have the students, we were thinking of time and everything. So it was either the student as they were leaving got it and wiped it, or the student that was coming in. The one thing that I think we agreed on was because some students probably don't wipe as good as they should be, and they're just worried about getting out of there. We were worried about the surface being cleaned the way it should be, for one. And if that was to be a potential something that we were actually looking at, we would probably look at the student coming into the classroom that would actually be sitting there doing the cleaning of that desk, because they would be more apt to be more thorough because they would be the ones sitting there.
And that's one of the reasons why we'll have in classrooms, the bottle sanitizer. This is what actually will be, you'll see in buses and you'll see in classrooms and you'll see at front doors, just this. And you'll see the disposable. In some schools, that's what they're recommending is for students coming in and leaving, wiping down in between the 2 wipes.
And
They're
that didn't
thinking-
hurt,
Correct.
even extra, even doing that on top of the spraying as well.
I just want to throw out just kind of a hypothetical situation. So I'm a secondary teacher
Mhm.
And we have 4 or 5 minutes in between classes. How many is it? Do you remember? 5?
5.
Okay, so my class is over, students exit, takes about a minute or so for them all to get out of the room. Got about 4 minutes left. So now, then my principal says I have to be out in the hallway to make sure that I'm watching students to make sure they're all doing what they're supposed to be doing. And so now I go out in the hallway and I'm monitoring students and wait a minute, I might have to go to the bathroom. But I can't do that because I got to go back to my classroom and spray down my desks and make sure they're all done. I think we're asking a fair amount of teachers to, in those 5 minutes, and I got to prep for my next class and make sure that I have my synchronous learning going and my computers are ready to roll and I've got that is so much. And to then add on top of it, and please clean the desks.
So we probably need to make it more than 5 minutes to class change. I think to give more time to teachers.
I just feel like that is, if I think of that scenario and having
Sure.
been there, that is just,
Yep, I
those 5
understand.
minutes go really, they go fast.
Yeah, they do. And when I was teaching, exact same thing. I mean, you have to get all that in the class change and then to add the spraying of the desk, it is. I don't know what else to do.
I know, I understand, I
but
think
we
need
can't
to be
add time
realistic.
in the class transition. We can do that if need be, or look at a different way. Now, here's something else too is, we haven't gotten down to this level. I mean, to the level of what some things, procedures in actual individual schools. There are some things schools are going to have to decide, such as what do class changes actually look like?
Yeah.
It probably will not be what it's been, where it's a bell and everybody just goes outside in the hallway. All right. It's probably going to be more of an organized effort in how classes are dismissed one at a time. So it's going to look different than that 5 minute kind of thing that we always been used to. It's not going to be that, but we have to talk to principals. They have to, buildings are different, grade levels are different. We have to, like in our middle schools at Christiansburg and Blacksburg, a lot of the kids are in pods. Well, that's an easy switch. You don't need a bell to go from pod to pod. That can be an easy flip of when the teachers
To move within
move within the periods. Yeah. The move within the periods will look different. And we'll be asking our principals and to work with their leadership teams in their schools to figure out what that actually looks like. And so I guess we got to think outside of, it's not just going to be, like it always is, and the bell rings and everyone heads to the hall and goes to bathrooms, and because that's going to cause issues as well.
Yeah.
In the number of kids in one place at one time, even at 50%, that's a lot of students in the hallway and passing by each other. So that's something that will have to be looked at in the coming weeks or before the students actually are back in the building.
And maybe this is a thing that gets dealt with more at the school level, and
Yeah,
how the
absolutely.
desks are going to get cleaned. And
Yes.
Mhm.
No, there's a fact we don't have enough custodians to do 85 classrooms at Blacksburg High School. I mean, it's not going to be 5 minutes, and it's going to be some kind of change. But I mean, we still don't have the custodial staff. We're going to need teachers to help us out, and spray down the desk.
That's part of that sacrifice we were talking about earlier that everybody
Yeah.
has to make.
Everybody has to is that being asked to do a little bit more these days. Yep.
If
A
I'm-
lot more. How's that? And so,
If I may, it is after 5:30. We have guests coming at 6:30 to address you as a board. Your dinner is ready whenever you are to take that 1 hour break.
Would you like to finish? We'll be able
Do you
to
wanna
finish up,
break
Mr.
here?
Franz? Or is it a
sit
good
here?
break
That's
time?
the
Do this?
pleasure of you guys as the board.
I think we got a lot to do. Maybe we should just eat and talk at the same time.
no,
No?
I prefer not to. We can come back sooner.
Yeah,
Right.
that's fine. I can do
Yeah.
whatever.
I would
Well,
say we
may
still break
Not use the whole hour to come back.
and not use the whole hour.
Yeah.
Yeah, just
Yeah.
go eat, and when we finish, we'll come back.
Yeah.
Is that
Sounds
okay?
Sounds good.
Dr.
We'll have a
Meyer,
teacher lunch, 25 minutes.
Our public notification included that the board would,
I can't hear you.
our public notification included that the board would break for an hour
Oh,
and would
okay, so
restart
we
at
have to?
6:30. I believe we have a responsibility to
Okay.
the public
keep
to
it that
adhere
way,
to
yeah.
that. I apologize.
That's
Okay.
okay.
That's all right. A good plan.
That's really fine.
Okay.
Okay.
Yeah.
Anybody have any objections?
So we're gonna break for 1 hour right now.
Me, I don't get to
Yeah,
watch that long.
We are. Mr.
Okay.
Johnson.
Sounds good to
So we
me.
will be back at 6:30 is what we're
That's a
saying.
lot of time.
6:30 we'll be
Okay,
back.
thanks, Ms. Drake.
I got people yapping.
Let's get back to work. Thank you.
Mr.
All right.
Garrison, go ahead.
Chief Wilson and
Mr. Garrison.
Dr. Bissell, thank you for being here.
Yep.
Mr. Garrison, floor is yours.
Oh, sure. We're all saying the same thing. We've got two guests with us here this evening who have agreed to come out, of course, during an extremely busy time for both of them. Board, you've heard a lot of comments, particularly in my presentation about the New River Valley Public Health Task Force and the work they've done starting since early March. I think I gave you a number of, I think we've met 75 or so times, either face-to-face or in virtual setting. And we asked Chief Wilson from Blacksburg Police Department and Dr. Bissell from the New River Health Department to join us today. I understand we want to thank them for what they've meant for us as we've negotiated the last 3 months of school and our feeding programs, and as we begin to talk about planning for next year, and as we talk about being able to accomplish drive-through testing at some of our school sites, and as we've worked through situations where we've had questions about employees, they have been an invaluable resource to us and have been constantly available really at all hours. Dr. Bissell had sent me an email the other night, I think about 45 minutes after midnight. So they've been working very, very hard and very, very diligently to help put us on the right track to make good decisions and help us keep our staff and students safe. So I think tonight we wanted to bring them here to be able to give them an opportunity to be recognized and appreciated by the board and all the rest of us. And I also understand that maybe there's a few questions you might have just in regards to some things that might exceed levels of expertise that you might find in my office or elsewhere. So with that being said, if you two would care to join us and the board can share comments.
Mr. Chabaka, are you on?
I am, thanks.
Thank you. We have one board member electronically participating, so make sure that he is hearing. Well, thank you for being here. I appreciate your time, and I know we have questions. In the beginning of the afternoon, we discussed with Mr. Garrison a lot of health issues and health concerns and what to do and how to proceed. And so, board members, any questions to Chief Wilson and Dr. Bissell, or if you would like to say something before our questions, it's also up to you.
I'll just speak really briefly because I'm sure I have not much for you. But I want to first of all thank Jason, Dr. Meyer and company for helping us from the very onset establish drive-through testing. Our school sites were absolutely critical. They were very safe and secure. They had a monumental task, feeding the public and then letting us on those sites. They were absolutely fantastic to work for. My job as a task force leader was pretty easy. We just built logistics support. And what we did was Dr. Bissell has the expertise. They had a small machine with a huge job. And what we did was we provided a much bigger machine to support her. We're here for you guys. Our K through 12 is our most critical infrastructure that we have. It's our most valuable resource. It's our children, but it's also, if it doesn't fly or something happens, our economy doesn't fly. But we stand ready to help you with whatever decisions are made. We bring a tremendous regional approach to doing this. We've talked to every superintendent in our region. We've collaborated all of our county administrators to put the financial and political backing behind this, doing this as a regional basis. And we look forward to it. We look forward to working with you side by side. We will never leave you. And no matter what decision you come up with, if you need me to clean your school buses, I've stood in front of boards before and made ridiculous promises. I'm still the ACE coordinator for year 4.
You've done that before.
But I'll clean your buses. We will get you.
I haven't taken notes, you know.
I know, take it. But I'm telling you, that's the commitment of our task force. We are absolutely community based. We will take this thing as a region, and we will mitigate it and survive it and thrive in it as a region. So thank you all for letting us come. And I'm sure you got lots of questions for Dr. Bissell, but I'll guard her in case it gets ugly.
I appreciate that. And it's definitely such a wonderful community and such a wonderful community effort. And we're blessed to have the numbers down and relatively safe place to live, even under unprecedented crazy virus conditions. So I definitely appreciate all the work you guys are doing. Board members, anybody would like to start with their questions?
Okay, so
Ms.
nice
Franklin.
to meet you in person. So one of my concerns has been, and I think you and I spoke about this, was the lack of education as far as the community around what a exposure actually is, as far as distance and time and conditions, and how the tracing is done, how folks need to make sure they're cooperating with that. So for me, that has been a huge piece that I've had to deal with. So how do we educate our folks better about this?
Yeah, so a true exposure is a lot different than what most people think. Most people kind of panic. I walk through the same room as someone who had COVID. The true exposure is within 6 feet for more than 15 minutes without masks. So that really cuts down on the number of true exposures. I have a staff and we've augmented our staff. We have hired, and in fact, in Southwest, we're going to have about 100 new staff to take care of Southwest Virginia for contact tracing and follow-up with the health department. I have a fabulous staff, and actually cooperation with our investigations is not a big deal. We work very hard to gain their trust. We have a conversation. We don't criticize. We don't shame or blame. We really want to just, get the story and find out what they've done, who they've been in contact with, and be safe about it. So people cooperate with us. When they call us, we try to educate them. A lot of people call us out of fear, and we hear contacts of contacts of contacts of contacts. And what we did early on, because we were able to start community testing very early, we were able to open testing to pretty much anyone. And there aren't a lot of districts in the state that were able to do that. And I think what has shown a lot of people who thought they had a contact and they came and they tested negative, that maybe they didn't have that close contact. This virus, yes, it is spread from person to person. It is a communicable disease, but it is not going to jump out and grab somebody. You really can take sensible precautions to prevent it and to take care of yourself. And so we've done a big job messaging that, and we educate with every contact that we have on the phone, whether it's through the call center, whether it's through my EPI team, whether it's through me. I have population health people who are doing outreach at events. We're messaging the community, we're messaging the students coming back. So we're working on that. But I think we have good cooperation with our investigations and our contact tracing. We're fortunate that we have the resources with Fralin Biomedical Research Institute that we're able to get testing with a really quick turnaround time. So if my EPI team calls me today and says, I need these 5 people tested as part of my tracing, it's not unusual that I or my staff will literally make home visits and do it, or we'll bring them into the health department first thing tomorrow and we'll have a result within 24 to 36 hours. And that really allows us to mitigate and to, find out who actually was exposed and who needs to quarantine, as opposed to people who are panicky and really don't need to.
Right. So I understand that, and you all are doing a wonderful job. But it's that last piece you talked about, and that was helping folks understand, know what you've had is not a contact, or just walking into a room where someone 2 buildings over had it. And
Right.
that doesn't mean that you've had contact because you walked down the street. Because I work in a plant, and
Right.
if someone coughs,
Mhm.
everybody in the plant panics. And trying to help them understand, no, this is not a contact, which talking with you and your staff has helped me understand better. But in general, I don't think the population understands that 6 feet, 15 minutes, no mask as being a true contact. They just, and so somehow or another, we need to get that across to folks, because once I'm able to have that conversation with folks, They immediately calmed down once they realized, no, it wasn't 15 minutes. We had masks on, and it might have been within 6 feet, but it wasn't. It was with mask on.
Right.
And I'm okay. But before that, they're in tears.
Right.
You know, trying to figure out, am I taking this home to my family? So I believe with the school system, with the whole community engaged with this, with the schools, unless we help folks understand that criteria, it's going to be just crazy.
And I'm happy, my staff is happy to talk with teachers, to talk with staff, to talk with bus drivers, to talk with parents. I mean, we're happy to set those kinds of things up to get out there and help with some of the panic and the nerves about it. I mean, we're willing to do whatever I've been trying to do. We've started an interview series, and I was with Katie Reshedko of WDBJ7, and I was with Onward NRV, and then today I was with the Partnership for Access to Healthcare. We're planning to do some video. Our media group is planning to do some little video blogs and podcasts, and that can certainly be one of the topics that we address. What is a true contact?
Right.
And let's bring the panic down a little bit, and then as part of that, I want to get back to just the basics, right? Stay home when you're sick, wash your hands, cover your cough. Those kinds of things will make a world of difference in the spread.
Okay, great. So when you get those videos going, I'd like to have ones we can play it over and over in my plan.
So Doc,
I have several questions for you, but I know others do too, so I won't do them all at once. First of all, what do you think is going to happen when the students come back?
The Virginia Tech and Radford students?
Yes.
We will see an increase in cases.
Because you said right now that you can get results pretty quickly.
Yes.
And you're working with Fralin, and Fralin's part of Virginia Tech. And so I'm just wondering now, when the town goes from the town of Blacksburg and the county, I don't know what the population is of all of Montgomery County, but I know Blacksburg, we're going to go from 14,000 to 43,000 people in our town. Are you going to be able to maintain that same quickness in getting test results? And what do you think will happen when the students and their parents all come and back to town, and they're shopping in Christiansburg, and they're coming in to all the restaurants and all of our stores? Could you give me an idea of what you think might happen?
We'll definitely see an increase in cases. I mean, there's no two ways about it. We'll see an increase in cases. But again, the panic of just because you were in the store where someone was
Right.
positive, that's not a contact. We're trying to lay the groundwork and the expectation about masking, about some physical distancing. And I think a lot of our store owners are buying in with it now. I think a lot of our community's buying in with it, and we expect the students to adhere to that as well.
You expect the students to, but realistically, will we be able to really control?
We're not going to be able to control it 100%. And the students want to have social activity. I mean, we've taken what they expect to be a college experience and we've turned it upside down. So to expect that they're not going to have social activity is just not realistic. To be very honest, the students are very low risk to get COVID, and they know that. And that's part of the problem. They're invincible. They're very low risk. Our goal is to look at where those students intersect with the rest of the community and our higher risk population and take it from there. So in, say, a social gathering of students, if they have a case or we have a bunch of cases, we tell those students, and I will say, back in March, our first cases, I think everyone knows we're students, but they did all the right stuff. I mean, when we told them they needed to self-isolate, they did. When we told them they needed to quarantine, they did. So if we have a big gathering and we want to kind of cut down really quickly, we just say, look, these folks need to self-quarantine or need to self-isolate for this period of time. And we check in with them. We have a monitoring system now that they can check in on, and we put it there. So if it's a group of students, we're not super concerned about it. If it's a group of students that is then going shopping and stuff, that's where we have to put the stop to it. That's where we have to say, you can't be using the stores and stuff. You need to find friends. You need to find somebody else to help you get your groceries and do that. And the students have cooperated with us. They really have cooperated with us. Yes, I have friends to help me. Yes, I have someone who can go get groceries for me.
That's the students with the summer? You mean students during the summer?
That was in the springtime and over the
When
summer
there were a
too.
lot less students around.
Right, there were.
I can't help but be concerned that the numbers are going to surge to some degree when there's more, not just students, but just more people coming into our area. Tech is going to start operating at a greater capacity. We're going to start having more guests come into town. And I feel as though there is going to be an increased risk to our residents, which an increased risk to anybody who's here in Montgomery County. So I can't help but be concerned about that. And it sounds like you agree that, yeah, it will
Our numbers will
increase.
go up. Our
Mhm.
numbers will absolutely go up. But again, it is risk, right? There is no elimination of risk.
Right.
Even if the students don't come back, there is no elimination of risk. COVID is here. The students are not bringing COVID back. And we are at risk going out and about right now if we don't practice those sensible precautions.
When do you think you would see that surge? So students come back in, I think August 24th is the first day of school. So students will probably come back to town that week before. When would you expect to see the surge in cases due to just the increase in population in Montgomery County? 2 weeks, 4 weeks?
Within 2 to 4 weeks, we will definitely see an increase. Will it be a huge surge? I'm not convinced it will be a huge surge.
We don't know.
I think that, the students are coming back knowing that there are expectations. And again, if they're hanging out together and we keep them together, we are going to mitigate a lot of the risk to the greater community. And that's the whole goal here. I mean, we can't stay shut down until we have herd immunity, looking for 60 to 70%. We can't stay shut down until we have a vaccine because that's, at least 6, 8, 10, even more months away. So we've got to deal with COVID. And we have to accept that there is going to be community transmission. There's going to be some sustained community transmission. The goal from the get-go was to prevent the transmission from overwhelming our healthcare systems. That's the biggest goal. We want to make sure that our healthcare systems can take care of who they need to take care of with COVID and those without COVID, those who are having heart attacks and strokes and all the other things not associated with COVID. And we're in constant communication with them. And we've done a very good job of that, keeping our healthcare systems solid and keeping them to where they can function. Again, that's our biggest goal. So we look at where the students are going to intersect with our higher risk communities and where the students are going to intersect with our healthcare system. And we already have the messaging and the planning in place. And I mean, I agree to some extent, the students are going to be students, but I think there's enough word out there and they know that their college experience depends on this right now, that they're going to have some behavioral change. So we need to have that understanding, that mutual understanding. Yes, you can socialize, but no, we can't have you getting drunk to where you end up in the jail and infecting our jail, or where you end up in the hospital and you could potentially infect people in the hospital. We have to watch when you're going into the stores, going into the restaurants, those kinds of things. And that's a big messaging.
I'm sorry.
I mean, I think it's a big messaging thing, but I think given where we are, people understand that they're going to have to put forth the effort. And they know that it's in their hands. They know it's in their hands. And I will say, our dealing with the students all summer has been very, very positive, a very positive experience. Have they all adhered to total restrictions and total physical distancing and everything? No. But again, they're in their social cluster and it stays within their social cluster. I haven't had them going out and causing problems. There will be an increase in cases. I think, with our messaging, with working with the university, we'll be able to manage that and keep it controlled. And they're going to have the same options you do to kind of flex, to go online versus in person, to go, and if the students are told to quarantine or isolate, they've been doing that for us. And more students in town, there will be more of them that potentially have to quarantine or isolate. I can't speak for all of them, but for the most part, they've been very cooperative with us. So, I think we have to give them a chance. I really think we have to give them a chance. And if it's not working, then we have to put the brakes on really hard. But my sense in talking to the students is they want to get back. They want to get back to, they realize that they're not going to have the same college experience that they signed up for a couple of years ago, but they want to get back to it. And I think, we have to be really careful about this perception that they're just going to be all of our problem. I don't want that to be the perception. I want to welcome them back. I want the students to feel like we welcome them back. I want the students to feel that they're part of this community and that they have responsibility just like our community members have responsibility, and we'll hold them to it. And we have a great partnership with our law enforcement. We have a good partnership with the school. We have a good partnership with the local businesses, and we all have to work together to hold them accountable with those simple things.
I'm gonna.
And I'll
I
just-
have other things, but I know there's other people.
Can I just add that is part of that too, and this is a huge project, a social kind of switch of climate. But in our toolbox, we have all of our apartment complexes. They're going to get messaging from them. We have student affairs involved. Brenda's part of our PIO group. That is not just schools. It is all of our government PIOs. It's Virginia Tech. It's Radford University. It's NRCC. The real messaging campaign, which you'll see come out, we'll probably buy 100,000 masks in the next 2 weeks to put out with our logo on it that says it's going to be a personal responsibility campaign. I mask for you because I don't know who you are and I don't know what you have. I mask because it's the right thing to do. It's not what the governor said. It's not what the cops are saying. It's what I mask to protect my brothers and sisters in this community. And we're going to hammer them with it. And then we're going to use their lifestyle differences, which are like every college town in America, they live differently. And we're going to take advantage of that. We're going to shop in the morning for high risk. We're going to do things to avoid student contact. Dr. Bissell's built a really robust plan to protect our mental health facilities, our jails, our hospitals. And now we're hoping to do the same. I've seen a great plan come out of the school system. The same thing. You're a critical piece of infrastructure as anything we have. And so it's going to be vital that we can protect that as well. We talk to the CEOs of our hospital system every day. We've got our foot on that gas pedal. We're still under emergency declaration. So if we need to hit the brakes, we're going to do it, but we're going to do it as an entire region. We're going to slow down. If we see our hospital system start to become overwhelmed, we have indicators in place that are going to show us that we need to slow down. And that may be social outlets, it may be restaurants. We don't know what it'll be, but we'll be doing it together. We'll be messaging you guys immediately if we sense that the health system is getting stressed. So I know it's a scary time, but we've really had 15,000 of them come back after spring break, and they behaved miraculously well from my perspective. And I deal with them day in, day out. And they did really fantastically well trying to manipulate life in this new world. And that's what they're going to get hit with as soon as they come back. Between now and November, it's life in a brand new world. It's going to be completely different. And we're going to use every tool in our toolbox to make sure it stays there.
So Dr. Bissell, if now might be a good time to go ahead and talk about your recommendation for us starting on the 13th with our 50% capacity plan with children.
Do I support that? Yes.
I know. Can you give some more explanation about the transmission from children to adults and children to children, and what you as a task force are going to do, let's say if we have an outbreak at a school?
So transmission from children to children, children to adults, you're asking, okay. There was just a big study that came out of South Korea that younger children, the transmission is a lot less. Older children are more like adults, and the transmission is more like adults. Again, there will be cases in the schools.
Sure.
There absolutely will be cases in the schools. Our goal in the schools is to protect the most vulnerable population, to protect our faculty members, our students who may have issues, our custodial staff, our bus drivers, and keep them protected. Again, this virus doesn't just jump out at people.
Right.
So if we do effective distancing, if we do hand washing and hand sanitizing, if we do masking, then the transmission is really, really cut down significantly. The cases that we're seeing, the big outbreaks we're seeing, are in situations where those things weren't adhered to. There were people were together in parties. There were people were together sharing drinks, sharing meals, sharing things on top of each other. So I think your plan to space the students out, to have hand washing, to have hand sanitizers, to have the masking availability is going to cut things way down. I think your risk is going to cut down. If you get a case in a school, we'll treat it just like any other case. We'll start with that case and we'll do the contact tracing. And again, what we will find is that most contacts are not true contacts. I mean, if you're spacing people out by 6 feet, then you're already at that distance. So most people are not going to be a true contact. The biggest challenge will definitely be dealing with the panic that surrounds an outbreak or cases in a school. And, you know, we'll work through our PIO group, we'll work with our EPI team, we'll do the investigations, we'll get the appropriate people quarantined, isolated, and make recommendations for further testing. We have the testing capability, we have decent turnaround time. So our investigations actually progress very well. And I feel like we're able to really mitigate the further, you know, transmission of the disease and contain it pretty quickly. So if you have a case in the school, that doesn't mean you have to shut the school down. Certainly doesn't mean you have to shut the whole district down. You know, multiple cases also doesn't mean that. You know, we take each individual situation and we evaluate it and we look at the exposure risk. And then we go from there and we would work with you all. We would work with the school principal. We would work with the teachers. We'd work with the parents. We'd work with the school board and the school administration. You know, what does this look like and where do we need to go from here?
Right.
And your plan seems to have a pretty good online, a virtual in-person component that you can flex back and forth.
Right.
So, you know, if we need to kind of put the brakes on and say, okay, we're going to go virtual for a while, then we can do that.
Right. So you don't see any concerns with us returning with our students on the 13th?
Not at all. My daughter goes to Montgomery County and she will be on that bus and she will be in school.
Awesome.
She will absolutely be in school.
And just a note, I think Miss Cass was going to say something about the testing, not overwhelming the testing we already have. But I understand from Chief Wilson that Virginia Tech and Radford University are using third-party testing labs, correct?
So Radford University is contracting. Virginia Tech will be using Fralin, but Fralin is going to be at a capacity of 1,000 tests a day. They're working up and they're very close to that right now. And they have committed to us. Fralin, we've had a great partnership with them. They have exclusively done our testing for about a month now, 6 weeks. They have committed to me that our community and investigation testing is a priority. So what you read about Virginia Tech's plans to test their students, our community and investigation is prioritized over that testing. And so I'm confident that at 1,000 tests a day, that we'll be able to handle what we're doing. Because the reality is if we get to that point, then we will be putting the brakes on. And people will go virtual and we'll probably be going back.
Sure. Thank you very much.
Any other questions before
I don't
say
know that I
Mr.
have a
Shabaka?
question. I just have a kind of a statement. I just want to thank you for saying everything that you said, because I'm a person that tends to agree with your thoughts. And I work in a profession that I touch people every day and have been since we came back to work when the governor had closed us. And I get to talk. I'm blessed that I get to talk to a lot of parents and a lot of students every day. And even in the high school and young levels, they're wanting to go back too. And that's what I hear. And my daughter is an ACES graduate and going to Tech in the fall. And she's excited but nervous because some of her classes online weren't so easy. And if it weren't for her perseverance, she would not have graduated as high as she had, because not everybody has a good online experience. So being able to at least try and have you guys give that a thumbs up is great news for me, because I hear a lot of students, I want to go back. I want to go back.
I think, we tend to look at this through a very narrow COVID lens, and there are a lot of unintended consequences from where we are right now. And we still see that. We still see the isolation, the anxiety, the depression. I saw it in my own daughter, and I think my daughter's pretty well adjusted, but she really had a hard time. We see suicide attempts and suicide completions are up. Overdoses are up. Substance use is up. Teen pregnancies are up.
Exactly.
Sexually transmitted diseases are up. There are a lot of unintended consequences. And I'll tell you, every snow day, I worry about the kids that are staying home alone that shouldn't be because the parents have to work. I worry about the kids that are food insecure and don't have that access every snow day. And when we're talking snow days, we're talking a couple snow days, maybe a week. Here, we've been talking weeks and months. The other thing, I'll be very honest, schools are our big reporters for child abuse and child molestation. And I am very concerned about what's been happening, because if you talk to, in fact, I know, a juvenile domestic relations court judge, and she said, of course, cases are way down because they're not being reported. That doesn't mean they went away.
That's right.
I am
In
very
fact, they're
concerned.
probably worse.
I am very concerned
And I agree with you 100%.
about those long-term effects
Thank
of
you for
that.
saying
So
all of that.
I think, we need to give it a try. We need to trust that we can do this and we can scale it. You guys have made a good plan that I think we can scale it and we can work together. We have a very unique situation in this community where everyone comes together. It doesn't matter if it's Blacksburg or Christiansburg or Pulaski or Giles. Everyone comes together. And I think if we all stay together, this community has shown resilience and resolve through a lot worse things, and they've done very well. My biggest advice is to keep it local, to stop worrying about the state, to stop worrying about the national. Let's keep it local.
Thank you.
Because I think we've done a really good job locally, and I think we need to give it a chance.
Dr. Bissell, it's clear you have your own opinion on this. This is not a recommendation. You're basically saying we should go back. I'd like to ask you a few more questions. First of all, you said that there will be cases in the school. About how many cases do you think there's going to be?
I have no idea.
Just an estimate.
I mean, no idea.
No
I don't
idea
know.
at all.
No.
2, 10, 20, 50?
You could easily have several cases a week.
Okay. If I'm a
Easily.
child and I go to school and I give my teacher COVID and my teacher gets really sick and ends up in the hospital, maybe dies, do you think that would have a profound effect on a student as much as being isolated at home? Do you think when let me finish because you did say quite a bit. Do you think that students, when they go back to school, aren't going to be somewhat anxious or nervous about the whole idea of being in a school with other students, or when people are feeling anxious and wearing masks? I guess my point is that I realize that, yes, being home is difficult, and the isolation, and I've read all the articles about what that means. But I think there's also articles that talk about the fear that's instilled in students and teachers. And you called it panic. I don't think people are panicking. I'm actually not, I'm generally pretty much a risk taker, but I think in this case, I don't want to take a risk with not even one student's life. I do not want to be responsible for one student in my school district getting sick and dying, or a parent or anybody related to them. And I think that's what we're talking about here. And I hear what you're saying about going back and it's minimal risk and it wouldn't be so many people. And it's only going to be a small amount of cases. But in my mind, any case is too many. And to me, the only way to avoid having those cases is keeping students home for a while. And I'm not saying permanently, I'm not saying to the end of this school year. But I think what we need to do is keep students home until everybody gets settled where they need to be settled. We see what the surge might be in cases, and then consider bringing them back. But I think just throwing everybody back into school on August 3rd and saying, oh yeah, we feel real good about this. This is great. Until that first case happens and the first serious case happens, and then everybody will be like, oh my gosh, that was a bad idea.
So the plans you have in place protect your teachers very well. You have a distancing model in place. You have face masking. You have face shields as an option. There's hand washing. There's hand sanitizer. And I agree with you, absolutely agree with you. We don't ever want to see a death. But the reality is every year we see deaths from everything in our teachers, in our students, in our family members, whether it's flu, whether it's meningitis, whether it's hepatitis, whether it's the Kawasaki type disease that they're talking about with the multi-inflammatory system disease in children. We will see that. But the numbers do not show, I mean, the numbers coming out of the modeling from Stanford University and very well-respected epidemiologist, for somebody under the age of 70, the death rate is 0.01%, not 0.1% or 1%, 0.01%. Everything we do every day, there is a risk. Getting in the car and driving someplace, there is a risk. And I understand you. And I do think there is a certain amount of panic with the fear. And I think it's driven by the media. And I think it's driven by social media. And I think we need to have some balance and some perspective. Do I have a crystal ball? No, I don't. Will we see cases? Yes, we will. By and large, those people will do just fine and recover just fine. And life will go on. Will there be people who don't? Yes. But there are people every year who don't. We see people die, young people die every year of meningitis. And that's transmitted in schools. We see people die every year of flu, and that's transmitted in schools. Hepatitis, all of those things, pertussis. This is another infectious disease. It is preventable if we take the appropriate precautions. And the plan you've laid out for this is far more elaborate than for any other infectious disease that they get every year.
Mr. Chabaka, do you have questions?
Yeah, thanks. I do have several, I guess, starting at the high level. Dr. Bissell, I'm sorry I'm not there to meet you in person, but thank you for being here.
Can you speak as loud as you can? Thank you.
Okay, are you having trouble hearing me?
Yes.
So my first question has to do with, when you make and I don't know if it's a recommendation that you're making as much as you are in approval maybe of our recommendation to go up to 50% in person. When you make a recommendation like that, or when you down the road, heaven forbid that our cases spike and we have to shut down a building, or we have to, shut down the whole school system or whatever, do you have, what are your metrics for that? Do you have caseload? Is it an absolute number? Is it rates or rates of increase or decrease? Can you give us a kind of a high level assessment of how that happened? I'm trying to understand, how you get to the risk assessment on this.
So first of all, I can't approve your plan. I can make recommendations as to where it is consistent with the CDC plan and with the VDH plan, which is essentially the CDC plan, and the governor's Forward Virginia plan. I can make those recommendations, and then you submit your plan, and you submit any variances to that plan. As far as the metrics where we would slow it down, we're going to look at the transmission. It's not going to be a hard number of cases. We're going to look at the transmission. If we have one case and we end up with 30 contacts from that case, then that's going to be a situation where we say, whoa, something happened in this situation. We really need to put the brakes on. If we have scattered cases, if you have 20 scattered cases in a school, then you look at where those cases were and what their path was, and you're going to make a decision based on how those cases connect, what we call an epi-link. And then you will look at the rate, you will look at the rise in cases. There's no magic formula to it. And, again, just like with flu, when we talk about should we shut the schools down for flu, there are a lot of things that will come into factor in making that decision. Some of it is perception. Sometimes we end up shutting the schools down just because parents on social media say, I'm not sending my kid to school. You know, there's a huge outbreak there, and absenteeism skyrockets more out of you know, the perception that it's just totally out of control. And the best thing to do in that case is to just shut it down, give it some time, and then people come back. We'll also look at, you know, what the school is, what the resources are, and where we can go from there. So it's going to be each individual investigation. It's going to be the EPI links. It's going to be the contact tracing. It's going to be the rate of increase, and ultimately the numbers, but it'll definitely be those other things first.
Okay, thanks. And then I'll ask one more question and let other people, I guess, get in with their questions. But can you talk to me a little? I was happy to hear you reference that study out of South Korea, because I think that there's a lot of people in my constituency anyway that are reading these studies that come out, and that certainly helps to inform the community in one way, right? But can you talk a little bit about viral load as it relates to aerosols and droplets? Because we were having a discussion about this earlier. This is, I think, a part of the science that starts to get a little bit technical. It's not necessarily easy to just give one statement, stay 6 feet away and you're done. I'm especially concerned about when we send, from everything I've read, the idea of being indoors in circulated air, which apparently maybe a lot of our buildings may fit that bill, is kind of the prime breeding ground for a respiratory virus like this. And, I know at Virginia Tech, we have Dr. Lindsay Marr as an expert in aerosol virus transmission and things like that. I trust maybe that you've at least read her work, if not maybe even collaborating with her. Can you tell us anything about what the increased risk of being indoors with recirculated air, in these environments for the virus transmission?
So indoors is definitely going to be riskier than outdoors for sure. If you have to recirculate air, it is worse than bringing fresh air in. It depends on the size of the room. How high are your ceilings? How big is your room? Obviously, a much bigger room allows viral dispersion a lot better than a smaller room. If you're looking at, when you talk about these viruses, you're talking about the size of them and how heavy they are and how long they remain suspended in air versus dropping to the ground. And that's really what it comes down to when you're talking about whether something is truly airborne in the sense of a TB or chickenpox or measles. COVID is not at that point. If you look at the infectivity from one case to another, you're talking measles and things, the numbers are 18 or more. For COVID, you're talking maybe 2 to 3. So there's a big difference there. What we really look at is, yes, just by breathing, when you exhale, there are droplets. Obviously, someone who's not symptomatic, it would make sense that they probably have a lower viral load than someone who is symptomatic. And there are some studies that have come out, and there's a big difference between asymptomatic and pre-symptomatic. And people get those confused a lot, and that was a lot of the controversy. People who are totally asymptomatic, that they never show symptoms from this disease, have lower viral loads than people who are pre-symptomatic. We know people who are pre-symptomatic who will go on to develop symptoms are most infectious 0.6 days before they actually develop symptoms. But that's not asymptomatic, that's pre-symptomatic. That's when their viral load is higher. And we know when they're symptomatic, their viral load is higher. So it makes sense, it's intuitive that they would have a higher viral load and be more infectious. In the context of the droplets, just by exhaling or speaking with COVID, you're looking at probably about 3 feet. And that would be indoors as well as outdoors. So that's why they actually, usually in public health, we use 3 feet distancing. This is the first time we've gone to 6 feet. And the reason they do that is because with normal conversation and normal breathing, you're looking at probably about 3 feet. So if you're 6 feet out, those droplets are heavy enough that they should fall to the ground, and the transmission is going to go way down if you're 6 feet apart. I mean, you can never say never. You're never going to say there's no transmission, but it goes down significantly. coughing or sneezing or singing definitely increases the transmission. And that's where we have to work on. People who are sick need to stay home. So if they're coughing or sneezing a lot and they're sick, they need to stay home. We need to work on respiratory etiquette, that if they're going to cough or sneeze, they do it into their arm or they do it into a tissue. That breaks that transmission significantly, so you're not doing more than the 6 feet. The other thing is masking. If somebody has a mask on, then that decreases the risk that a cough or a sneeze is going to project those particles more than 6 feet. So if you're maintaining your distancing, your chances of projecting that, that virus getting projected that far goes way down, even indoors. It's much less even outdoors. I mean, if you can do more stuff outside, that's great, but we all know that's not totally realistic.
Okay, thanks. So as far as, I guess, there's probably not enough science to really know to what degree, we know that if you stood there and talked to somebody without masks who had the virus, that would be a contact and you're at risk. I don't know where we are in the science on the aerosol component. I do know, one of the early studies that came out, I think it was Aaron Bromage that wrote that article. I think it was based on the contact tracing that they had in South Korea. They had people in a restaurant. I think this was before people were wearing masks, perhaps. And people 15, 20 feet away in different parts of the restaurant were getting sick because of that recirculated air. And now with the mask use, I don't know if you've heard or if you have a guess or an idea of how much that reduces the risk, especially if you have an enclosed, say, room the size of a classroom with 15 or 20 people in it, and the air isn't recirculated maybe very frequently.
So there are.
Do you have a?
I will say there is a good study that actually was in a salon between two people who do hair, and the transmission was between them because they weren't wearing masks, but there was not a single case of transmission from either who ended up being positive. So they ended up being positive. They wore masks and their clients wore masks, and there wasn't a single case of transmission to a client. It was between the two individuals, and it was when they were not wearing masks.
Yeah, and that's good to hear. I think everything that I've read has to also do with the time, right, of contact in that space, and as far as getting your hair cut versus spending 3 or 4 hours in a building. That's where I become concerned. I mean, obviously you're not concerned. You said you're sending your daughter, but I just, I know you understand this stuff, and I'm just trying to get you're far more up on the science than I am, perhaps, and I just want to kind of get your take on that concern or that piece of it.
It is definitely distance and time. So if you space out the more than 6 feet, that reduces your risk considerably. If you wear masks, it reduces your risk considerably. So you're right. I mean, the time factor is in there if they're going to be in a classroom for any prolonged period of time, but you've mitigated those other two factors significantly. And again, we're talking, a lot of these studies are done with individuals who are known to be COVID positive. In your classroom, a substantial number of those people are not going to be COVID positive. Your numbers aren't going to be as high as taking all. It's not that everyone's going to be COVID positive. And this is going to rely on, I know a lot of parents tend to want to send their kids to school when they're sick, when they're not feeling well. This is going to rely on, but again, the parents need to buy into this, because the parents who want their kids back in school, they'll shut it down real fast if they try and slip one by and send kids to school sick and we have a big outbreak. So the parents need to do their part here. And if the kids are sick, or if they've been exposed to someone who's sick, they need to keep them home. If we did those simple things, if we stayed home when we were sick, if we washed our hands, we have studies that we wash our hands 20% of the time that we should. And we have studies that if we wash our hands 5 times a day, we will cut infection rates by 40%. If we wash our hands 10 times a day, we will cut infection rates by 60%. So stay home when you're sick, wash your hands, really discourage touching the face, and just the respiratory etiquette. Cough into your sleeve or cough into your hands and then wash your hands. that will cut transmission substantially of any of these, whether it's COVID, whether it's flu, whether it's pertussis, any of these illnesses.
Thank you.
Thank you. I'll hold off on my other questions, I guess, and give other people a chance.
Board members, any other questions?
Okay, so, I hear you, and I've learned a whole lot about COVID and tracing and contact and stuff over the last few months. So, but we still have the same issue that you're talking about. Folks need to stay home if they're sick. They need to keep their children home if they're sick. One of the biggest components of what's happening with this is childcare. And it's childcare. And even under normal conditions, folks go to work sick because they have to. They send their children, or children are left at home alone, sick. So none of that has changed except for we have a pandemic that folks are scared to death of. For me, the thought of sending kids back to school is a good thing because many kids need to have that. But sending kids back to school on the 13th of August, when folks have not been educated enough about how this spreads, how they have to contain it, to actually believe that there is a risk and that this is not just going to go away someday. That's a huge piece of this. And folks are not there yet. They are not. So they're not going to send their children to school. Our teachers are not going to come to school because they're scared. They are scared to death of what's going to happen. So with everything that you said and everything that we're putting in place, until, and I can't say this enough because I've just been living with it, until folks are better educated about how this is contracted, the distance, the time, the conditions in which you do have a true exposure, it's not going to go well. And that piece is still missing for me because I live with it every day. So for me, sending kids back to school on August the 3rd is just not something that I'm going to be willing to vote to do.
So, I mean, we've had a lot of campaigns about transmission. What more can we do, I guess is my question.
Okay, so for me, I don't know that I've ever seen any of your campaigns about transmission. Where are they publicized? Where are they at?
So VDH has been putting things out.
I'm sorry.
VDH from Richmond. They've put a lot of stuff out. It's on TV, it's on the radio. I've done things on TV, on the radio. I did podcasts, which are on the Montgomery County website.
The town halls.
The town halls that we had, a whole series of the 6 town halls. We are getting ready to do even more kind of podcasts and blogs and things with our media folks. We do a lot of education through our call center. So, I mean, we in our call center have fielded several thousand calls. I don't know exactly how many. I'd have to ask exactly how many. But every time someone calls our call center, it's not just, okay, we'll test you or we'll not test you. We'll talk to them about their concerns. We'll talk about them about what their potential exposure was, what their fear was. And so in the very beginning, we had to do a lot of that because we didn't have testing to offer. So 90% of the people that called us in the beginning, we had to kind of try and calm and allay their concerns and their fears and talk about, what they can do to protect themselves and protect their families. So I do feel like there's been a campaign there. As I said, I'm certainly happy to meet with teachers. I'm certainly happy to meet with parents, do anything virtually to start getting that message across.
So is there printed material things that are posted that very simply lay out 6 feet, 15 minutes, no mask, less than 6 feet.
We can
that-
certainly create that if there's not. I honestly
I'm-
don't know
I'm
if we
telling
have
you,
print
that
material.
would be huge for folks to be able to see that visual when they are walking around and get that into their thought process as to this is how this works. Because not everybody is listening to podcasts. They're not paying attention to the news. They are listening to social media. They are listening to, quite frankly, our president give a whole lot of
I know.
nonsense about what's happening with this. And then when something happens, they don't know if they believe they've been exposed. And in 99% of the cases, that is not the case.
All right.
But because the information is not being given in a way that most people are going to digest it, they're not getting it. I'm
Can I?
I'm
Yeah.
telling you.
Ms. Franklin, that's something that, Mr. Drake and I can work on. I mean, we know how to get information to our families and to our students, and we have multiple ways that we can do that. And I think we've been pretty effective and shown that in the past 3 or 4 months, the information we've gotten to our families. And I think we could start a campaign, right now with the help of Dr. Bissell and the task force, whether it's posters on every school wall, I mean, Twitter, Facebook. I mean, we've done pretty well. If we want to get information out, we've gotten it out, and so.
If I may.
And it's, we actually have those handouts and have 2 graduate PhD students who dropped their research to help us do a huge bilingual campaign that's going out to every construction site. And it's very simplistic. It's in Spanish, English, et cetera. So that saturation campaign, that's already being done, started. But I think you're right. We just need to get it in your hands for your plan. We need to get it on piece.
Jar.
And if I may, Dr. Meyer, I'm also part of the regional PIO group, and we're working on a comprehensive plan right now that really is a regional plan with some simple messaging. I'll take your suggestions to the group and we'll incorporate them, not just in what the schools are doing, but make sure that other people are benefiting from the feedback that you're providing to us. So I'll take those suggestions to our next meeting.
Yeah.
Maybe we
I
can
mean,
issue
every
face masks.
business, every factory, every whatever needs to have
The rules
this
are-
information to go out to their folks. It needs to be on posters that they can put up, very simple pictures that, just like I said, 6 feet, mask, less than 15 minutes, or 30 minutes if you're 6 feet, right? But if you're within this and this is a situation, it's an exposure, right?
We could actually issue masked all students with those right on their masks, since they got to wear them every day, everywhere we go. I mean,
But-
that'd be a constant reminder just in that. I mean, it's.
I have to say, every business has to list that anyway. I mean, that's part of the reopening, all of them. It's on their door. It's on our porch. It's on every door. And with every business, they have to post it. That's in order for them to stay open. Am I correct by thinking that?
Yeah.
Yeah, I mean, it's a guideline. It's a rule. You have to.
You have to have everything posted
That's
about
right.
the masking and the, yeah.
Right, posted that you have to have a mask. And
Yes,
right,
everything, 6
but
foot.
but folks don't understand that just because I have a mask on, I'm 6 feet away. I have people who will be on one end of the plant.
Right.
And there's a possible case on the other end of the plant, and they're scared to death and want to leave work and quarantine because they don't understand that's not exposure.
Right, I understand, but I was talking to the piece when you said every business should have that information. I was just meaning that they do have it.
No, the information about what is an actual exposure.
Right. She's
How we
talking the
get
time.
exposed,
You
yeah.
have the
Not
6
just the
feet and you
mask.
have the mask, and she's talking the 6 feet, 15 minutes,
Gotcha.
not wearing a mask is really what we look at as an exposure.
And the tracing, break that down easy so folks understand. Because I've had situations where somehow or another folks have gotten left out of the exposure, and then they come to me later and explain, yeah, And the company was told, but they sent all these people home, but they didn't send me and this person home. And when it's brought to their attention, they send them out of the building, but it's 2-3 days later, or in one case, not at all, because no one said anything or no one took the person serious. I'm telling you, these are the kinds of things that happen.
So somebody brought up about a potential exposure.
Yes,
Did they talk to the health department?
this is through the company, right? So, whatever they did, and that's when I started having conversations. I had one with yourself and
Right.
folks in your department to understand more about what exposures are and how the tracing and everything is done. So I'm just telling you, we may do everything right in the schools, but what's going on around and then comes back into the schools, that's where there's going to be a problem because folks don't understand what's going on. And folks are not taking tracing on their own seriously. So if there's a potential before you have a positive, it's not being handled in the ways that it should. So I'm just telling you, those are the kinds of things that scare me about opening the schools because there's some issues that we have as far as folks understanding what they need to do when they need to do it.
Mm-hmm. Well, we can certainly work with Brenda and Dr. Meyer, and you already have a great network to get word out. So we can get infographics out, we can explain things, we can do the FAQs. We can
Right.
put the 6 feet, 15 minutes. I mean, I honestly don't know if we have an infographic of that.
Right.
But we
And
can
that's
definitely put
something
6
that's
feet,
really
15
neat.
minutes, not masked is what a contact is. And there's actually some really good stuff coming out now when we go to a lot of these younger folks. And there's actually some really good information that if they don't know the name of their contacts, they probably weren't a close contact. And it's panning out with the data. It's panning out that you test all these people that were around them and they're negative. It's the people that they specifically named. Yeah, I was close contact with Jimmy, or I shared my drink with Sally, or I did this. And those are the folks that turn up to be the true contacts who then were positive and were exposed. You test everyone else that was around them, and then they're all negative. So there is some good epidemiologic experience to support that as well.
I know we took so much of your time. I appreciate that, but I'm going to wrap it up with my little question. My question is the timing. I know we never had both Radford and Virginia Tech students on campus with all our students on school campuses too. So opening 13 versus waiting for all that settled, that Radford comes on the day before we open, and then Virginia Tech comes on the 24th, and let's say 2 weeks after. So I guess I know none of us have magical ball, and we will not know what will happen, how the numbers will go or not go. But do you see any wisdom opening on the 13 versus waiting till Labor Day? Whether we'll do in between remote learning or just not open and start after Labor Day like some school divisions doing?
So I guess is the concern that your students are going to be in
Or-
association with the college
My
kids?
my concern is for I know we did a great plan and I know you do a great job, but we never had this, we never practiced this, what will happen with all the colleges in town and we are in school before. So would it be better for you to deal with whatever those college students bringing, whether numbers going up or down, and then, we open them after Labor Day?
I think, to be honest, it's kicking the can down the road, so to speak. I'm not sure what the benefit would be.
The system will see what kind of a case going up between
Cases will
now
go
and-
up. Yeah,
now and-
cases will
yeah.
go up. I think, we have to acknowledge that cases will go up.
But if we don't open the schools, cases will go up, not within our schools. You see what I'm saying, where I'm coming from? Then we'll stay still out of the whatever is happening. And
But
then
we
we'll
may
stay.
not be affected at all.
Right.
And then 2
we
weeks
don't have
later-
a magic ball. I'm just asking,
But then
So-
just general
we bring them
wisdom.
back, that it's just going to happen 2 weeks later.
Yeah.
Yeah, I mean, it'll happen when we bring them back, right? I mean, my best guess would be 2 to 4 weeks. When Virginia Tech comes back, we'll start to see cases and outbreaks. Same thing with Radford, 2 to 4 weeks. I will tell you that we've done kind of mini experiments right now. Both universities have a significant number of athletes on campus, a significant number. Not in the thousands, but definitely in the hundreds. We have positive cases amongst the athletes. We're not having major outbreaks. The athletes are doing what they're supposed to do. Everything is handling very well. We haven't made national news that 46 of our football players have COVID or anything like that. It's gone very well.
I mean, I might be thinking wrong, but to me, probability will be more when there is so many thousands of students in town if we open the schools at the same time versus, I might be wrong, versus, whatever the wave comes with initial, because those kids are coming from different states. And some states we know doing, so bad. Let's see some of them brought with them, not necessarily they had it after they come back. So those numbers going to show up initially. I'm guessing. And, if the schools are not open, we are just avoiding that. Not necessarily we are not going to have anything after, Labor Day, there's no guarantee. But is it safer, so to speak? Or
I
it will
don't think
make a
so.
difference
No,
or
I don't.
not?
It's not going to be safer. You're going to have cases.
Yeah.
We're going to have 100 people to be managing our cases in the area. And again, these cases are not, people get really worried because of somebody walking through a room and then you have 50 people panicking that they've been exposed to COVID. We shut that down pretty quickly and we say, okay, you had 3 true contacts. We contact those people. So we get that controlled very quickly. I don't see, unless you're concerned about just because we have more people using the stores and whatnot, I don't see that there's going to be a lot of interaction between our college kids and our school children.
Interaction going to be through the teachers and through the parents, obviously, not necessarily the students themselves probably, but the adults will be interacting more with a little larger crowd at that particular time.
And it is going to depend on the adults being responsible and doing the right thing. And, the hand washing, the staying home when sick. Everybody has to buy into
their
this
part,
and be responsible.
Yeah.
And,
Yeah, absolutely.
if you put it off till after Labor Day, it'll be 2 to 4 weeks after Labor Day. I would definitely not recommend putting it off too long because then we'll get into flu season and that will start to confuse things a lot. I'd rather get a head start on it before flu hits us and see where we are. Because once flu hits us, it's going to make things a lot harder to distinguish. And I don't see that we're all of a sudden going to miraculously have enough testing that we can test everyone who wants, needs, or has to be tested once we have flu. And then the other thing is, that's where you really start wondering about, are we going to strain our healthcare resources if people are being admitted to the hospital for flu and COVID? So earlier to me is probably better at this point. Let's kind of deal with COVID now and get a handle on it and see where we are. And then we'll be rolling into flu season, hopefully in a better place.
So,
Good point.
I'm sorry.
And hopefully all these precautions will keep flu down as well. Again, I think all of these precautions will keep flu down as well. So and hopefully more people will be getting vaccinated for flu. We are doing a very aggressive flu vaccine campaign and we'll be out and about in the district. We've ordered a lot more than we normally distribute, hoping that we'll get more people vaccinated.
I appreciate
I'll make
that.
sure I
Thank you.
understand. So basically, we're going to send the students back to school on August 13th. They're going to get COVID. Some of them are. It's inevitable. But we don't want to keep them home learning virtually too long because once they go back in September, then it's going to be flu season. And then we're not going to be able to tell the difference between COVID and the flu, and the hospitals are going to be starting to get full. And so now you're making me wonder, why are we even going to open up at all? It just sounds like, I'm trying to understand why it makes sense to rush students back into school for them to get sick, because you're saying they're going to get it. So we're going to rush them back so we can get them sick, so we can just start taking care of it. And you and I'm sorry, Officer Wilson, Chief Wilson, had mentioned something about, getting Blacksburg's economy moving or getting business moving. I mean, I'm trying to understand why students going back to school, how that gets business moving. And to me, I care more about keeping our children safe than I know business has to get moving, and the whole country knows that. I'm just having such a hard time understanding the logic of putting our kids on the firing line. I mean, we're basically sending them out there to get sick when we know if we keep them home, they'll be safe.
We don't know that.
That's not
Your
true.
kids are not
don't know
living,
for
your
sure.
kids are not living in a bubble. The
They're not
kids are
living in a
out and
bubble.
about right
But we
now.
know
The
that
kids
putting-
are at
Like,
risk of getting COVID everywhere they go right now. They're at risk of getting COVID. It is here. We need to deal with COVID. So if we look at your logic, then we may as well cancel the whole school year and wait until maybe next spring
I
when
didn't
we're
say
over
cancel.
COVID.
There's a difference between canceling school and teaching remotely. Nobody's saying, I don't think anybody in here is suggesting canceling.
But I
school.
think we all would agree that remote instruction does not compare to in-person instruction.
I don't think, well, I was a teacher, and so I probably feel a little more knowledgeable about this. That I think that remote instruction done well, with more time to prepare, with the technological ability we have, I think, is it perfect? No. Do we want to get kids back in school? Absolutely. Do teachers want to be with children? Absolutely. But I think that doing that prematurely, and so I think I'm going to disagree with you that it doesn't work by teaching them remotely. I don't think that's necessarily.
Ms.
Yeah.
Cass, I
Doc-
think
Dr.
you're being
Bissell, can I
very
have-
disrespectful
Can
to
I
Dr.
ask a
Bissell.
question? With contact tracing, if a student were to contract
Come on,
COVID
Carl.
in a classroom,
Mhm.
would it be necessary to do contact tracing of all the students in that classroom? Or would you not do that because they were possibly not exposed because of the mitigation strategies we put into place?
We would start with the case and we
Okay.
would get the teacher involved and we would ask the student and we would talk to the school administration. Where has that student been? Who have they been in contact with? Who have they been less than 6 feet for more than 15 minutes? It always starts with the case. It doesn't start with the whole class. So
Right.
no, not every student in that class is going to be a contact with the plan you all have laid out. It's just not, because you've got enough distancing. You're at a much reduced capacity. They're going to be wearing masks. So the contact from that student, and again, we don't even know that student got it in school. That student more than likely brought it into school from someplace else.
Mhm.
So we have to look at that as well. But I understand that the State Board of Education recommends notifications. So when we have cases in the schools, you would notify appropriately. We would start with the case and we would make everyone aware. If your child is considered a close contact, you will be contacted by the health department. If you are not contacted by the health department, your child is not considered a close contact.
Okay.
That's good, yeah.
Great. Good to know.
That
Thank
was
you.
Another question earlier we were discussing in
Mhm.
terms of how we can announce, whether we have a case or, whether that. yeah,
So to be
that was good,
honest,
yeah.
our preference would be to not necessarily do a wide notification, but I do know that social media is going to
Yeah.
take over and it
Yeah,
will be
they will
out. And I
be
do know that
discovered,
the
yeah.
State Board of Education recommends notification. So
Work
our
together.
suggestion is you put out the minimum possible
Mhm.
and then you notify according to what the Board of Education recommends, which I
Yeah.
think is that school.
Yeah.
So if there's a case in a school, the faculty, staff, parents,
Should know, yeah.
they're all notified.
Yeah.
But then I think you start with that case and parents and everyone, faculty, everyone needs to know that the health department will contact you if it is felt that you had a true exposure. Otherwise, you won't be contacted. And again, a true exposure is less than 6 feet, more than 15 minutes, not wearing any kind of mask or facial protection.
Which would be, we talked about earlier, the correspondence that would go out. That would probably be part of our messaging that goes out. If we were to have
Right.
to send it to an entire school, we would use the language, you will be contacted by the health department if
Mhm.
you were thought to have been in
Yeah,
contact.
that's-
So,
that's the
okay, good.
language.
It's good to know.
Yeah,
Thank you.
that explained earlier, all our earlier discussions. So
Yep.
I appreciate your time. I know we
Yes,
took
ma'am.
so much of your time and I'm sure you're tired, but thank you so much. I'm sorry, Ms. Parkman. I don't think I ever
That's
gave
okay.
you a
That's
read.
okay. A lot of my stuff has already been answered. Dr. Bissell, I know I have talked to you before
Mhm.
about my concerns. Thank you for your time. Chief Wilson, both of you, for your time on the health task force. And I know this because I have someone close to me that is on that team as well. I don't think most people even realize how much time has gone into what these people on this team have done. We're talking Monday through Sunday, 7 days a week, no break. They met every day, every morning. So weekends, it didn't matter. Just recently, I believe they've started cutting back a week or so ago. But from March, from the time this started, these people have given tirelessly their time and effort and their expertise. Thank you so much for all of your help and your wisdom. I can't thank you enough. Chief Wilson, thank you for everything you've done. And just please take back to the rest of the group how appreciative we are
Thank you.
for all of your help and everything that you've done for us.
Absolutely.
Yeah, thank you.
Thank you.
Absolutely. Thank you.
Thank you.
Thank you very much.
Thank you,
Okay,
Dr.
thank
Bissell.
you
We
very
appreciate
much.
it. Thanks, Chief.
Stay safe.
Now it's public comment.
That's right.
Yes.
Thank you, Tom.
At this time, we have actually public address, Mr. Kranz.
No, I'm wiping it.
He's
Oh,
wiping
you're
it
fine.
down.
Thank you. You're so kind. Let me get my computer space. Sorry, guys.
Told Mr. Krantz he could demonstrate the new back there and spray it down. It's pretty impressive, actually.
It is.
Yeah.
Yeah.
At this time and at each our regularly scheduled meeting, the school board sets aside up to 30 minutes for residents, students, and employees to address the board about issues pertaining to public education. In Montgomery County, we have also virtual public address responses this evening. And if you scroll down where the guidelines for public address agenda item is, let's see oh, I lost my board back. You will see all the virtual comments that actually Ms. Drake put it for us. Those responses are provided in the agenda and are part of our record of the meeting. For those who elected to attend in person, our staff has assisted with signups on the Chromebook, and I have 1, 2, 3, 4, 5 individuals looks like sign up. And each one allowed 3 minutes to speak. The screen throughout the room and the laptop will indicate the speaker has 30 seconds remaining when the 3 minutes has passed. As a reminder, the board doesn't respond to speakers during the public address. First individual that signed up is Zach Underwood. Do I have Zach Underwood in the hallway? And I'm assuming nobody's waiting outside. Then the second one will be Matthew Fentress. Please come forward, state your name and address, and you have 3 minutes.
So my board docs has disappeared again.
May I
help you while Mr. Fentress addresses the board? Is that okay? Or do you want to pause for a
I
moment?
couldn't hear.
May I help you while Mr. Fentress addresses the board, or do you want to pause?
No, as long as, person is fine,
Yep.
but when we get
then
to
I'll get
the, I
that rolling
can't see
for you.
anything else.
Yep.
Yeah. So he can come ahead.
Yes.
I'll leave it there for now. But thank you.
Go ahead. Go ahead.
Hello.
Come to the mic.
What's that?
Mic, please.
All right.
Yeah, close the mic, please.
Honestly, it's good to see you all, even though most of us are covered in masks in the situation. And bless you for the work that all of you are doing. It's hard work. I know today you've heard a lot about what the data has said. I tend to be in my position as MCA president dealing with the emotions, people's emotions. What is deemed safe practice for schools from the CDC or government agencies seems to change like the weather here in Virginia. Our governor has put decisions in your hands. Then there is our nation's education secretary, Betsy DeVos, who has no experience in public education. And the only thing America's public schools have heard from her are threats of funding cuts, which makes your decisions and our jobs much harder. We believe that Dr. Meyer and the Montgomery County Public School staff have done an amazing job and have come up with a plan that may be unmatched by any other school system in Virginia. And I've seen a couple of plans with my work with VEA. But during this pandemic, is our very best plan enough when it comes to the safety of our students and staff? And I'm sorry that you all are the ones that have to decide that. As MCA president, I am like the Lorax, but instead of speaking for the trees, I speak for the teachers and our students. From my conversations with MCA members over the past couple weeks, the staff is scared, and many are making wills. We all want to be in our classrooms teaching our children, but what they have asked me to ask you is at what cost? I shared with you by email the results of our MCA VA survey that went out in early June when positive COVID numbers were around 64. Many MCA members voiced that their answers to those surveys in the past would have changed or will change as the numbers have changed today to 220 positive cases. We sent out another survey question to our 570 members on Sunday. And the question was, do you feel it is safe enough for students and staff to return to buildings on August 13th under the proposed return to school plan? 509 members responded. 76% felt unsafe. 24% feel it is safe. Thank you. Good luck. And may we all treat each other with grace.
Thank you.
Thank you.
The next individual is Manisha Sharma. And then there's Frank May. And then Ted Lee. I guess. I don't think we have any more public address speakers. That's the end. So thank you. And now public address is closed. Now we can return our discussion.
Okay, yep,
to the
Mr.
plan.
Kranz can
Mr. Kranz.
continues.
So
Thank you, Mr. Kranz.
sorry to keep cleaning the microphone. I appreciate it.
So recap each night. So Monday, Tuesday, Thursday, Friday, we'll do our routine cleaning. On Wednesday, we will do our deep cleaning with our emphasis on Wednesday will be cleaning and disinfecting all surfaces. So not just one or the other. It will be doing everything that we can on Wednesday evening. We talked about the training that we will do. One of the challenges that we face is vacancies. Throughout the year, we'll average 6 to 8 vacancies almost every single day. And with the lower hours that we have, obviously that has an impact on maintaining our buildings. And it's something that we're struggling. Sorry about that. Right there. I think that will. It's something that we struggle just to attract people to apply. As a result, later in the meeting tonight, we'll be presenting a recommendation or request to move forward in increasing our rate of our starting pay in order to become more competitive. If we are going to open during this COVID environment, the biggest thing we have to do is ensure our buildings are clean, is one of the main things we have to do. And we can only do that with having sufficient man hours to do so. We will be meeting with each of the schools because each of the schools are unique buildings. They all have unique needs and challenges to ensure we have a good cleaning plan for that school and one that the school administration is very comfortable with. Lastly, we're keeping a supply on hand of all of our products. We have obtained masks. There are masks for 4 to 8-year-olds, as well as shields that go from 5 to 12-year-olds. And I'll have that pricing later tonight, but we have confirmation of them and the availability. So we have the N95 masks, the non-N95 masks, which we have 60,000 masks on hand. Currently, we have 10,000 pairs of gloves, hand sanitizer. We've got 800 plus gallons of hand sanitizer, hand soap, and towels. And we will continue to monitor our needs. We have, for example, at all of our main exit entry points, we'll have the hand sanitizer stand-up mobile units. There's 340 units, and if you look in the warehouse today, it does appear to be just a sea of hand sanitizer units. We will be operating non-school daycare sites. Those will be our responsibility to clean. We'll have carts at each one of those sites. Those carts will be supplied with the standard equipment we supply inside our schools. We'll use our substitutes to actually do the cleaning of those particular sites so we don't impact the staffing at the school level. In the event that we have an area that there has an exposure that takes place, what will essentially take place is we'll do a deep cleaning of that area immediately. In the event that a school would have multiple rooms, that's where that list of contractors we've identified, we would use those contractors to help assist us to ensure that we can get the rooms done in a timely fashion, and we believe we can do that. On the facility side, as Mr. Chewbacca says, the biggest thing there is honestly the airflow. If I put what's called a MERV 13 filter on an AC unit, that's one of the highest standards we can get to. And currently, some of our buildings, we do that. Blacksburg High School, Auburn High School, and Blacksburg Middle are the three that do have MERV 13. For me, though, to go, for example, at a CHS, which is a MERV 4, I can't raise that unit to a MERV 13. Okay? I would need to replace their entire system. So it's not just go put a new filter on it. I also have to have something that filter can fit the existing equipment that we have. Inside our district, our MERV numbers are 4, 7, 8, 11, and 13. So we're a little bit, and I'm sure that most school systems would fit that because there's limited dollars available to replace units as they reach their lives. We are changing the filters regularly. We are cleaning the units, making sure that all the operating equipment inside that unit is correct. The biggest thing to know if your mechanical system is not working typically is your humidity level in a room. Once the humidity level gets below 50, down to 45 plus, down to lower, or above 55 is an indicator that we're starting to have some mechanical air problems. So we're ensuring that the humidity levels are where they need to be. We're ensuring that all the equipment is fully operational. We're ensuring that all of the filters have been changed and everything will be ready by the start of school. Everything's ready right now today. We're at that point. And we will continue to do that throughout the year. Under Dr. Meyer's leadership, we broke facilities up. And so in the components there, we have the leadmen, we call it, and they're done by trade. So I've got grounds, carpentry, kind of a general trade position. We have electricians and plumbing. We have mechanical systems. And through that group, they're all licensed and we're all able to fully maintain the systems that we have. Okay? and that team, that's all they focus on. Airflow. Airflow has been something that during the pandemic, at sometimes it was no airflow in buildings, then it was dump all the airflow you can in the buildings, then it was a combination thereof. We are putting in airflow, like for example, if you go to Blacksburg High, 6 times in an hour, I change out all the air in the building. If the system's working correctly, 6 times in 1 hour, we take all the air out and we put new air in. That's basically how the system operates. But that's not true across the district because all of the units are not the same. We're running all of our units at what the manufacturer represents we can do to bring fresh air into the buildings. If we were to pump in more fresh air than what's recommended, we run the risk of burning the units up. And then to replace our units, we're talking in the hundreds of thousands of dollars, and in some cases over millions of dollars. It's not just a simple fix. Some of our units are so old that if I were to replace it, not only do I have to replace the unit, but I may have to replace ductwork. It becomes a whole process, okay? So we're pumping in as much fresh air as possible. The same thing in trying to open windows. We're looking at the windows, we're seeing what we can open. And again, we have to balance it out between the unit and the air that we can bring in from the outside. We've put signage up. We talked about the plexiglass. That's going to be going up, and we will work with each school on any areas that they think other areas that needs to have protections set up at. We've looked at doing the cube on the tables. So I think we've got a good menu of items that we can address. It'll now be going, school by school, and we'll address those needs. We've listed here the contracts for you, ServPro, who we use. We've used them with some of the flooding we had at CMS's gym. We used them for the flooding we had at BHS and some of the actual contracting work we had to do. L is a company that monitors all environmental projects, and we've used in the past. ServiceMaster, they're very similar to ServPro, and both of those are companies I'm very familiar with. And Hurt and Profit has the industrial hygienist. But on the Montgomery County Public School team, sometimes we talk about facilities and we don't think that there's not a lot of highly trained people. Let me tell you, they are. We have a certified industrial hygienist and environmental engineer on our staff. But we have a lot of talented people on the operations team, not just that particular individual, but there's a wealth of knowledge and experience, and that team can pretty much do anything we give to them. We go to food service, and food service is real simple. Come the end of August, the waivers that allowed us to continue feeding children under summer feeding will expire.
Okay, so that means that if students are not in school, they do not get fed.
Correct. Accountability.
Students do not come to school, they do not get fed.
That's correct.
Unless the government extends
Unless
that.
the government gives us an
We haven't
extension.
heard that they're going to do that. Is that correct?
No, sir, but there was an email out tonight that the School Nutrition Association national level is really putting on a lot of heat in DC. And we're getting from some of our local national representatives are helping us. So we can't promise anything, but everybody's working extremely hard to try to get that done.
Okay.
When did you say it expired? When did you
End
say
of
it
August.
expired? End of August.
Yes, ma'am.
And you not heard any rumblings that it might extend?
Purdue did an extension early July that we thought it would be included, and it was just politely forgotten. But there's a lot of politics involved, but we're not the only one. Many districts during this time fed adults, which we're not allowed to claim.
Right, that's the neighborhood, that's the community piece that we don't qualify for, right?
Well, no, school systems like Los Angeles, Chicago, Houston, all made a conscientious decision that they were going to use their reserves and feed the whole group. And they're now facing opening school and they're short. So the only place it can come from is the general purpose fund, or it's going to come out of federal funds. So there's a lot of pressure from everybody within the system because we all are facing severe financial, economic potential issues with this. But we're working diligently with T&J. We're creating 2 menus, a menu if we have what we have, how we can go about doing it. So if it does get implemented, then we're ready. And then a menu on how we can continue it. One thing we've gotten a little stale, but the staleness wasn't because of everybody's efforts. It's been an effort of utilizing the equipment we have, utilizing the product we have, and just being as prudent as we can. Not trying to, you know what I'm saying, hit necessary numbers, knowing that we were getting to the end of the run and we'd be coming up with something new for the start of school year. So we're running both courses. We'll be ready for whatever situation takes place. Transportation, the big challenge with the transportation is twofold: cleaning of buses and then the routes. Cleaning of buses, right now today, we spray our buses. We spray with a disinfectant. What we're proposing to do is when we have our run in the morning, so we drop off our secondary morning, we'll spray the bus. We drop off our elementary morning, we'll spray the bus. When we run our midday secondary, we'll spray the bus. When we do the elementary, we'll spray the bus. And in the afternoon, when we finish the secondary, we'll spray the bus. When we finish the elementary second at the end of the day, we'll actually not just spray the bus, we'll wipe the bus seats down. Trying to ask our drivers to do that each time would be very time consuming, and our time frame's pretty tight. So we think that's enough. Currently, we've developed in routes with 26 students to a bus where we've taken, until we get our final information, we've taken what we do every year. We take our prior, we roll it, and we develop our routes. That's generally 99% of all routes we do. We've already done that. They work out. We're comfortable. One thing I haven't gotten a chance to tell you tonight, but I'll tell each of the board members. On Price's Fork, construction on the turning lanes for the 2 residential developments in North Star Church will take place. It will take place over 4 months. Unfortunately, it's going to start near the end of August. We're working with VDOT, and we have a plan to kind of get us through quickly. But we are going to have, just so y'all are aware, we may have a few bumps, but everybody's willing to work together. Any questions?
So when we approved option 2, it was to be able to have 26 students on the buses, right?
Yes, ma'am.
And that meant that they all had to wear masks and that there needed to be an aide on the buses to help the driver ensure that the students were. And from what I've read, we don't have enough aides.
Well, that was our intent. That was the intent, was to have the aides. Each of the buses will have the mask. They will have the hand sanitizers. They'll even have gloves. Our drivers today, when a child comes on the bus, the driver engages with the student. And I've ridden the buses, so this is firsthand knowledge. So if it's Dr. Meyer, Mark, how you doing? Have a good day. Hope you have a great day. Sit in seat number 2. What we're going to ask the drivers to do is when Dr. Meyer comes on the bus, we see he doesn't have a mask, we'll offer him a mask. If Dr. Meyer elects not to sit in the seat that we ask him to, just like which happens now, generally every bus, most of the buses have assigned seats. Dr. Meyer, would you please go sit in the seat? And we think in talking to our drivers, not everybody, but talking to a good population of them, that this fits within their normal workday. More of my concern is just my drivers having time to do the cleaning that they need to do. Some of my drivers are over 80 years of age. And, normally they're used to working 4 hours. Now they're going to be working anywhere from 7 to 9 hours in their day.
Right. Which puts them in a high-risk category.
They are going to be in high risk, and we're going to offer them the mask and or the shield. They will have to wear it. And we're adamant about that just because of the engagement we will have with the students and the fact that the students will be close to the drivers to protect everybody.
So I'm very concerned that what I agreed to
Mm-hmm.
is not going to happen with 26 children on the bus, a bus driver who is going to have to try to ensure that the students are staying 6 feet apart and that they are all wearing the mask for the entire route. I think that's more than what a driver should be asked to do. And I haven't a drive. I know that they have relationships. I've talked with these drivers.
Mhm.
I understand, these are my kids.
Right.
They take care of them. But we're in a whole different situation now. And making sure that those children are wearing those masks and that they're staying 6 feet apart is key to what we're trying to do here. I don't believe that it is safe for our drivers to be focusing on the normal things that they focus on with the bus and children.
Mhm.
And on top of that, make sure those other two components are happening too. It's not what I agreed to. And that was one of the big things for me, is that there would be an aide on the bus. So
But-
what do we need to do to get aides so that we have them on the buses if we're going to open these schools?
We getting 74 aides. The plan that we had put together was a sound plan. And just unfortunately, it didn't work out. The 6 foot, let me address that issue first. By having one child per seat, I'm not 6 feet apart. But the health department has said that if I have the mitigation, which is the masks and the hand sanitizers, and I offer that to the student, then I'm minimizing that impact. Now, we get to question number 9, which is, and I'll let more flow more in Dr. Johnson because he's handling the discipline side. But even if I have the aid, when the student comes on the bus and they don't have a mask, all I can do is offer them that student the mask. From Richmond, now I don't know how they would handle it here, but I had bus drivers that tried to prevent students that were walking down the middle of the bus while I was traveling, put their arm out, didn't move it, the child's legs touched it, and he got arrested for sexual assault. Took 16 months before he was found innocent. So I can't allow any of the employees to touch a student. And we're not trained in the discipline side in this world. So I hear what you're saying, but I think it's doable. It's not the best of worlds. And to get 74 aides, even between now and pick a date, I don't think I can get 74 applications in.
Mr. Kriess,
So
how
then that
many?
shouldn't have been put in front of us as an option, as part of that option, that an aide would be on every bus to help assist the driver
Mhm.
in making sure that the students, not that they had a mask, because that's a requirement, but to make sure they were also going to keep those masks on and that they were going to stay 6 feet apart.
But okay, let's take the question. I hear what you're saying, but I'm on Mount Tabor. I'm a half of a mile from the child's home. It's raining hard. Child refuses to take a mask. We're gonna leave him at the bus stop?
If
I mean,
child-
Ms. Franklin,
if the
I'm
child-
just
I'm-
saying,
I'm
what I had to do in
saying
Richmond, that's
here-
the kind of decisions we had to make. Are we willing to say?
Here is the situation for me. I was asked to vote on an option,
Right,
and that option included having an aide on the bus to help with this
I agree.
situation.
I agree.
So no matter what else you may throw out there, the child refuses to put a mask on, this or that. What I voted on is that there was going to be an aide on each one of those buses.
And
The other piece are pieces of, as you said, Dr. Johnson will talk to us about, but I'm talking about the aides that are not going to be on these buses, as I was asked and was told was going to happen.
And that's correct. You were told that, and that's my fault.
We thought that we could make that work at the time after looking and talking to Dr. Walker and students' IEP needs and the one-to-one aids. We've just recently, we thought that we could make it work. We felt real good about it at the time, but after looking at individuals' needs, individual kids' needs, and knowing what the one-to-one aids would have to do, we were not able to work it out. So, I mean, we're not going to bet to get an aid on every bus now.
It's not even possible for elementary routes for younger kids. I'm just
Dr. Walker, if
wondering.
you want to speak to anything, you're welcome to do so.
In the spring, when we had the first shutdown, every student was at home.
Yeah.
So we had the ability to utilize the instructional assistants at that time. Based on the surveys.
Dr. Walker, can you speak into the mic, please?
Sorry.
For the purpose of the YouTube video. Thanks.
In the spring, we were all shut down, of course. The governor shut us down, and all of the students were home. And the students who drive the aides through their IEPs were home as well. And we had social distancing, so our aides could not go home to be with the students, to work with them. So we did utilize the instructional assistants to help out, at that time. So at this point, with our alternative plan and based on our survey we sent home to parents, we have anticipated about 200 plus students attending full-time who have instructional assistants attached to them through their IEP. So the kids are in, the aides are in, so therefore we don't have the ability or the flexibility because they have to work with the students during the school day. And these students are attending full day.
Mhm.
So that's the major reason for the instructional assistance. So we did have an opportunity to early on to make that work, but these numbers do fluctuate based on IEP meetings and also based on parents wanting students to attend school and based on their individual needs. So that's where we are at this point in time. We've got about 227 students attending full day with an instructional assistant working with them during the school day.
So much higher than we anticipated when we first brought this to the board.
Yeah.
So thank you, Dr. Walker.
Thank you, Dr. Walker.
Mr. Krantz, how many students do our bus drivers have to deal with on a daily basis?
Average elementary bus, is going to be about 55.
And so we're talking.
Average secondary is around 45.
So we're talking less than half of that for the AM PM routes. About
Correct.
26.
Yes, ma'am.
Right,
Yes, ma'am.
less than half.
Mhm.
And do the bus drivers now have trouble with the students staying in their seats?
Yeah, and the more experienced drivers, I think, are much better at it. We have obviously even our more experienced drivers will run into problems, but they've learned just like the teachers learn. How to manage a classroom.
Sure.
They learn how to manage their bus.
Okay, thank you.
Right, and I understand those points, and I think I made that point
Yes, ma'am, you did. Yes, ma'am, you did.
earlier, but it does not negate for me what I voted on.
Right.
And that's a problem for me.
And like I said, I agree completely. I understand where you're coming from. I would ask the board, though, to consider point number 9, which is if we're requiring students to wear a mask. When a bus does travel to pick up a child, Cagni Tabor, and like I said, some of our stops in relationship to homes are a good distance. Are we going to leave the child at the stop with no mask, or are we going to bring the child to school and then fall into the discipline side on the school? I'll just say this. In Richmond, we had some of our schools, we did citywide, and we had done transportation, done it door to door, and the district no longer could afford it, so we went centralized. And it was difficult for our board when parents were calling saying, what, my child can't get to school now. You change it. Well, it became a difficult phone call. So this is very similar. The first time I leave a child at a bus stop, there's going to be a phone call to a school board member. And I'm willing to do whatever y'all want me to do.
Okay, so we're asking for a vote on number 9.
Yes, ma'am.
Hang on a sec. I'm sorry. Before we move on to that, think there were a couple other things.
Sure, go ahead, Mr.
I-
Shabaka.
Yeah, there was a couple other things that I wanted to ask Mr. Krantz about, including the bus aids. Tommy, you said we couldn't really do it, but can we do it to any level? I mean, do we have a certain, what was the number you said, 76 aides? Do we have half that number or a quarter of that number or something like that?
Right now, all of my bus aides are assigned on special ed buses. I think I have 2 substitute aides, and that's it. We even looked, Mr. Shabaka, at us using personnel in our maintenance fleet because some of them fit in as substitute drivers, but we wouldn't feel comfortable taking more than 3 there. So that gets me a long way from 74 when I have 5.
So, one issue we have with aides, and talking to Dr. Walker too, is especially that midday route, when the student's there all day, they need to tend to the kids midday, the aides, the one-to-one aides. The morning and afternoons may be doable with aides somewhat, okay? Because the kids aren't in school yet, but it's that middle of the day that's the most difficult time. Does that make sense?
Could
Go
we
ahead.
maybe look at the possibility with the 14-day quarantine, since this is hopefully not going to be anything that's going to be long-term as far as having to do this, with the possibility of volunteers maybe, or is that a liability? I don't know.
You all voted for a long-term, it was okay if you were a long-term volunteer.
I
And-
mean, just,
and that is-
so if we worked it out to do the morning and the afternoon, we could do with our aides, even if we just had to use the volunteers for that midday transport of students, would that be something doable that we could
As long as we
do?
did the checks on them.
And that's what we
they
did
came
for
through.
food delivery.
Yeah,
Right,
have
we
it-
used them in
right.
Food Network.
One thing that if we do that, we have to, this was an issue with food delivery, is being a different volunteer every day.
Right.
That's not something that we wanted. The bus drivers did not want. They wanted
Yeah,
that
more
consistent
extra.
person every
Sure,
single
yeah.
day.
Right, and that's
Because of
understandable.
exposure
Yeah.
and
That's
that kind of thing.
understandable,
So,
right.
but it's
If-
definitely something
If
we can
found
explore.
someone who was maybe looking to do, who could do something like
Mhm.
that at that time of the
Well,
day every day.
Possibly.
That's different too than delivering food. You're actually on the bus with students.
Mhm.
And so you really have to have somebody, I know a liability standpoint of having somebody on that bus monitoring those students who's a volunteer. Is that something we can do?
We would have to provide the training we do to our normal aides.
Yeah.
So
Yeah,
we
we
do.
We're not paying them. They're.
No, ma'am, but we do, we provide training and ensure that our aides are doing what we need to do in conformance with state regulation.
And I mean, we have volunteers that go on field trips all the time and monitor students.
The teachers are on the bus too.
Yeah, and a bus driver
There-
on this bus too. I mean, so we'll have an employee. Basically, we've said if there's an employee present, but we go on field trips and the volunteer will take a group and tour and that kind of thing without a teacher present.
Right.
Yeah.
Yeah.
So I understand what you're saying. I
Just a
mean,
thought.
it is a thought.
It's a
something we can
thought.
explore.
Mr.
So
Chabaka,
Tommy, and
you had another
yeah,
question.
well, related to this one, and then I'll go on to my next one. But another thought that I had from a mitigation point of view on buses is, buses are going to be moving most of the time. The trips I know can be long, but relative to the time that we're talking about for COVID transmission, I mean, most bus rides are probably more in the 20-minute, 30-minute range. I know some people may have a 45-minute or even more bus ride, but what about the idea of requiring maybe at least 2 windows, one in the front and one in the back, to just be cracked and just allow some airflow through that? I mean, I think when the weather's warm, those bus windows are going to probably, a lot more of them will be open. But, if we do that, I think that could be a good mitigation strategy to just keep the air exchanged and moving in that bus. And I think that should reduce risk as well.
Yeah, and I apologize, Mr. Shabaka, that isn't our plan. We've identified windows in each run that we'll take down to get the airflow so the students are safe, and at the same time, we get the airflow into the bus to help mitigate any viruses that may be there.
Okay, thanks. And then my other question was actually also related to the airflow. You did mention that some of our newer buildings have that ability to change out the air in the air handlers. And I think you used specifically, the example of BHS being able to do it, 6 times an hour, which is way more than I thought we would be able to do. So do we have that ability to change it out once an hour or 2 or 3 times an hour in most of our other buildings, or how does that work?
I would say in about half of those buildings, we can do that regularly. The other half, we not. We're looking at a device that is basically a HEPA filter that you could put inside of a classroom. It can turn the air in an 800 square foot room every 30 minutes, in a 1,600 square foot room once an hour. Most of our classrooms on average are between 800 to 900, not all, but most are between 800 to 900 square feet. So they could turn those twice an hour, potentially, the air. The thing we're trying to evaluate is the cost benefit. It's about $200,000 plus $1,000 for us to do that. And we're trying to make sure we're prudent on how we spend the CARES Act funds. But we are looking at
Okay.
it.
Okay, thanks.
Do we know how many students will actually be on the buses in the middle of the day? Because every parent that I've spoke to is probably going to have to leave work to pick up their child, to take them to daycare or somewhere. So how do we know we're even going to have 26 students on a bus in the afternoon? Now I get in the morning and I get going too,
Mhm.
but the whole way of it working out is going to be a problem. So.
Well, where we have the offsite daycare, our intent is to use our trip drivers. So we have drivers that all they wish to do is midday trips or evening trips. They don't do any of the routes. Some of those drivers have agreed to come back, and we would use them to transport students from school to the offsite daycare. Okay. We
for
don't,
those
we
that-
won't know on the parent count because this is so different.
Yeah,
You
for
know,
those that
that
don't, 'cause
we
you can
won't know
only-
until we start running it.
You can only house so many at that daycare, correct?
Correct.
So that's a
Well-
help, but it's not a fix. And so that's why I wonder how many students you're really even going to have on the bus.
I don't know, like the
We already have a
example
huge-
for Harding, we can, that facility can hold 50 to 55 students.
Okay.
So it's a pretty good population that they can to meet the needs there. But we won't know until we open school.
Okay, so we're still on question number 9, and we've had 2 votes.
We recommend option 2. We bring them to school and notify the administration.
I would feel better about voting for either the second one if there was a limit on how many times that could happen, because I could see that being a problem. Instead of just bring the student to school and notify the administration, okay, well, you gotta, well, then the next day, well, I forgot, well, I didn't have one, mom didn't let out. And that could go on. And then every other student is going to be like, well, they didn't have to wear it. Why do I have to wear it? So I'm not going to wear mine. All they got to do is go to the principal, and then we get to wear it the next day. I don't have to wear a mask.
I think
Right. I
you'll-
mean,
I'm
and let me
sorry.
say, the administration, I don't think we as a board need to set a limit on that. I think the administration and principals need to handle that. If it becomes an issue, after a couple of times, then they can deal with it, and we'll instruct principals to deal with it. If this happens, 2 or 3 times, it becomes a habit, then you're going to have to have a conversation with the parent about bringing the kid to school.
Gotcha.
And
Yeah.
that will happen. Just like just a discipline issue. Kid continues to
Discipline
behave.
issues,
At
right.
some point, you
Yeah,
can't
sorry.
ride the school
Yeah.
bus. I mean,
Okay, so we currently have 4 votes now.
For me, it's hard to answer this because part of it depends on how old the student is.
how what?
How old? I mean, obviously, I'm not going to leave. I would feel horrible leaving a 6-year-old sitting at a bus stop if their parents not there. But if it's a senior who's 17 or 18 years old, heck yeah, put your mask on, or you're not getting on this bus.
Yeah, I think there's a liability when we're responsible for their students. I mean, I think there's a liability at any age.
I'll say 16-year-old young lady, 17-year-old young lady.
Yeah. I mean, I understand your point that they should know better,
Mhm.
obviously. But I mean, we're going to have, we're going to have masks.
Yes, sir.
For them.
Yes,
So,
sir.
I mean, the drivers will have a mask to hand to
This
them.
is if they refuse to put the mask on, right?
Yes, ma'am.
Yeah, I mean,
what
they will
it's
still be
about.
able to use a mask. I mean, yeah.
Yes, sir.
It's not like get on the bus and we don't have a mask. We're gonna put masks on every bus so that if the kid doesn't have one. But then, at some point, if
Right.
it becomes an issue, yeah. We're gonna have masks for the kids when they get on the bus if they do not have them or forgot them. Because that's gonna happen every day.
Mm-hmm.
Yep.
Several kids on every bus.
That's what we intend.
It's like
Same
bringing a
kid
pencil
every
to
day.
class. I mean, it's gonna be an issue.
And it all comes down to the same issue like Ms. Franklin mentioned earlier, the education issue. And if this plan ever has to work as best as it can without us getting into so much, problem with the virus, everybody has to cooperate. So I'm hoping, all the parents that listening right now and will listen to us till the opening day will realize that they have to teach the kids at home to do these things too, or at least, tell them that they have to wear the mask if they don't want to get sick. I mean, as simple as that. So, I mean, we have to all work together. So I'm hoping most parents, almost all parents, has to help us out for this to be successful.
We currently have 6 votes. We're missing 1 vote before I can say that before I'm allowed to say that we have full participation in the voting. We're still missing 1 vote.
Let's try again. If it's me, I think I did vote.
We are now at 7, and it is a consensus on option 2. So we can move on to number 10.
Okay, Mr.
Thank
Wickham.
you, Mr. Pence.
I think we're
Thanks, Ms. Grant.
into athletics.
Technology.
Technology, no.
We don't have any questions about
We don't have any
technology,
questions.
so they're not.
Oh,
a
that's
different
why.
one.
All right.
But it is Mr. Wickham's turn in the.
Sorry, thank you.
Yeah, it's okay.
Thank you, Ms. Krantz, for cleaning off the mic so I don't destroy it again. I'm going to talk tonight very briefly about our technology plan. So for students, device availability, for students in K through 2, we'll be assigning them a Chromebook to use in school that will be labeled with their names. And we're doing that, one, for mitigation purposes, so that each student will get the same device each day. And then also, if we have to scale back to an at-home scenario, students K through 12 in our division will be supplied with devices for their use at home, which is very good for our division to have that. We are ordering new Chromebooks for our teachers. One of the complaints and issues that we had was maybe with some of the remote access and tools that we have. So we are purchasing new Chromebooks, one that have a bigger screen, because that was another issue that the teachers addressed. And so we're trying to meet their needs. And our new Chromebooks have higher specifications to help with the online and remote learning that will happen. For our teacher training opportunities, based on the results of teacher feedback surveys, we will continue to offer our Tech Tuesdays, which are virtual workshops that focus on the tools to support online instruction, including Google Classroom, Google Meet, G Suite products, Pear Deck, Flipgrid, and others. Our attendance so far in the sessions this summer has been nearly 600 participants, with an average of nearly 38 participants per session, which is a real testament to our teachers because these are all voluntary workshops. They aren't getting paid. They get a couple credit hours of recertification, but nothing beyond that. We still have 23 sessions that we are offering between now and when teachers return. And so most of those are going to focus on Google Meet, which will be the video component of our remote learning, and if we scale back plan, and on Google Classroom. So teachers will be required to attend training on these if they have not done so already, because they are the cornerstone of how we plan to address remote learning and in case we need to scale back to being at home with online instruction. Our recommendation for a remote synchronous model will be the Chromebooks to deliver the audio and video feed, and then the teacher workstations to deliver the shared content, so that as teachers present onto the smart boards to the in-class students, the remote students will see the same thing, or if they work out problems on the smart board, the students at home will see the same thing. And really for technical purposes, it's better to split off those two feeds, one through the wireless and one through our wired network. So that is our recommendation. And we will be providing teachers how-to documents, videos, and then when they come back to school, we will also give them face-to-face trainings on how to set up that in their classrooms so that they are prepared to deliver the remote and online instruction if we do have to scale back. To assist with students who do not have internet access, we have added an additional 300 MiFi units, bringing our total up to 400 units for our division. Students who are unable to receive an internet connection will attend school in person in our plans. We also have internet access at each of our school locations, and in talking with the county IT department, they also have hotspots available with public Wi-Fi where students will be able to go there as well. We continue to seek ways to increase our internet services to our students because we do have pockets in every one of our strands in this division that are either unserved or underserved for broadband access. And then the last part would be the delivery of instruction to our students without internet. It will look different at each of our phased approaches. In the phase 1, level 1, any student who lives in an area without cellular service will be provided a flash drive of content similar to what we did when we closed down in March, with the exception of we differentiated between the high school or the secondary schools and the elementary schools. Elementary did packets because of an equity issue. Not all the students had Chromebooks that they could take home. We've resolved that equity issue and all students will have a Chromebook. And so we will use the flash drive over the paper packet delivery method. Students without internet access will receive MiFi devices if they live in an area that has adequate cellular service. Just because they get a cell phone signal doesn't mean that they also have adequate cellular service for data and streaming. So we will address those. In the phase 1, level 2 and above, any student who lives in an area without cellular service will be allowed to attend school in our buildings. Students without internet access will receive MiFi devices if they live in an area where cellular service is available. And then in phase 3, secondary students who live in an area without cellular service will be able to attend school for the entire day. Secondary students without internet access will receive MiFi devices if they live in an area where cellular is accessible. So that is our technology plan for how we'll move forward with remote and online learning. Are there any questions from the board on the technology component?
Can I ask you a quick question on the changes in the Chromebook that helped them with Google Classroom and Google Meet that they were struggling with?
Yes, so the processor, I'll go through a couple technical specs. So the processor, the really heart of the device, is a scaled back version for the Chromebooks, and that's how we keep the prices low.
Sure.
The new ones that we're buying have a true core processor. It's an AMD core processor, which allows us to be able to have a more robust experience. We also doubled the memory, the RAM that's in them to be able to address those needs. Will the Chromebooks that we're purchasing ever replace a laptop? They will not.
No.
But at the price point that we need to be able to do this, this Chromebook is better. And we picked the AMD strictly for the purposes that we could get these devices in time for school to start.
Right.
All manufacturing is running into delays due to COVID. In fact, the biggest one is our shipping. They used to be able to ship devices using commercial airlines when they had luggage space and be able to get that. Because of the reduction in flights, we are now limited more to cargo containers, which take up to a month to get here.
Wow.
So there's not been, we bought 14-inch screens for the teachers, so they're really big.
Sure.
That's not the demand for Chromebooks right now across the nation. They just need Chromebooks, and they're all going with smaller ones for students. So we did order new 9th grade units as part of our plan, our regular plan. Those units will not be in until probably late September, early October.
Okay.
And what we'll do with the teacher units that we switch out, those will help supplement our K through 2, where we have not provided devices, or we're really having to dip into our repair stock in
Mhm.
order to do this K through 2 plan. And so we need to fulfill that back again.
Great, thank you. And thank you
Yes.
for doing all that.
Yeah, all great plan. Any other questions? Mr. Chavaka, do you have a question?
Yeah, Mr. Wickham, do you know, one of the things that some parents have brought up, and I don't know how prevalent this is, but in the spring, I think some people had some issues, I think, with, running Zoom with video turned on and things like that. Are we going to have procedures, best practices, things like that for our teachers to recommend for them, such as, if you're not speaking or whatever, turn off your video and things like that to kind of help get through some of those bandwidth issues? Have we done any testing maybe at people's houses, various services of internet that's common in our area to make sure that, virtual classes can actually, happen online?
Well, to address all those, Dr. Johnson does have a document, an appendix, where he has developed some guidelines for best practices that we have looked at it too as a technology department that cover exactly what you were talking about. Best practices, we recommend that you do keep your video off, and we recommend that because there are students who are in locations, they may be homeless, they, just a poor living situation, that we really do recommend that you leave your video off when you're redoing this. As far as testing, we have not done any large scale testing other than, us in the technology department. We have done things from home to test, but mine's an unfair assessment. I have a very robust internet connection at my house. And so it would be difficult to test beyond that.
So you were talking about the hot spots. and
Yes.
Working with the county. Did I get
So
that right?
the county, just like we are putting out antennas for outside access to our network, the county has also put out some outside antennas in spots. The Frog Pond is one of them. So you could pull up to the Frog Pond and be able to get access to the internet. And they have some other places as well. I know, I just had a thought when the chief was up here and he said, we'll help you do whatever you want. It'd be great if we could get some businesses to also join into this where they may have signals, because even though all of our high schools and our middle schools and elementary schools do have access points, that's still a long drive for some of our students if they needed to pull up to a parking lot. But there are businesses that are around in some of our areas, and particularly our Auburn and our Shawsville and Elliston areas are our two most underserved areas. And it makes financial sense. If I'm a company, I'm not going to spend a large amount of money to run the connection to a single home. I don't get the return on investment. I did talk with the county government, and there is a broadband. They've received proposals for companies to come in and do broadband throughout our county. And so that will be happening, but it won't happen in the time frame that we need it to in the next 3 weeks, unfortunately.
So we still have students who won't have access even to be able to get to those hotspots that might be set up.
Yes, and if they don't, during our current phase that we're in right now, they will come to school.
Right. The only phase, if you look at the phases, the only phase is the phase 1, level 1. And that would, we intended that phase to be a governor shutdown, stay at home order, pretty much a level 2 in phase 1. The only students we would bring in would be those who do not have access to the internet. If we didn't do that, because it's only, we're looking maybe 80 kids, which is 5, 6, 7 kids a building. And if we didn't do that, we would have to go back to the model that we used in the last quarter of last year to create an equitable situation. So the first kids that we would ever bring back into the building would be students without internet access that we can't provide it to.
Okay, thank you.
Mr. Wickham, I'm sorry, I had one more question.
Yes.
Some of our families who struggle with the technology and how to help their student, I understand from Ms. Kraft that you guys are working on some videos to help them.
Yes, we are launching a website that will have resources for parents. We already have a resource, a Google Classroom set up for teachers, but parents cannot join that Google Classroom. So we are going to have a public facing access for for the parents to be able to give them best practices. In the spring, we also did send communication out to parents about how to join the Google Classroom as their student. Right now, Google Classroom does not let parents join a Google Classroom because then they would get all the assignments that the kids got, and it would be hard on the teacher. So
Sure.
we did send out some communications on how parents can get into Google Classroom, look over their students' shoulder and what they should be looking for to try to help them. But we will extend that
Mhm.
to some more videos, some more how-tos to
Yeah,
help out.
because I just know that, we have families that aren't technologically advanced, and, they may not know how to help their third grader, for instance,
Right.
or, soon to be K through 2. So it would be good if we had some videos to help them. Sounds like you guys are already working on
We're
that.
already working on that. We will have something up very soon.
Great, thank you.
Yes.
Any other questions? Thank you so much.
All right, I'm going to turn it over to athletics.
Mr. Knott?
And,
Mhm.
Good evening. So as you all know, back in March on the 13th, when schools shut down, VHSL suspended high school athletics until March 30th. We followed the VHSL's guidance, shut our high school athletics down, and we also shut down our middle school athletics at that time or postponed them. Then on March 24th, the VHSL canceled the spring sports season. We did the same thing with middle school athletics. We have followed the VHSL's guidelines throughout this process, and the VHSL has worked with the VDOE and the governor's office as they've worked to provide us with working guidelines for what we can and can't do with athletics. The VHSL did reinstate out-of-season practice on June 15th. They did not release their guidance for what we could or couldn't do at that time. They released that a little bit later. We reviewed that. Our ADs and I met, and we went over their guidance, and we shared all of that with our coaches, prepared our coaches for working with our student athletes, and began on July 8th, allowing our coaches to hold out-of-season practices following all of the guidelines. One of the things that the VHSL used was the NCAA recommendations on their sports. They categorized them as low, middle, or high as far as the contact goes and the severity, the ability to transmit, contract COVID. And we found out today that the NCAA has revised that just a little bit. They had put soccer in the middle category, and they have now put that in the high-risk category, along with lacrosse and football and wrestling and volleyball and some others. We will continue to follow the VHSL guidelines as presented to us by them for both our middle school and high school athletic programs until we are able to return to normal as far as athletics goes. We do expect some potential transportation issues and maybe even some other issues when we do start sports again. The executive committee for the VHSL is going to meet on July 27th. That's a week from yesterday, next Monday. And they will likely decide or come up with a plan or announce a plan for when athletics and activities will begin for the 2021 school year. The plan right now that appears to be the front runner would be starting the winter sports season in December, starting the fall season in February, and starting the spring season in April. All of these seasons would be reduced. They would be shortened. We wouldn't play the same number of games as we currently play, and we would follow the same kind of thing with our middle school sports as well. One of the issues that we anticipate being an issue for us is transportation. With the demands on our drivers as they are now, with the shortened seasons, with the number of games, which we don't know what that's going to be at, that will need to be played. And then honestly, the number of teams we have across the county, middle through the high school level, we anticipate transportation being an issue, not being able to leave, to get to games on time, maybe not being able to travel like we have traveled in the past. We don't know exactly what that's going to look like, but we did want to alert you that that is something that we're likely going to have to deal with down the road. Assuming that we get back into school on a more regular basis and we are able to have an athletic program, we may have to make some tough decisions, but those would come at a later date. You know, we currently don't know for sure our funding and how it's going to all work out this year. And because of this, not knowing what we're going to have, and not knowing if athletics and activities are actually going to take place for sure, we don't plan to issue contracts to our coaches and our supplemental folks at this time. Normally, we would do that at the beginning of the year. But we don't want to do that because we, again, have some funding concerns. All of our contracts include a clause that state this agreement is contingent upon funds being made available either by the county or the state or both for the purposes of paying the salary specified. And so if we don't have the funds to pay, then, you know, we don't have to pay because of that clause. The cost of our 2021 coaching stipends is $839,566. Getting to question number 10 for the board is, do we want to pay these stipends to our coaches if they have reduced seasons or don't have any, if they don't have any seasons, if they're canceled this year? We recommend not paying these stipends because of the financial piece to that and not knowing for sure what our funding is going to look like for this year.
But haven't some of them already been coaching and working?
Some are working currently. Well, coaches work year round.
Right.
You know,
I mean,
they don't do
you just said that a little bit ago they were doing some kind of workout.
They don't do it for the money, to be honest with you. We don't pay them enough to do that. Our pay is great now. When I was coaching football, I made 17 cents an hour.
And let me say this, we do not require our coaches to work in the off season. If they do so, it's of their own choice. And so, but it's not a requirement. We pay them to
But
coach.
I thought Mr. Knott said that they were actually started working this season.
They have, yes.
They were told to do it. They
No,
did
they
it
were
on
not
their
told
own.
to
They
do
were
anything,
told they
no.
could if they wanted
could
to.
if they
Oh,
wanted.
okay.
They don't have to.
Right.
And we have some coaches right now who are choosing not to work with their student athletes at this time in some schools.
Thank you.
Any other questions?
And Danny, we're paying those coaches, right? Didn't we set up something to compensate them for?
Yeah,
for
something
the
that
work
we
they're
decided to
doing?
do for the well-being and the mental health of our students is because we were not having a fall season, and we pretty much know that's not going to happen. Is that if a coach actually had the initiative to do this and to bring some kids in, because I think it's good for kids at this point to do, to have something to do, that if they, and of course, Danny gave them very strict guidelines based on VHSL guidelines. If they do bring them in, what to do is we're actually giving them a certain amount of money on an hourly basis up to a certain amount. It's not much, but it's something to say, thanks for helping our athletes out and just to get them out the house.
We're paying them
basically.
for up to 10 hours a month.
Yeah, 10
at this
hours.
time.
Yeah, so 10 hours if a coach wants to go out and do it, I think it's good for kids right now, and in terms of mental health and just physical activity, since there's not going to be anything going on this fall. So, if we can sustain that, we'll see. Mr. Krantz we're looking at how that payroll comes in every month. Right now, there's not a ton of coaches that have taken us up on that. But I have seen some coaches actually who are not just bringing their own players in, but I saw a coach the other day had a gym full of students who were socially distanced, and I know they were not his athletes because there are a lot of, well, maybe I'm making an assumption, but there were a lot of females there, basically working out any kid who wants to come in and do some physical exercise and be in
That's
shape.
awesome.
So I thought that was pretty nice.
Mm-hmm.
So on question number 10, we have 4 votes.
So
I'm a little confused. So we have coaches that the spring season was canceled, but they had already started doing some conditioning. And we're saying we don't want to pay them.
We did pay them.
We,
Yeah,
That's the
we
next,
paid-
that's the next
yeah,
question.
We paid spring coaches a third of their salary, which they actually worked 3 weeks.
3 weeks, about 18% of the season.
Yeah, they didn't work 30% of the season. They worked about 18% of the season, and we gave them 30% of the pay. So we did pay spring coaches a third of their pay. They did not complete a third of their season though.
so some of our fall coaches,
Any of our current coaches right now, fall, winter, or spring, could be working with their athletes in out-of-season practice for what we talked about just a minute ago, up to 10 hours a month and be paid for
okay.
that.
Okay, thank you.
Yes, ma'am.
Okay, we're at 5.
So I guess and this is what I'm going to say about point 10 is probably going to come up again in point 11. And that's that, when we have coaches, especially when we have head coaches who are in charge of the program, they develop relationships with these students. They work with them year round. They're kind of invested in this program. And in general, I agree with, for now with option 1 that, if we're canceling seasons and we're not having this work, then we shouldn't pay for it. I feel better that we have these other opportunities to pay these other stipends, I guess, for practices and whatnot. Is there any consideration, I guess, for some of that consistency with with the head coaches, as far as being in charge of the program and kind of having, with all the uncertainty, there's still, I feel like, a certain amount of work they're going to have to do anyway. Is that, or are we assuming that the practices that we're setting up and that opportunity kind of covers those coaches?
I think we have not discussed what you just asked about, but I do think that the practices, the 10 hours a month, is allowing our head coaches, because it's primarily our head coaches working with our athletes right now. Some of our assistants are also working and we're paying them as well. But I do think the 10 hours a month at this time is going to allow our coaches to continue to build and do some of those things. In the out of season practice world, some coaches do more than others. Some students can participate more than others, because we do have 2 and 3 sport athletes who can't always participate in all of the other sports out of season activities. So I think our coaches have done a really good job, especially our head coaches, of building those relationships. And I think that they will continue to do that as long as we're able to sustain the model that we have right now.
Okay, we're currently at 7 votes. Oh, sorry, we're now at 7 votes, and we have consensus for option 1. So we can now vote on question number 11, for which we have 4 votes. If you want to speak to that.
So a little bit of information about school board decision point number 11. Last spring, every Montgomery County employee that was paid by the school division was working in some fashion during the closure, maybe not in their the role that they were hired for, such as our aides being on buses delivering meals, but they were working for us. We did have some employees choose not to work, and those employees that chose not to work, not because of any medical reason or anything else, they just chose not to work, they were not paid. Last spring, our spring court sports coaches worked 18% of the season, and that's from the start date of the season to the championship, the state championship final date, because I think every coach's goal is always to get to that state championship. And we paid them 1/3 of their stipend. This was due, again, to the concern of overall funding. We weren't sure what our sales tax revenue was going to be, so we made that decision for funding, but also from an equity standpoint. Our fall and winter sports coaches, they worked a full entire season from the beginning through the state championships. poor Auburn high school basketball was there in Richmond and scheduled to play, and then that got ripped away from them because of COVID. So, but they were co-state champion. So that's the good news. I did do an informal survey of HR directors in our area. Of the responses I got, only one school division paid 100% of spring sports stipends. The rest of them ranged from 25% to 50% that they paid. To retroactively go back and pay our spring sport coaches for the 2019-20 season would cost the division $168,510. And this is the question for the board. Our recommendation is not to do that. We feel that it was a fair and just decision that we made with our coaches because unfortunately they just weren't able to work with the athletes like they normally would have. So I'll answer any questions that you may have.
Any questions, board members?
I wanted to chime in here on this one. This is, again, I think for me, this is not as binary. I'm going to say yes to this one on the retroactive pay because, to look at it from an equity point of view too, I think another way to look at it is that, we enter into year-long contracts with these coaches. It starts in August, and my understanding is that some of them take it seriously and they work on building their program or they work on working with those athletes throughout the year, really. And there's a lot of work that goes into it, and the season really, in a lot of ways, for a lot of these coaches, is the reward. And I am sorry for so many of our student athletes and coaches that, because of what happened. I understand the legalities, if you will, of our ability to pull that back when we don't have the funding. But if we do have the funding, and I'm, that's something we can talk about. I think, from an ethical point of view and from a what's right point of view, and also just speaking from my own experience, watching what my daughter did in the spring with teachers, remote learning, and then working with, having a coach who's doing the same type of thing, encouraging the kids and giving them, kind of just remote activities and things to keep them active and stuff. It was just as important what she did with athletics as what she did with academics. And I'm grateful, for that coach, for the work that they did. And so in my mind, I think the right thing to do here, if not the legal thing, is to do that retroactive pay. And I think that's especially true for, again, for the head coaches that probably spend the most amount of time and really do a lot more of that work year round. And certainly if there's situations, we've definitely gotten a few emails, and if there's situations where coaches weren't notified properly or something like that, I think we have to take care of those types of things. So I'm voting yes on this one.
For me, I have to say that I love athletics and I love everything that comes around that. But if you're not having games, you're not getting gate, you're not getting the money, and that hurts. And all coaches, not just spring coaches, not just fall coaches, work with their students all year long. So to say that it's just a spring thing, I think that's a little unfair to the rest of the coaches. So I think if we can't vote for fall, I don't think we should vote for spring as well. And I guess they would have that same opportunity to do the 10-hour a month to work with their students as well to regain that. And sad to say, this has affected every business and we've all lost. It's not just one certain type. And I know this is not what we're voting on. We're voting on a coach's situation, but sad to say it affects everybody. And it's just losses that we all have to accept. So.
All right.
Ms. Bond, just to reply to that, to what you said, I think maybe you misunderstood what I was saying on the, as far as, we're talking about last year, and last year's fall coaches, if you're a fall sport, you signed that same contract and you worked with your athlete, you had your season in the fall, and, maybe you did a bunch of work and worked with your athletes and stuff and kept up with them in the spring too. And that's what you normally do. you got paid your full stipend, whereas the spring coaches didn't have that opportunity, right? So that's all I'm saying about that.
On number 11, we have 7 votes, and the consensus is no. So we can move on to number 12.
If it pleases the board, I believe that's the end of Mr. Knott's presentation. It's been about 2.5 hours. Is the board interested in having a quick break?
Yes.
5 minutes.
Thank you.
And that also gets us halfway through our questions. We still have another half. Halfway. We're only at halfway through the questions.
Only halfway.
And after that, we have agenda too.
You might not be back yet. We can start.
Mr. Chewbacca?
Paging.
No.
Yeah, I'm here. I can hear you.
Okay, thank you. Thank
Okay,
you.
good evening, everyone. Members to the board, Dr. Meyer. In reference to attendance information, attendance expectations will be communicated to our parents and our guardians prior to the beginning of the school year. Attendance will be taken in class through synchronized instruction and through the remote and virtual learning platforms. At this time, the state is still creating guidelines on what the attendance will look like in the virtual learning programs. Our practices regarding attendance will be updated according to those guidelines as they are released from the State Department. All of our students are expected to attend school each and every day and participate in the home synchronous learning. Our teachers will take attendance online during synchronous learning based on the students that they see who are engaged, those students who are focused, and those students who are participating in the learning platform. But for those students who cannot attend school due to quarantine, but they are well, we are expecting those students to participate. We are expecting them to focus. We are expecting them to be engaged in the remote learning platform, and they will not be marked absent. So if we see students being engaged, focused, completing their work, we will make sure those students are accounted for attendance-wise. Our Wednesdays will be used as independent work days. On those days, our students will have the opportunity to participate in a variety of online activities. Those activities include, but are not limited to, enrichment activities, tutorials, counseling, clubs, and also classroom assignments. All students are expected to be on time and present for class in the remote learning instruction. In reference to discipline information, once again, those expectations will be communicated to our parents and guardians as well prior to the opening of the school year. All students will be expected to follow the MCPS Student Code of Conduct guidelines. Students are expected to follow those guidelines in the remote and virtual learning platforms as well. So to set those expectations, we will email out to our parents with the first week's packets of signings for our parents. We will email out what's called the elementary remote learning platform and the secondary remote learning platform. That will give our parents as well as our students the expectations on what should be taking place in our virtual learning platforms. This brings us to school board decision point number 12. Expectations will be communicated to parents and guardians prior to the opening of the school year about the expectations for face coverings. If students are required to wear a mask, what happens if and when a student refuses to adhere to these guidelines? We have two options on the table for the board tonight. First option, students will be given a mask and asked to wear it. If they refuse, the parent and or guardian will be contacted to encourage the child to wear the mask. And as we spoke about earlier, I'm just trying to have that communication with our parents about the expectations to see if they can help support the overall goals and expectations of the division. If the student will not wear that mask, the parent will be required to pick the child up from school. Students who refuse to follow those guidelines on a regular basis will be required to participate in a remote learning platform. That is the recommended decision from the leadership team based on the safety of students and staff. And I also want to make a point to the board that if a parent has a concern about safety, if a parent has a concern about a student not coming to school based on COVID, a parent has the option to make sure that their child participates in a remote learning platform. Okay. And then option two, students will be given a mask and asked to wear it. If they refuse, the parent or guardian will be contacted to encourage the child to wear the mask. If the student will not wear the mask, they will not receive any consequences and they will return to class without a mask. Again, we ask the board to consider these options and please provide us with your directions. Do you have any questions?
Board members, do you have any questions to Dr. Robinson? Dr. Johnson?
We currently have 5 votes. We're waiting on 2 more. We're now at 6 votes. Okay, we're now at 7, and we have a consensus for option 1. Students will be given a mask and asked to wear it. Students who refuse to follow guidelines on a regular basis will be required to participate in remote learning. Thank you.
Thank you, Dr. Johnson.
Thank you.
Dr. Johnson.
Dr. Wickham's up.
Based on the elementary schedule that was approved on June 16th, what I'm about to share with you is the instructional elementary schedule. Children are assigned to an AM or PM block with half of the students attending at one time. Students will eat grab-and-go breakfast in their classrooms in the morning and lunch in the afternoon in their classrooms. Remote and virtual learners are assigned to one teacher's class per grade level per school, and additional sections are opened should they be needed. In-class and remote instruction includes access to both whole and small group instruction with opportunities for differentiation. IEP teams will determine individual students' placements for students with disabilities. ELL students at proficiency level 1 or 2 should be scheduled for full day attendance, and students will receive both core content and specialty instruction. So decision point number 13, specialty teachers provide instruction in art, library, music, PE, and STEM. This is usually done by taking the students to those classrooms. This means that many students use the same space with very little time in between. Recommendations regarding social distancing and mitigation have promoted the minimization of the use of common spaces. So how will elementary students access their specialty teachers? Option 1, specialty teachers provide instruction in the classroom so as to limit the use of common spaces and movement. PE teachers would be the exception. They would go outside as much as possible and take students to the gym when they can't go outside. The second option, students will travel to specialty classrooms, increasing the use of common spaces and movement, requiring additional cleaning. Our recommendation is option 1 that follows the CDC and VDOE guidelines for minimizing the use of common spaces. And additionally, in those specialty schedules, specialty teachers could have anywhere from 3 to as much as 6 classes in an AM or PM block. And that would require a lot of cleaning, and we simply don't have the custodial staff to assist with that. What questions can I answer for you about that?
I guess a challenge would be, for music, dragging all their stuff over there. For art, the same thing. I mean, and certainly, for library, the students really love to go to library. And I know we can do all that on carts, and that may be what we have to do. I just hate that they're missing out on being in those spaces.
And we are prepared to purchase carts should we need to do so. And an option for library with the first choice would be that children would go through Destiny, choose their books, kind of like we did in the spring when we were taking the books on the buses. They would choose their books. The librarians would then bring them to the classroom to give them to the students. And again, it's approximately 30 minutes per class. It's really not a lot of time, and it's certainly not a lot of time in between for cleaning. But that's a very good point.
I think it'd also be good. I understand the reason for the recommendation, but I also think for students just to go somewhere different, get out of the classroom and
and be in a different environment would be helpful. And, and again, for the teachers to be in their space, more
I-
familiarity, but I understand the reasoning for the first one. Just, I wish we could make the second one work.
I agree, Ms. Cass. That would give them a breakout of those 3 hours.
Yeah, just, just a chance to get out.
What about outdoors?
What about setting up, like doing some outdoor teaching and
PE teachers, of course, will take their students outside when possible. And certainly if teachers had the opportunity, I know some of them have doors with outside access. The idea here is to limit the movement in the common spaces, the hallways, and then using those classrooms. But I certainly could see there could be times where they might be able to go outside of their classrooms.
like music class, do it outside or.
Is this, Ms. Wickham, is this something that we can let buildings, on a by building basis, depending on the workload of the custodial help or the willingness of specialty teachers? I look at this thing and I don't want to pick option 2 because I don't want to go against that recommendation necessarily all the time, but I don't want to pick option 1 and hold them into one scenario either. Is this something that we have to decide on? Is this something that if it can be done safely on, occasion that they can, rotate?
I think that's a
somewhere
great question. It comes back to something that was discussed earlier, and that was the idea of when children are sharing those common spaces, it is the cleaning factor that's involved, and then who would do the cleaning. And again, a common day, maybe 3 of those classes in an AM block, but it could be anywhere up to 6, like I said, and just making sure that you would have the time and the personnel in between those classes to be able to clean.
Okay, currently we have 6 votes. We're waiting on the 7th. There we go. So we have a consensus for option 1. Specialty teachers will provide instruction in the classroom so as to limit the use of common spaces and movement.
Thank you. The next part is how will we provide new instruction to elementary students? They'll receive new instruction from the classroom and specialty teachers. They'll have language arts, math, and a specialty each day. Students will have science at least twice a week and social studies at least twice a week. Teachers will provide appropriate homework for students to complete when they're not at school to support that missed time and to support that instruction that the classrooms provided. Additionally, reading teachers, gifted resource teachers, and other support teachers will continue to provide instruction as well. Students with disabilities will access the general curriculum with specialized instruction provided by a special education teacher as prescribed by the IEP. In-person and at-home students will receive instruction at the same time so that all students remain on the same pace. A virtual committee consisting of a teacher from each elementary school will provide support and resources to assist with those teachers providing remote learning. New instruction will be delivered to in-class and remote students using a combination of whole and small group and center-based instruction. Remote students will join the teacher in class for whole group instruction. The teacher would then do a small group with the virtual students, and then they would complete assignments asynchronously via Google Classroom. They'll rejoin the class for the next content area. Addressing the needs of all students equitably, students with disabilities will have their individual learning needs addressed through their IEP. Instruction will be differentiated during small group instruction, and assignments will be differentiated to meet students' needs. Grades K through 5 students and families will have the opportunity to access remote instruction through Chromebooks provided by the division. All students will be assessed to determine their needs. Data from assessment results will be used to guide all tiers of instruction, and ESL students at proficiency levels 1 and 2 again may attend for a full day. Administrators of curriculum are revising pacing and curriculum guides to ensure that essential content missed last spring is addressed and connected to the current curriculum. Identifying instructional gaps and student needs. Again, special education teachers will collaborate with the general education teacher on students' performance on classroom formative assessment to guide instruction. Special education teachers will also use ongoing progress monitoring methods as related to their IEP goals and objectives. Students with disabilities will receive instruction based on their individual needs as prescribed by their IEP. Admins of curriculum are seeking guidance from the VDOE for reducing the curriculum load. Essential SOLs will be identified and taught. Additionally, the traditional assessments that we give, such as PALS and MAP and so forth, will continue to be used. Administrators of curriculum will continue pacing and curriculum work with teachers throughout the school year to provide guidance and support. Supports for student success and well-being. Students with disabilities will have access to the supports extended to all students. Normal staffing allotments for counselors, tiered intervention specialists, and instructional coaches will be in place for the school year. The Student Services Department is developing and providing a program of additional supports for students. Online activities for Wednesdays have been discussed for topics such as meetings with school counselors, study skill seminars, technology assistance, as well as interest groups and clubs. Topics were suggested by stakeholders through our parent questionnaires, and we'll continue to gather feedback from students and parents regarding areas of focus on our Wednesdays. Professional staff will also be trained on these supports. Continuity of instruction for the elementary level. Our phase and level guidance for instruction will determine how remote learning is used at the elementary level. There are 6 grade level teams, a specialty team, a virtual team, and the elementary advisory committee. The delivery of remote and virtual learning was discussed and brainstormed with each team. Each school will have teachers delivering remote instruction at each grade level who will expand their expertise and be able to support other teachers should further closures be necessary. Again, Chromebooks have been secured for grades K through 2 in addition to the upper elementary grades. K through 5 students will begin using the Chromebooks in Google Classroom right as school starts, so that if students should need to move to remote instruction, they'll be prepared. Students with disabilities will have access to the general curriculum. Specialized instruction and accommodations will be provided through co-teaching and collaboration. Professional development. The technology department has offered numerous workshops that was spoken to previously, specifically to Google Platform. The technology and curriculum instruction departments will continue to provide PD on Wednesdays based on needs identified by teachers. Division level professional development will be held in the afternoons on Wednesdays, and this will be as needed with the exception of the anti-bias, anti-racism training, which will have both morning and afternoon sessions. PD for special education teachers will be made available by the special ed department through collaboration with other departments. Their PD has focused on strategies for implementing co-teaching virtually, best practices for providing specialized instruction in a remote and virtual environment, virtual collaboration, and implementing universal design for learning principles in a virtual environment. Robust family engagement. Teachers may use Wednesdays as a time to connect with families. Schools will identify the 2-hour time frame for office hours for students and families on Wednesday mornings. Schools will conduct virtual and remote engagement activities with families. The Student Services Department is developing and providing a program of additional supports for students. Online activities for Wednesdays have been discussed for topics, again, such as meetings with counselors and study skill seminars, as I mentioned before. Topics, again, were suggested by stakeholders through our questionnaires. We'll continue to gather feedback from students and parents regarding these focus areas to ensure that we're meeting their needs through these engagement activities. And again, professional staff will be trained on these. Special education case managers will continue to regularly communicate with students and parents and guardians through multiple modalities, including but not limited to telephone conferences, virtual meetings, parent-teacher conferences, newsletters, Google Forms for data collection, or submission of parent questions, concerns, Google Classroom access for parents. And of course, we anticipate our teachers will continue to send home those letters like they always do at the elementary level. You can see here that elementary stakeholder involvement included an elementary advisory committee with representation from each school. There were also grade level committees, so kindergarten through fifth grade, there was a grade level committee, again, with a teacher from each school. There was a specialty teacher team with inclusion from the communities from each area of our division. There was a virtual committee as well, and again, each school had representation on the virtual committee. Additionally, meetings with elementary principals were held, and Jason Garrettson, our Director of Student Services, and Judy Diggs, our Director of Equity, they attended as many meetings as they possibly could that fit into their schedule. What you also have here is a list of the dates of the meetings, the purpose of the meetings. I included links to the presentations and agenda as well, and you can also see the number of participants. Any questions for elementary scheduling and programming?
That's an incredible amount of work. And thank you for all that.
I have
Any
a question.
questions?
Oh, I'm sorry.
I'm sorry?
Were you going to ask a question?
Sure, yeah, I was just going to say, any questions? Go ahead.
I'm right back to the beginning. I do have a question. And I want to make sure I understand. In-person and at-home students will receive instruction simultaneously so that all students remain on the same pace. Does that, I'm not clear what that means. Does that mean that, is this synchronous learning? Is that what you're talking about?
Yes, it's synchronous learning, and that's a great question because at the secondary level, and I think this has been a point of confusion in some areas, we have a virtual platform, and children have used this virtual platform for years. At the elementary level, we don't have a virtual platform. Of course, now things are coming on the market. We're investigating, we're looking into them, but right now our remote and virtual looks the same. So where the children are being assigned, if they're a remote student, into one teacher's class, either AM or PM or both, depending upon the numbers. And then that teacher then is conducting that instruction from her school, from her classroom, his or her classroom. And then should parents decide that they want to send their child back to school, then that teacher's already started building relationships with that student, gets to know that student, and they would be able to go into that teacher's class.
I wanted to just make sure I understood.
Yes, great question.
The remote learning elementary students, if they don't have the access of internet, are they coming to school as well?
That's a
Even
really
though
good
they-
question. It is our hope, obviously, that children who don't have access, we would give them that opportunity. But if there was a child that could not access instruction remotely using a Chromebook, didn't have internet access, we have talked about a workaround for that. And what teachers would do, they would record their lesson for that student and provide the student that lesson that way.
Any other questions, board members?
How will I guess this is maybe more of a nebulous question. I'm not sure exactly how to ask it, but I guess I'll say it as a statement. I'm concerned about the synchronous, like I think that I'm concerned already about the remote learning at the elementary level, as I'm sure that you are. And then to add that other layer of synchronous learning on top adds even more concern. I'm not saying that we can't do it necessarily, but I guess this is being presented as a plan, and you know, some of the questions that pop to my mind is, you know, can we even do this? How do the teachers feel about it? Is there another way to, you know, to deliver? I mean, I know, you know, my daughters went through elementary school and there was always team teaching going on, right? So is there any way to kind of spread the burden for the teachers so that maybe, you know, one teacher in the team is handling, you know, the online class and one teacher is handling the in-person class or something like that? I mean, have those things been discussed?
So yes, with the elementary advisory committee, the grade level committees, the specialty teacher committee, the virtual committee, and the elementary principals group, we have discussed this with all of those teams. And the advisement that we received from the teachers, their preference was to schedule, just as you said, as much as possible. Principals were asked to schedule remote and virtual students into the same class so that only one student then would have to plan and conduct instruction for those students. And at this point in time, for the most part, across the division, principals were able to do that. There are a couple of classes where one teacher is managing a handful of remote students and a handful of face-to-face. But again, it's one teacher per school, per grade level doing this. And that was their recommendation. That was their preference. Again, to make that planning easier for them. And then it also is preparing, so should children come back, like I said, they would already have that relationship with the teacher. And then additionally, we're training up those experts who will be able to help us move into remote instruction should we need to do so. Because last year, you recall, kindergarten, first grade, second grade, they did packets. Based on our feedback from our teachers, they understood that was the best you could do on the fly, so to speak, but they were not a fan of the packets. They did not feel like that they could introduce new instruction through the packets, and they felt like this would be more equitable for the children to give them access and just better instructional opportunity to be able to learn new material.
Just make sure it's clear that, again, this is one teacher per grade level in each school that will be teaching virtual on the 25% or 50% model.
Yes.
If we are to scale it back to all virtual, then all elementary teachers will be teaching virtual or
Correct.
rather remote.
Correct.
And there's
Including K,
So
including K through 2, right?
Including K through 2. We've secured Chromebooks for K through 2. And like I said, our hope is that as soon as the children start school, and they use Chromebooks anyway for different programs like iStation, iExcel, but we haven't really trained them in Google Classroom.
Right.
And so kindergartners in particular really need that experience. First graders only had a half a year of it last year. So we need to get them in, get them trained as quickly as we can so that should we need to move to remote, we would be prepared. You know, of course, at the elementary level, the data for years, you know, tells us that reading proficiently by the end of third grade is a huge predictor in whether or not a student will be successful in school and graduate. So it's really important that we have a way to deliver new instruction and really help children in K through 3. They're learning how to read. When they get older, they're reading to learn, but we need to be able to have that opportunity for new instruction.
So let me say this too, that if we are fully remote with elementary school, then the kids would still be divided in an AM/PM model. So the teacher would not be expected to teach all 20 students remote all day. It would be 10 kids the first half of the day, their PM kids the other half of the day.
And we did ask teachers their opinion on that. What was their preference for that? And they said they really felt like keeping that consistency, having half the kids at a time, that was their preference.
Yeah, because if we started remotely and then went to the 50%, the kids would be in that cluster. I want to just make sure I understand. So there'll be one teacher in the school, each grade in the school who will be having face-to-face students and also students synchronously.
Not necessarily. It depends on the numbers.
Okay.
So if you, let's say you have 20
But
children.
not every teacher and every.
Correct. One
Okay.
teacher per grade level per
Okay.
school. Yes.
That's what I wanted to know.
So I'm sorry, Barbara, I wanted to just clarify one thing then on that. So I like Jason's model here, so I'm gonna use your name. So if you know Barbara is in second grade or let's say third grade and is attending in person, but then the following week, you know, over the weekend she was exposed or did something risky, and her parents want to hold her back, you know, for the next couple days or for the next week. Does Barbara go from teacher A to teacher B, you know, on given days, or how does that bouncing back and forth work?
That's an excellent question. And last week when I met with our specialty teachers virtual team, elementary principal team, I'm trying to remember the different groups, but we met and we actually discussed that question. And I asked them what their preference was for that. And their preference was if a child starts school and let's say they're there for 2 weeks and then something happens and they need to go remote, but it's their parents' intention for the child to come back to school after whatever that issue is. Maybe they needed to self-quarantine or what have you. So they start out and they have to go remote for a short period of time and then they're coming back. What they would do is they would start in their classroom teacher class face-to-face. When they go remote, they would jump into that remote virtual with the one teacher who's doing it. And then when they returned, they would go back into that teacher's classroom where they started, trying to keep those relationships going.
Okay, thanks.
Yes, sir.
Any other questions?
What's going to happen to pre-K?
Yes, so pre-K, and they have a plan as well. If they needed to go remote, then they would continue with paper pencil packets. They're also talking about putting some kits together. We're looking at funding for that to be able to make that work at home more robust, to be able to provide those materials.
And will there be elementary students will be attending full day if they do not have internet connection, like we've been talking, right?
So that,
Or not?
They will be attending a half a day.
A half a day, okay.
Correct.
That
Unless
was
the
in the
IEP says
Correct.
different.
Okay. Thanks.
Mr. Pauley?
Did the air get cut off?
Yes, I
Yes.
think so. It got hot in here.
It's
didn't it?
starting to cool down again. I think we've got it going.
Not making noise.
I could.
Yeah, it automatically goes off, doesn't it?
Yeah, it's a timer.
Good evening. As you can imagine, Dr. Wickham and I worked very closely together on our instructional plans. We're essentially two halves of the same coin when it comes to instruction. There are many, many similarities in our plan, especially the last half a dozen or so parts of the plan are nearly identical. But the key differences are what you'll see in how we have our students scheduled and the way in which we are providing the instruction. As you know, you approved secondary schedules on your June 16 meeting. And in those schedules that you approved, we will be providing daily face-to-face instruction for all students while following appropriate prevention strategies. And as Mr. Krantz explained, each classroom will have a designated maximum capacity based on square footage and on physical distancing requirements. The elements of the secondary schedule are listed there for you. They provide a combination of remote and in-person instruction. I'll run through those with you quickly, but because it is really just a verbal way of explaining the charts that you've seen of the schedules. All middle and high school students will be divided into two groups at 50% each. Each group will take 2 classes in person and 2 classes remotely every day. Groups will alternate morning and afternoon sessions to provide equal in-person access to all classes. When students are not attending classes in person, they will participate in synchronous remote learning at home. And that's defined later on in the plan for those of you who are wanting to hear that. Principals will work with families to accommodate a need for sibling schedules to be aligned. For students with disabilities, IEP teams will determine individual student placements. Students whose families prefer that their children not attend any in-person classes until we enter the beyond phase 3 portion of our program may participate in all of their courses remotely through their current school, following their schedule at their current school. But students who prefer to take all courses in a fully virtual learning environment, even after schools fully reopen in beyond phase 3, those students will enroll in the MCPS virtual school program. These students, as you know, will take virtual Virginia courses, MCPS virtual courses, or a combination of those courses. So we have a clear distinction in secondary between what is virtual and what is remote. In providing new instruction at secondary, as I said earlier, the instructional model for secondary courses is remote synchronous instruction. And this is defined as in-person and at-home students receiving instruction simultaneously, and all students remain on the same pace, just as Dr. Wickham described it. And teachers the same autonomy that they've always had to determine how they teach their classes. Within the synchronous model, teachers will determine the best way to group students and differentiate activities within their combined in-person and remote classroom. The expectations are laid out for you below. All at-home students must be present or connected remotely in their assigned class at the beginning of the scheduled class time, just as Dr. Johnson explained in the attendance section. At that point, the teacher will take roll and record the attendance. The teacher will then address the entire class, the at-home and in-person students at the beginning of each class, to explain the objective, the relevance of the planned lesson, and the success criteria for the day. The teacher will also review the day's itinerary and explain the expectations of each group. In other words, the teacher will lay out what the planned activities are. It's the initial instructions to students and the direct instruction that will be recorded for later access, and we'll have the camera facing the teacher only during that time. Teachers who have chosen students who have chosen the fully remote option will be included in class activities available to in-person students. But the teacher will determine whether or not at-home students need to remain connected while doing independent work, because the teachers, we are telling them they need to be aware of the limits and cost of home internet services. The teacher will maintain an open connection through the class period to allow at-home students to reconnect and ask questions if they need to do so. The teacher may also designate a time for at-home students to reconnect and check in, like perhaps at the end of the period for closure activities. As far as addressing the needs of students equitably, this is essentially identical to the plan you just heard in elementary. We have administrators of curriculum revising pacing and curriculum guides to make sure that essential content missed last spring is addressed and connected to the current curriculum. Grades 6 through 12 students and families will have the opportunity to access remote instruction through Chromebooks provided by the division. All students will be assessed to determine their instructional needs, and data from these assessment results will be used to guide all tiers of instruction. Instruction will be differentiated during small group instruction, and assignments will be differentiated to meet student needs. The secondary plan provides differentiated access for students with disabilities, English learners, students in need of intervention and remediation, and students with no home internet access. A modified schedule will be developed for students who have special needs in order for them to access specific services. And that's delineated below in the sub-bullets below. Students with disabilities will access the general curriculum with specialized instruction provided by a special education teacher as prescribed by their IEP. Students with disabilities will have their individual learning needs addressed as prescribed in their IEP. And ESL students at proficiency level 1 and 2 may attend for a full day. While schools remain partially reopened for 2021, teachers will have set office hours on Wednesday mornings so that they are available for students and parents to contact them. Students may meet with teachers individually or in small groups during office hours for conferences, additional assistance, remediation, and intervention. Schools will identify the 2-hour time frame during the morning for office hours for students and families on Wednesdays. Identification of instructional gaps and student needs. Teachers will collaborate with administrators of curriculum and colleagues to identify essential content that was not taught last spring. Pre-designed assessments will be given to determine learning gaps, and map testing will continue in grades 6 through 8, and we will be adding that to grade 9 to measure student growth over time and provide teachers with information they need to differentiate and adjust instruction and to make students focused, data-driven decisions in language arts and math. Pacing will include a review of last year's essential concepts and skills covered in school year 2019-20 and develop lessons and assignments that focus on essential concepts and skills to be covered in 2021. Classroom assessments will include formative, summative, formal, and informal measures. Formal summative student assessments will be done in person. This was a rather major point from the advisory committees and the teacher survey feedback. The idea of doing formal summative assessments in person was very important to the teachers. Teachers will have to devise a way to administer the same summative assessments to the all remote students in a secure manner. Special education teachers will collaborate with the general education teacher on students' performance and classroom formative assessments to guide instruction. Special education teachers will also utilize ongoing progress monitoring methods as related to the student IEP goals and objectives. Under supports for student success and well-being, as you know, Wednesdays will provide opportunities for students to engage in additional offerings through student services, such as counseling, social emotional learning, cross-district and school-based discussion forums, student leadership training, etc., as well as outreach and assistance connecting families with additional services they may need. Specific guidance for specialty classes, PE, fine arts, and CTE, is being developed by curriculum administrators. Athletic and extracurricular activities may continue with some mitigation, and at the time we wrote this, it said guidance forthcoming, but as you heard this evening, Danny Knott shared with you what that guidance is. Students with disabilities will have access to supports extended to all students. Revisions to curriculum pacing and instructional delivery. Again, administrators of curriculum are seeking guidance from the VDOE for adjusting the curriculum by identifying essential SOLs to be taught. They are also collaborating with teachers prior to the start of the school year to revise pacing and curriculum guides identifying essential concepts to be taught during 2021. Essential SOLs that were missed during last spring will be integrated into the curriculum where they seamlessly connect. The admins of curriculum will continue pacing and curriculum work with teachers throughout the school year to provide guidance and support. Teachers will also collaborate on strategies for teaching the content to include remote learners throughout the school year. Students with disabilities will receive instruction based on their individual needs as prescribed by the IEP. For continuity of instruction, the MCPS phase and level guidance for instruction will determine how remote learning is used at the secondary level. Survey feedback indicated strong favor for synchronous remote instruction, and it was the recommendation of the Secondary Advisory Committee that this should be the model for secondary, not the asynchronous model used in Q4 of 2020. And on page 46, you'll see the beginning of the stakeholder involvement, secondary stakeholder involvement. The synchronous remote model will allow students and teachers and students to adapt more easily to fully remote learning should further closures be necessary. As we said earlier, it's important that students just be extremely comfortable and practice with remote synchronous learning in case we fully close and that becomes the full model. To prepare students for possible future school closures that require fully remote learning, teachers will integrate technology into in-person instruction regularly. Delivering remote instruction daily will expand teachers' expertise and student familiarity with the model should further closures be necessary. All secondary teachers will be issued new Chromebooks, as Mr. Wickham explained, with better cameras and audio to deliver remote instruction. All secondary students already have Chromebooks. Students with disabilities will have access to the general curriculum. Specialized instruction and accommodations will be provided through co-teaching and collaboration. Preparing teachers through professional development. Professional development on remote pedagogy, assignments, and assessments, as well as training in Google Classroom, Google Meet, Edmentum, educational software and apps, website tools, Canvas, and more, will be provided throughout the school year on Wednesdays. Having set office hours will allow teachers to have the rest of the day as time for collaborating with colleagues, lesson planning, training, curriculum work, etc., without the expectation to be available all day. Professional development for special education teachers will be made available by the special education department through collaboration with other departments within MCPS. Focus on strategies for implementing co-teaching virtually, best practices for providing specialized instruction in a remote or virtual environment, virtual collaboration, and implementing universal design for learning principles in a virtual environment. The technology department has offered numerous workshops on the Google platform as well as video conferencing to help teachers be better prepared. The technology and curriculum and instruction departments will continue to provide PD on Wednesdays based on needs identified by the teachers. Division level professional development will be held in the afternoons on Wednesdays, with the exception of anti-bias, anti-racism, or as we're referring to it as ABAR training, which will have both morning and afternoon opportunities. Our last section is robust family engagement. I believe this is identical to the elementary plan, but just to read it through quickly, teachers may use Wednesdays as a time to connect with families. Schools will identify the 2-hour time frame for office hours for students and families Wednesday mornings. Schools will conduct virtual and remote engagement activities with families. Student Services is developing, providing additional supports for students. Online activities for Wednesdays have been discussed for topics such as meetings with school counselors, study skill seminars, technology assistance, and interest groups and clubs. Topics were suggested by stakeholders in parent questionnaires. Wednesdays will also provide opportunities for students to engage in additional offerings through student services such as counseling, social emotional learning, cross-district and school-based discussion forums, student leadership training, etc., as well as outreach and assistance connecting families with additional services that they may need. Special education case managers will continue to regularly communicate with students and parents and guardians through multiple modalities, including but not limited to telephone conference, virtual meeting, parent-teacher conferences, newsletters, Google Forms for data collection or submission of parent questions, concerns, Google Classroom access for parents. The number and types of stakeholder meetings and the agenda and the presentations that were made in secondary mirror those that were done in elementary. Dr. Wickham and I worked closely to make sure that we were aligned in that way. All of that on pages 46 through 51 are outlined for you. So at this time, does the board have any questions for me about the secondary plan?
Board members, questions?
Do not. Thank you.
Well, we've had a lot of teachers questioning the whole synchronous learning, and you know that. And
Mhm.
we've been trading emails all over the place
Yes.
about it. And there's a lot of concern that it's going to be very difficult to be, and I see here this one line, review the day's itinerary, explain the expectations of each group, plan activities for the day. So basically, it sounds like you got to do 2 plannings for each period. You got to have a plan for your online people, and you have to have a plan for your synchronous learning people. And so it sounds like that's a lot of extra work for a teacher to be doing that. I know a lot of teachers thought that they weren't going to have to do synchronous, and this has sort of come up, even though they were told they weren't going to have to do synchronous learning, and now all of a sudden they have to, and they've got to do extra planning.
So I'm not sure where teachers didn't know that they weren't going to do synchronous instruction. That's something that was approved. Those exact words were used when we approved the schedule back in June. Certainly my meetings with teacher leaders, that was explained thoroughly what synchronous remote learning was. The initial intent was for them to not have to do 2 different lesson plans,
Right.
that they would actually just, everybody would stay online and everybody would be in front of them and it would all be simultaneous. But we had since, as you know, that time gotten some feedback from teachers saying they didn't want to do that. So we gave them flexibility, saying that at a minimum, you need to at least have them there at the beginning, explain what the objectives are for the day and the success criteria and the planned activities. And then the teacher, as it says there, the teacher determines
Okay.
what each group will do. Like if I were teaching, I would think most of the time my preference would be to include both at the same time simultaneously, but we wanted to leave that flexibility open. So I understand that in trying to please one group, we upset another
I
and
think
then
the
vice
key is
versa.
the flexibility.
So the key we decided was we used,
That is the key word.
yeah, so if you notice, the words used are autonomy and flexibility. We wanted to lay out some bare minimums, which was they have to be there at the beginning. They have to at least be told what the objective and the success criteria are for the day and what the activities are. And then the teacher has to remain connected so that those students who want to come back in and ask questions, or they can certainly stay on the entire time.
Now, let me say this. There is a group of students, the group of students who families have chosen to be completely remote during this time. I mean, we can't give that option unless they're actually engaged in that class like they're actually there. So they'll have to be a part of that class some of the time. So, but we can't give the option if we don't, where they stay home.
And there's no way to have remote students in one particular group.
Yeah,
I mean,
that gets
like we're doing in
elementary.
in the elementary
Yeah,
school, you know, you've got one
That's-
person, and now we got every single teacher has
Right.
to do this,
Right,
and
so
that's
let me answer
The
that.
challenge, the challenge is, you know, with high schools, is the multiple courses that are offered. We would be limiting the number of classes that students would be able to take if we didn't actually do that.
but middle school you could probably do it.
They still specialize, even though their certification, as you know, is
It would be
is
easier
broader.
too. But, you know, we're still, you know, moving, there's still a possibility of moving from virtual to, you know, in person, face to face. So yeah, it's going to be more work. There's no doubt. It's going to be new for teachers. It's going to be new for middle and high school teachers.
What kind of numbers are we looking at as far as, do we know how many students we're talking about that are going to
didn't
be
print that out.
Remote.
remote?
I have that information, but I didn't bring it with me.
Okay. Yeah, Mr. Husband has virtual. He'll talk about that in a second. The remote piece.
I can look it up and
We've got the numbers.
I'm just curious as to how
Mm-hmm.
many we're talking about here. And then how many was it again we were talking about we're going to be going full-time because they don't have internet? There was a number of students.
I
The
think
number who would
60.
actually,
60 students who don't have,
it was
Access
about,
to-
it may be about 80 in
Okay.
the whole division. So, I mean, that's divided by 20 schools.
80 in the secondary.
no.
No, in
Or
all, yeah.
Oh,
And they would be going, because they don't have internet, they would be going.
Yeah. And that's, I mean, that's probably fewer than 5 to 10 a school, depending on how big the school is, you know, total.
Well, actually, elementary wouldn't even count there. It would be secondary. Okay. I'm just wondering what the numbers are. How many we're talking about?
Yes. You want to come up if you would, so everyone can hear you? Thank you, Mr. Wickham.
Thanks,
You took it off.
Oh,
It's
I would be the
completely
unlucky
clean.
one that happened.
Looking at the survey data, it looks like for the middle schools, there are 345 students who have asked for remote only. And for the high school, there are 467 students who have asked for.
That's the
remote
remote, not
only.
virtual too, correct?
Now, that's just remote
Just
only.
remote.
Virtual is 124, but these numbers may be updated. And some of these are.
Do you have it
are
by
a little bit
school?
I was
duplicated.
gonna say, do you have a
Did-
breakdown?
I do
Just-
have it
just so
by
we can do a
school, so
comparison.
here we go. AMS 48, BMS 149, CMS 116, and SMS 32. That's for remote only.
Is that by survey data?
That's by survey data.
So the survey data, can I speak that?
It's,
You
it's
can.
sounding like around 10%.
So the survey data, the principals have called these people
Right.
and there was a good bit of confusion
Yeah.
as they
Virtual was
thought
remote,
that they
yeah.
were saying one thing and they were really,
Yeah, I got a lot of questions.
right. So I actually have the actual numbers based on what the principals found out.
Well, these were initial.
thought
We
they-
did update some
Yeah,
of
these
those
are updated, I think.
Yeah.
It's,
as much as I can. AHS 52, BHS 206, CHS 159, and EMHS 50.
Okay.
Those are remote
They
only.
went up then.
Thank you.
Yes.
Well, that's it's more like 15%.
So I just, it's
I'm
in
just
the,
trying to get a sense of
Yeah,
how
sure.
many students are going to be remote. So you're teaching a class about how many students are going to be remote versus how many are.
Now you got to remember
Wanna be in
too, at the high school, those students will still have access to virtual Virginia, so they might not actually be with the teacher. That will be a few in courses from here to there.
Well,
you know.
and it's still going to be the 50%. So
Mhm.
you're going to have 50% of the in-person plus the 50% of the remote.
but back, your concern about the balance of the students who are remote or at home and the students in front of us. Based on all the surveys and based the experiences in Q4 2020 and the input from the Secondary Advisory Committee, it was very clear synchronous remote was what was needed and wanted. But we got a little bit of feedback after it got presented. We got a little feedback that we needed to provide more flexibility and autonomy. And then in doing so, I'm not surprised that some people see that as more work. So they may want to just do what we originally intended. We give them that flexibility.
And we've already heard from several teachers who have great ideas, and
Oh, wonderful.
we have great teachers that are creative. They think outside the box. We have teachers talking about flipped classrooms and doing already thinking about some pretty amazing things.
Do you want the numbers that I got
Sure.
from them? So thank you, Ms. Whitaker. So number of students in all remote, they're still pretty high. Auburn High School, 57. Blacksburg High School, 234. Christiansburg High School, 187. Eastern Montgomery, 47. Auburn Middle, 41. Blacksburg Middle, 141. Christiansburg Middle, 149. And Shawsville Middle, 29.
Just about 20%.
Yeah.
So I don't have a total on that, but that is the number of students who selected all remote versus the number of students who said they
this
want to
is-
go virtual.
And this is updating the survey. Okay.
This is
This
after
is
after
after
principals
calls.
made phone calls and said, "Did you really mean virtual?" And they were like, "Describe the difference." And then
Okay.
okay,
Mhm.
okay. I'm sure Mr. Husband can tell you what the virtual numbers are. Yeah, he does. Okay. Thanks.
Carl.
Any question, Mr. Chewbacca? Are you good?
Yeah, I'm good. And thanks, Carl. I appreciate the flexibility because that is the one piece that I heard about too. And I'm glad that we were responsive to that.
Thank you.
Thank you.
Okay, thanks. Dr. Walker, special education.
Evening, Madam Chairman, board members, and Dr. Meyer. In order to support scheduling for students with disabilities, the leadership does recommend that the division adhere to the regulations governing special education programs for children with disabilities in Virginia, which states that a free appropriate public education shall be available to all children with disabilities who need special education and related services aged 2 to 21, inclusive, who meet the definition of age of eligibility as outlined in the Virginia statute and who reside in the jurisdiction of each local educational agency. Based on the current division and parent questionnaires and collaboration with schools, the anticipated numbers of students with disabilities attending the hybrid school alternative model for this fall are as followed. 599 students attending half day, 227 students attending full day, 25 students attending virtual learning, and 114 remote instruction. The chart does break down the number of anticipated students with disabilities by elementary, middle, and high school instructional levels. These numbers will fluctuate as we are in the process of continuing to have IEP meetings over the next 2 or 3 weeks, so they could increase or decrease based on the outcomes of the meetings. Areas of support for scheduling for students with disabilities include that students with disabilities will be included to participate in all elementary and secondary scheduling opportunities according to the division's health and secondary educational plans. Educational placements and length of school day will be determined by each school's IEP team. School personnel will hold IEP meetings, again, with parents and guardians to review individual services and supports. Also, you heard earlier, Mr. Garrison mentioned that students with disabilities may have difficulty wearing masks. So there are many students with disabilities who have sensory issues outlined in their IEP, so they may have difficulty wearing masks because of the difficulty of the texture of the material on their faces. Also, some students may have difficulty because they just don't like anything covering their mouth or nose. But then there could be other students who will have no problem wearing the mask. So we will encourage all parents and students to continue to work on achieving this goal. IEP accommodations will be implemented in all educational settings. Students with disabilities who are participating in the full day instruction based on IEP team decisions will participate in alternative academic scheduling during the transition times between A and B groups, and that's with elementary and at secondary levels. The special education personnel will supervise and provide specialized instruction for students attending full day instruction during the transition times between the A and B groups. School administrators and special education teachers will implement academic scheduling and programming based on individual student IEP goals. Providing new instruction for students with disabilities. Students with disabilities will participate in all division-wide new instruction opportunities. Supports include access to specialized instruction and content and specialty areas will be decided by the IEP team. Special ed and instructional assistants will collaborate and implement IEP during content and specialty areas. All IEP accommodations will be embedded in remote and virtual learning content. Special ed teachers will monitor student progress and data collection on all IEP and goals and objectives. And division leaders will monitor the delivery of co-teaching and inclusive practices of new instruction in all in-person and remote content areas. Also, special ed teachers and instructional assistants will monitor and provide for all at-home students to ensure participation in synchronous learning. And finally, special ed teachers will provide instruction in all content areas for students who meet criteria for homebound and home-based students, homebound and home-based instruction through the IEP process. Addressing the needs of students equitably, students with disabilities will be included to participate in all division-wide new instruction opportunities. Access to specialized instruction in content and specialty areas will be decided by the IEP team. Individual learning needs of students will be addressed by school personnel across all instructional content areas as prescribed in the IEP. Students with disabilities will be exposed to differentiated instruction in all in-person and remote settings. And students with disabilities will be offered the necessary materials and supports to access academic content and related services through in-person and remote instruction. Identifying instructional gaps and student needs. Again, I cite the regulation that the division will adhere to the regulations. Students with disabilities will have access to participate in all division-wide formative assessment opportunities to identify and help remediate their instructional deficits. Special ed teachers will collaborate with gen ed teachers, again, to identify, work with student performances on classroom formative assessments to guide instruction. Special ed teachers will also utilize ongoing progress monitoring and data collection methods as related to student IEP goals and objectives. School personnel will ensure that students with disabilities will access PALS, MAP, running records, and benchmark, and other related educational testing to assist with identifying learning gaps. Students receiving school-based interventions who continue to struggle will be referred to the School Assistance Program for additional academic and behavior intervention support. The Student Assistance Program will refer students to the Child Find process if they continue to be unsuccessful with additional targeted interventions and supports. Students with disabilities will receive specialized instruction based on their individual needs as prescribed by their IEP. Special education supervisors and coordinators will collaborate with administrators of curriculum to assist co-teaching pairs with support in pacing and curriculum throughout the school year. My next topic is supports for student success and well-being. Again, I cite the regulations. Students with disabilities will access and participate in all division-wide opportunities to provide support for students' overall well-being. This includes counseling, tiered intervention, social emotional learning, student leadership training, and et cetera. All will be decided by the IEP team. Special ed teachers and instructional assistants will be trained with all these supports on Wednesday mornings. Resources for families will be filtered through the Parent Resource Center. My next topic is continuity of instructional plan. Again, I cite the regulations and the Virginia statute. Support areas include students with disabilities will have access to general curriculum, specialized instruction, and accommodations, all provided through co-teaching and collaboration. Students with disabilities will be provided with Chromebooks to access virtual content in a general curriculum. Students will receive IEP-driven supports and services by related services personnel. Special ed teachers, again, collaborating with gen ed teachers to provide specialized instruction for virtual instruction and embedded accommodations. Students participating in remote instruction who have targeted assistance outlined in their IEP will receive the targeted assistance and support by special education instructional assistants. Next area includes preparation for teachers through professional development. All professional development for special education teachers are provided by the special education department, again, collaborating with other departments. Professional development topics, again, include implementing co-teaching virtually, best practices for providing specialized instruction in a remote and virtual environment, virtual collaboration, and implementing universal learning designs. Professional development are provided for special education instructional assistance on Wednesday mornings. My last area I'll discuss is robust family engagement. A survey will be developed for community stakeholders to solicit their feedback on additional ways special education department could meet the needs of students with disabilities. Also, the special ed department will collaborate with the Parent Resource Center to develop a series of professional development opportunities designed to support parent knowledge and understanding of the Child Find process, the IEP process, 504 procedures, disability categories, student transition, dyslexia, AT services, and social and emotional wellness. With that said, that completes the presentation for the plan for special education. Any questions from the board?
Board members, any questions to Dr. Walker? Thank you so much for all the work.
Okay, our next presenter is Mr. Mark Hudson, presenting on virtual learning.
Thank
And let
you.
me say, Dr. Walker and his team's credit, it is a lot of work.
Yeah.
Whenever we change levels, of course, they've been planning for the 50% model. Whenever we change levels, they have to go back and redo IEPs, correct, Dr. Walker? Every time in this process that we choose to change levels of service, they have to go back and redo all IEPs.
Yeah, every student's IEP in the division,
How many are they?
about 1,094.
They have to redo 1,094 IEPs every time that we decide to switch between levels.
Yeah, we'll amend now over the next 2 or 3 weeks. If there is a move back in phase or shutdown, we have to amend again. And we'll have to do it again if we go to fully, the level back to phase 1 or level 1 to all the phases.
That's probably one of the biggest jobs in the division when we make a move from different levels of services for students. It's enormous. So thank you, Dr. Walker, for the work you're about to do.
So can I ask
I had a
one
question.
Yes.
With those changes, so that means the parents also have to be involved every time you're.
Yes.
I'm sorry, say again?
Yes.
That the parents also have to be involved every time you have to go back to the.
For every meeting, we
Every
have to have
meeting.
parent permission because they have to sign and we need their signature
Right.
to implement. So we involve parents for every meeting, for every IEP that we have for every student.
And part of that committee, every time that happens, who's involved in that?
The administrator, teachers, gen ed teachers, special ed teachers, related service personnel, anybody the parent feels they can bring that has knowledge of the child, professionals in the community, the whole IEP team for each IEP meeting for each student.
Crazy. Okay. Definitely appreciate what you're doing.
Thank you so much.
All right, thanks.
Good evening. Almost good morning.
Not yet.
I'm here to talk to you about our new virtual school program. First, we've talked a lot about remote learning and virtual learning. I would like to make sure that we're clear in our definitions before we dive too much into virtual learning. Remote learning is students may participate in remote learning exclusively or as part of the proposed hybrid plan. Remote learning allows students to remain home until schools fully reopen and participate in courses remotely through their current school. Students follow the in-person schedule of classes through synchronous remote learning and return to the current school once schools fully reopen, which is what we've been talking about for a few hours now. Virtual learning and the brand new virtual school program is for students and families who prefer to have the autonomy to participate in virtual learning throughout the 2020-21 school year, regardless of the consequences of the pandemic. Students who participate in the virtual school complete 100% of coursework online for the entire year. The virtual school program is hosted at Shawsville Middle School and Eastern Montgomery High School. As of Sunday, and I did check today, although we had already printed these, and the numbers are pretty stagnant. We have 50 middle school students who have signed up for the virtual school program. 53 high school students have signed up for the virtual school program, and a little under 75, I think it was 72 when I looked at it today, 72 students are undecided or have not responded to our outreach. And my best guess from the families that I've talked to is that they're probably waiting on tonight and a little bit more information. Due to the nature of the virtual program, phase guidance does not impact the instructional delivery mode for students participating in the virtual learning program. Virtual learning will take place both synchronously and asynchronously based on learning platform being used. Remote learning will be primarily synchronous, as Mr. Pauly has spoken about, but there is exceptions for hands-on practice and oversight to ensure the safety of in-person learners. Providing new instruction. Virtual learning will provide new instruction on a daily basis. The majority of courses will be taught by Virtual Virginia teachers. Teachers taught by MCPS, courses taught by MCPS teachers will provide new instruction in a variety of modalities to suit as many different learning styles as possible. Teachers will record videos of instruction, hold office hours for tutoring and answering questions, create videos with demonstrations, and will utilize other innovative forms of instruction. Teachers will be expected to provide feedback on a daily basis with work deadlines organized on a weekly, 4.5 weeks, 9 weeks, and semester-long basis. Addressing the needs of students equitably, strategies and supports will include the following items that were also included in the secondary return to schools component of the plan. For the next couple spots, there's actually identical overlap because the same policies and guidelines that we've provided to all secondary teachers also apply in virtual, and I don't think that I need to read that to you. At the bottom of page 57, I do want to point out under support for student success and well-being, that in addition to the guidelines that Mr. Pauly talked about for all secondary teachers, students in the virtual school program will also be assigned a mentor at either Shawsville Middle School or Eastern Montgomery High School. The mentor teacher will help students navigate the virtual school program and act as a liaison between the physical school and the student and their family. We've put a lot of time in talking to the administrators and counselors at those two schools about these students are students at Shawsville and Eastmont. They're not just virtual students. So part of what they get when they're students at those schools is they need to know when is tryouts for the football team, when is tryouts for baseball, when's the dance, when's prom, when are these after school clubs going to be meeting? And they need to be involved in all of the same opportunities that students normally would if they were attending in person. Skipping down to continuity of instruction plan, halfway down on page 58, the virtual school program is designed to operate seamlessly regardless of the current stage of the pandemic and the implications of in-person instruction within MCPS. So another benefit of this plan that Dr. Meyer came up with in June, that reflecting on my own time as a principal, I think that whether we were in a pandemic situation or not, I think that you probably have 5 to 10% of students that would take us up on a virtual school program at any point in time. It's going to work for a lot of families. So I've been emphasizing to families that we see this as a permanent piece of Montgomery County Public Schools moving forward. And I think that that works with a lot of family schedules. Preparing teachers through professional development. The majority of students will be taught through Virtual Virginia, and it's important for me to note that Virtual Virginia teachers are licensed Virginia teachers. I spoke with the director last week. He said they are yet to hire a new teacher. Every teacher they've ever hired has been a veteran teacher, and they're also required to go through training before they begin teaching with Virtual Virginia. We also have an ITRT that has been assigned to the MCPS virtual school to aid teachers in adapting curriculum to a 100% virtual environment. And the rest of that page, and most of the rest of it is identical to what Mr. Pauly went through. I do want to point out in terms of stakeholder involvement, we had, as you can see, a tremendous amount of meetings and feedback and involvement in the spring and early summer when we were talking about remote instruction. And sometime right around July 1st, when most of us were at the beach and in between vacations, we transitioned that remote learning team into the virtual learning team. And there are 2 dates at the very bottom, all the way on page 65, that we have met as virtual school admin planning meeting. And that's where, as Mr. Pauly mentioned, a lot of principals had called families. If a family on the survey had indicated they wanted virtual learning instead of just saying okay and running with it, we've actually contacted all roughly 325 families just to confirm. And there were a lot of confusion about the vocabulary. So we had a conversation with each of those families, talked about whether remote or virtual was better for them. And then now we're moving forward with setting up schedules. And they've been talking with counselors this week and last week at Eastmont and Shawsville.
Great.
Any questions about the virtual school program?
This is so great. If something coming out of this like bad virus case, I think this is going to be.
Absolutely.
So thank you for all the.
I think
mean,
we're going to see
we've-
a lot of
we've- yeah.
students really succeed.
What are the numbers? Say those again between Shawsville Middle and Eastmont High.
There are 50 middle school students, 53 high school students, and we still have roughly 75 students that are undecided or have not responded to our outreach.
So already over 100 students who now will be Eastmont students through the virtual program. That's pretty amazing. I think it will
That's
continue to
awesome.
grow and be popular. So.
And
very
those
good.
numbers do not include homeschool students. We had a big outreach to homeschool students that may want to take advantage of some of our opportunities. We've had I'd say roughly a dozen that have enrolled on a part-time basis or more. And those were not included in that as well.
That's great.
That obviously will, one thing all this is doing, I think it's going to help our ADM as well. So.
Yeah.
Excellent.
Any other questions? Mr. Chewbacca, do you have any question?
It just got answered. Thank you.
Thank you so much. Welcome back, Mr. Nutt.
It's good to be back. And by the way, thank 5 of you for your favorite color being blue. I like it too. So as far as staff supports goes, as you have previously heard today, we have developed phases and levels for our reopening that will help guide us as we continue to navigate our path back to normal school. In these phases and levels, our employees will work remotely if their job duties permit. In phase one, level one, in phase one, level one. In phase one, level 2 and 3, all employees will work in their work location, but may bring their own children to their classroom. In all other phases and levels, our employees will work in their work locations, follow mitigation practices, and their own children will attend their child's school. So that way we're providing that child care or opportunity to take care of their kids for the employees. Throughout the early stages of this pandemic and continuing into the future, the HR department has and will continue to respond to employee concerns promptly and be as flexible as possible. Flexibility is the key word. We will also frequently remind our employees about the need for them to be taking care of themselves. We have a great program, the Employee Assistance Program. Should an employee need professional assistance, that is a benefit that they have, the ability to talk to someone professionally free of charge. So we will continue to remind our employees of this. We do expect our employees to work in their work locations on their assigned days. As always, an employee can use their accumulated sick leave, personal leave, wellness leave, and if they're in a 12-month employee, annual leave, following the provisions that are outlined in Policy 5-7.5. If any of our employees have qualifying needs, they can also apply for family medical leave, or FMLA. This act provides certain employees with up to 12 weeks of unpaid leave, job-protected leave per year. Qualifying needs include for the birth and care of their newborn child of an employee, for placement with the employee of a child for adoption or foster care, to care for an immediate family member, that's a spouse, child, or parent with a serious health condition, or to take medical leave when the employee is unable to work because of a serious health condition. An employee can also take intermittent family medical leave, which means they're not using the 12 weeks or any time consecutively, but at different periods of time throughout the year. They are limited to 12 weeks of family medical leave per year. The Families First Coronavirus Recovery Act expands the reasons for which an employee can take FMLA and also be paid. For the following reasons, an employee is entitled to their regular rate of pay for up to the number of hours their work schedule provides for a 2-week period. If they're subject to a federal, state, or local quarantine or isolation order related to COVID-19, if they have been advised by a healthcare provider to self-quarantine related to COVID-19, if they are experiencing COVID-19 symptoms and are seeking a medical diagnosis. Under FERCA, an employee is entitled to 2/3 of their regular rate of pay for up to the number of hours their work schedule provides for a 2-week period for these reasons: is caring for an individual who is subject to a federal, state, or local quarantine or isolation order, or an individual who has been advised by a healthcare provider to self-quarantine related to COVID-19, is experiencing any other substantially similar condition specified by the Secretary of Health and Human Services in consultation with the Secretaries of Labor and Treasury. To date, those agencies have not given us any guidance, so that really doesn't apply at this time. They can also, if they are caring for a child whose school or place of care is closed or child care provider is unavailable for reasons related to COVID-19, they also can earn 2 weeks of unpaid leave, but that can be expanded to up to 12 weeks total by the Emergency Family and Medical Leave Expansion Act. That would be for 2/3 of an employee's regular rate of pay. This applies to an employee who who has worked for us for at least the last 30 days and is not able to work or telework due to the need to care for a minor child because the child's school or provider of health care is closed or unavailable because of COVID-19. Some employees may also be eligible to receive reasonable workplace accommodations under the Americans with Disabilities Act. If an employee feels they meet the criteria for ADA and would like to request a workplace accommodation to reduce the risk of exposure to COVID-19, they should contact us in Human Resources. In the event that an employee uses all available leave to them under FMLA and FERCA, they will be provided the opportunity to apply for extended leave as applicable under School Board Policy 5-7.5. To help our employees know when to take sick leave, because some of our employees, especially teachers, come into work sick at times, and we don't want them doing that during this time. We're going to give them some guidelines as to for illness, and if they're the first one, if you feel sick, take a sick leave day. If you feel ill and are concerned that the illness is COVID-19 related, take a COVID-19S. That means the S stands for self day. Notify Human Resources and seek a medical diagnosis. The COVID-19 S code does not count against the employee's accumulated leave. That is something we are giving them at this time. If you feel the need to self-isolate out of an abundance of caution, but have no symptoms, and this is due to traveling or possible exposure, you take a COVID-19 S day while quarantining. Notify HR and seek a medical diagnosis. Since the employee is not experiencing any symptoms, they will teach remotely from home with supervision assistance from their substitute. If the employee begins to have symptoms, they will just need to prepare lessons for a substitute and attend to their illness. If at any time an employee feels ill or their illness is diagnosed as COVID-19, any employee-related leave that they have taken will convert to a COVID-19 D. D stands for diagnosed, and you will not be charged with any. They will not be charged with any of their leave. That's a benefit that, in talking with other HR directors around us, they're not doing. I think we're the only division locally that is helping employees.
I
with
know
that.
Pulaski's not doing that.
As usual, our substitutes will use the Frontline Substitute Management System to accept and decline jobs. If a substitute has any COVID-19 symptoms, they will decline any jobs they have and notify the Assistant Director of Human Resources. We will provide substitutes with training aligned with the health and safety and instructional plan approved by the board. We are also working to identify other areas where substitutes may need additional training due to COVID-19. We did develop guidelines for our employees who traveled over the summer. Travel is not limited to the summer, and so these guidelines will continue to apply during the school year because we know people will take weekend trips. The important point here is that these guidelines are about an employee's behavior while traveling and not necessarily about where they go. Certainly there are hot spots all over the country, but the reality is that any of us can go to our local grocery store and come in contact with a COVID-19 positive person. So if an employee can answer yes to these questions, they can return to work and monitor themselves for symptoms. Did you wash your hands regularly? Did you use physical distancing? That is 6 foot separation from those outside of your household. Did you wear a face covering when physical distancing was not possible? Did you avoid large crowds? Did you refrain from contact with any known COVID-19 cases? If an employee answers yes to those, they come to work and monitor for symptoms. If they answer no to any of those questions, then they work from home for 5 days following their last travel and arrange for a COVID-19 test, and they need to notify us, and we will work with them to help them with that. We do anticipate some employee shortages this year. The areas that we're in most concerned about are substitute teachers, custodians, bus drivers, and school nutrition employees. And we're in the process of an all-out media advertising campaign. We're going to put signs up on the bus like we have done before. We're going to put signs up at schools all around. We're going to advertise, work with Brenda to get it out on social media, and just do our very best to get as many of these positions filled as possible. If or when we do confront an employee shortage that affects the safety of our students in schools, the superintendent will inform the board and seek consensus on the potential need to reduce the number of in-person classes and maybe changes from one phase and level to another phase and level. Do you have any questions for me?
Questions for Mr. Nutt, board members?
So with all the shortages that you just,
I'm sorry.
no, with all the shortages that you just outlined, do you have a number for each one of those groups?
Right now, the only number that I have at this time that I feel confident with is the custodians. We are about 6 custodians short right now of regular custodians, and we're still working to hire the temporary custodians, which would be 19, one for each building. We have some out-of-the-box ideas for that. We think that the information or the proposal that Mr. Krantz talked about earlier for custodians will help in that area. So we're hopeful that that's going to help. But we also have some out-of-the-box ideas, possibly if we have some students who are 18, want to work, we could potentially use them like we have done in the past with student workers. Also, we have the ACE volunteers that need the ACE students that need volunteer hours. So we may be able to use some of them to help on a voluntary basis. Dominic is looking into as many different ideas as he can to try to help with this. Substitutes, we do know we're down right now about 160, but we had 500 substitutes, 527 substitutes last year. So we still have a sizable number of substitutes.
Until we call them and they say, nope.
That's a possibility.
How many of those are the retirees?
We have approximately 37 who are in the RIHIP program. So those are the ones that I think you're talking about. We have approximately 37 of those, and we are working with them to help them, get placed and get jobs quickly, so that they can earn their 35 days and then start earning pay if they want to earn the pay.
Okay, so.
Danny, I have a question.
Yes, sir.
So as far as substitutes go, and as far as our own staff, I guess, if they have to hunker down at home, is there a plan to switch any of the in-person, but let's say we're up to 50%, is there a plan where a teacher, let's say a teacher can't, for whatever reason, needs to quarantine or needs to isolate or something for a few days, that teacher can't basically go full-time remote as a teacher at that time? In other words,
yes.
do you have to, do you understand what I'm asking?
If they're being quarantined, but not necessarily sick, then
Correct.
we would ask them to teach remotely.
And their substitute we would work to acquire a substitute for them who would supervise their students in the classroom while the teacher is teaching remotely in that situation.
I think you just mentioned that in the plan, didn't you?
Yes, ma'am.
You just read that out of the plan. Okay, I thought so.
How are you going to have substitutes that are trained to be able to use the technology that we're going to be using for the synchronous learning? And I mean, it's being a substitute, going to a classroom and just taking somebody's sub plans and kind of, just getting things done for the day is one thing, but to go in there and get on the Chromebook and get logged in and that's a whole another thing.
Many of our substitutes have been using our Google Classroom, and I feel like, yes, it is going to be a challenge, but I feel like they'll be able to adapt, and we're going to do everything we can to work with technology to provide them training prior to going
Well, that's
in.
what I was going to say. I was
Yeah.
wondering if we had any plan to get them trained also.
That's
Okay.
that's one of the things we're working to identify now so that we can put that in place before they go in.
Yeah, because that would be a tough spot to put somebody in.
Yes, ma'am.
So you mentioned cafeteria workers also? How many? No, yeah.
I do not have, Dominic, do you have a number? For T&G? Yes. We'll bounce that around. Dr. Meyer? No.
There's 28 positions short. Most of those are minimal hours, and when evaluating the staff by school, it would not impact our opening, but if our participation were to get back to a higher level, we would struggle.
Any other questions?
Any other questions, board members? Thank you, Mr. Mayor.
Thank you.
All right, now speaking of RIHIP, and I think and Dr. Graham is up. She's helping us out. I think this counts for 2 of her 35 days tonight. So that's right. So Dr. Graham
Stay another
has
hour.
been a tremendous asset for us to actually put together our child care program, which is going to be huge for our family. So Dr. Graham.
All right. So I was asked to help coordinate the child care services, as Dr. Meyer just said, and appreciate that the board realized that child care would be a real need for many families. I'm not sure every school system is having someone help coordinate that. So as that, my goal was to identify providers, to encourage growth, to make information available. And as noted earlier, the goal was to coordinate childcare being provided at phase 2, level 1, since you can't bring children back until the general population is in the building. So you don't have a need for childcare before phase 2, level 1. Some accommodations to the board for even thinking about how we might coordinate this as a division. The first step, as I said, was the identification of providers. MCPS currently has 5 schools that run before and after school enrichment programs, and those have just been before and after school. Those programs are self-sustaining, they're fee-based, and they've proven to be valuable for our students and a great service for the families. They're located at Price's Fork, Beeks, Harding, Gilbert Lincoln, and Bellevue. Another provider is the Boys and Girls Club, which is at Eastern Montgomery Elementary School. That program has been grant-based and it has been free. And then we have several private providers, and I'm going to quickly list those. We have Adventure Club, which has their own site, and they've paid facility fees across or over the years at several schools to use our school sites. Children's Academic World, Children's Nest, Little Lambs, Honey Tree, Pathways, and Rainbow Riders are all our private providers. We also have 2 activity-based programs that are developing programs to match our scheduling needs for this new schedule. Those are Tech MMA and Fitness Academy and Virginia Techniques. And we've also worked closely with the Y Center, which is in Blacksburg. They've done more of a tutoring, but they're working with us through this as well. What I did was I called each private provider, and I'm very pleased to say that overall the programs have been extremely supportive. Almost every single one of them indicated that they were going to increase capacity based on the new schedules. They also indicated their challenges are the same as ours: space, transportation, and staffing. The Boys and Girls Club, in my conversation with them, has applied for an amended grant and possibility that one program may be free even if they go into the daytime care, which is their plan. So they don't have that in the grant yet, and we're hoping the grant will come through and it will be free for students. Either way, they will offer a program. The Y program's looking at how they can extend their program and support MCPS. The Rainbow Riders program is going to start offering a remote learning program for about 20 students, as well as extending into daytime options for kids in kindergarten through 5th grade. Then Adventure Club, Honey Tree, Pathways, Children's Nest, Children's Academic World, all are expanding to increase their capacity. Just got a call last night from KinderCare, which is in Blacksburg. Before, they've only served children under the age of 5. They're going to start taking some school-age children. They have not shared what their capacity will be yet because they're still working on their plans. So after identifying all the programs and talking with all the childcare programs and hearing what they were going to do, I knew that we still needed to expand our before and after school programs to accept students in the daytime. To do that, our programs needed space outside of the elementary school site because we're using the school during the day. And likewise, the adventure club sites that have been at our schools needed a place to be during the day. So I have listed those locations for you. I just confirmed today that Gilbert Lincoln site will be at the Y Center. I haven't seen that center yet, but we'll be seeing that later next week. In addition, as I mentioned, they plan to offer some programs for tutoring probably at the secondary level. We owe a huge thanks to Blacksburg United Methodist. They are going to serve Harding Avenue and let us use their facility. We're still working on the agreement with them. And then you'll see Scattergood is listed. Scattergood is the Adventure Club site. And they have a large amount of space there. And then you will see that we're using several of our secondary schools in several instances as we were able to designate a space within the secondary school, like the auxiliary gym in some cases, to house our daycare program. And we're still waiting to hear back from First and Main. We may use some of their space as well. I'll be looking at a space there tomorrow. So once we looked at the space, then the next consideration was how would we staff the MCPS programs during the daytime. The managers of our current before and after school programs have been amazing. Every single one of them has agreed to take on the extra responsibility of running a day program, which is not a small responsibility. So I've had Zoom meetings with them and with Adventure Club and the Boys and Girls Club to talk about what that will look like. In staffing the programs also for our MCPS programs, we've reassigned the lunch and the recess aides to help with childcare. We're still in the process of hiring many of those, which is proven again to be a challenge. Then what I did was I took the survey data that you have and the capacities that each program said they could take. I used the Wednesday data because every single parent filled this out, and Wednesday was a clear data point because there's no school on Wednesday. The non-Wednesday days, people didn't know if they were going to be an AM schedule or a PM schedule, so I think there may have been some confusion. So don't know how good that data is, but looking at just the Wednesday data from the surveys, it looks like we do have enough capacity. And of course, I mentioned KinderCare is going to start offering some slots too. When I looked at the non-Wednesday data, we may be short about 30 slots in both Christiansburg and Blacksburg. But overall, that's not too bad. Obviously, we want enough slots for every child. So based on the survey data, it does look like we'll have enough spaces, definitely for Wednesday, and maybe a little short on the other days. What we don't know is how many parents will use relatives, neighbors, that kind of thing. It still said they needed daycare, nor do we know how many did not complete it that might need daycare. So it's survey data. Other considerations were the fees and registrations. We wanted to keep those low, but remember our programs are self-sustaining, so we want to be able to pay our staff. So everybody tried to keep it under $4. Most are running around $3.50 per hour. Transportation, as Mr. Krantz explained, for those programs that are in our schools, the midday part is where we're going to do transportation for those that are in zone. Meals will depend upon exactly what the nutrition department does, but we'll participate in the meals as well. Safety protocols, the private providers will use their protocols as their protocols for their child care centers are pretty directed, and they've been operating anyway. So they'll continue with their protocols as are required in private programs. Then for our programs, we're going to follow what we do for the school system. So we'll follow the same protocols that you eventually agree upon. And technology, been working with Mr. Wickham He's looking at the sites to make sure that our students hopefully can have enough internet capacity that part of the time that they're at daycare, they can also be on their devices to do some homework or whatever. And then communication, sites are providing care as, oh, I've listed all the sites that are providing care are listed in the frequently asked questions, as well as schools will let parents know as well where they might look. And then I also wanted to say a thanks to the ACE program. We did have students sign up that they wanted to do their community service with the childcare. So depending upon all your decisions, that's we have about 24 students that would love to do their community service in helping the childcare programs. So I want to thank you all. Thank all of you. Join me in the hope that we see the end of the pandemic this year so students can return to school full time and the daytime programs won't be needed. But in the meantime, it's very evident that the community is trying to support the needs of families through offering childcare services. Any questions that I can answer?
Dr. Graham, let me add one point I think is very important for everyone to understand. There's no childcare in phase 1 levels 1 through 4. It's not until phase 2 level 1 that we offer childcare, because it is that is the first time we allow the general population of elementary schools students to come back in at 25%. I cannot, we don't think we can justify having childcare for the general population when we're not allowing them to come into the schools.
Right.
And so it is not until that, and that's the phase 2 level 1 when 25% of the pre-K through 3 will come in. Okay. All right.
Any questions to Dr. Graham?
And so my board docs went away again. The remote learning, what does that mean?
That's what Ms. Wickham was talking about. So at Rainbow Riders, they're going to assign, I think, 2 teachers to basically a classroom where children can participate electronically rather than.
And you did say something about cost, but I was trying to get my.
Said all of our daycare programs try to keep the cost low. It runs about $3.50 an hour. Didn't make every daycare program keep the exact same cost because they've been operating at slightly different cost, and we didn't want, once this is over, for them to have to go back and change that. But they're all under $4, mostly running around $3.50 an hour. Some offer what's called a flex plan. Some do it by the weeks, but they're all about the same.
Okay, so I know Jamie brought up the issue of transportation and getting children to childcare providers, whether they be hours or.
Yeah, several child care providers mentioned, for instance, that they would love for us to transport children to them, but if they're out of our zone, then we don't provide transportation during the year, and we certainly won't be able to do that now because our busing will already be tight. But all those that are MCPS programs, we will be providing that midday transportation piece.
So how many MCPS openings or slots do we have? Do you know the number?
If you look at this little chart, it breaks it down by the number of slots that we'll have available at each one. Now, once they sign up, we'll be able to actually say that's how many children are in that zone. And then I have another chart, I didn't put it in here, of how many slots each site will have. Bellevue has 35 that they're planning on serving. Beeks, I think, is 50. So each of our sites is broken down a little more.
That's a lot of work, a lot of conversations. So appreciate that, because this is a huge piece of how our families are going to be able to or not send their kids to school, just half days especially.
And it's also as many families have mentioned, it's financially something they weren't expecting to have to do.
Absolutely.
So it's a challenge for families that we recognize. So this is one small way of helping.
Thank you. A lot of work.
And thank you for taking the load off the principals and doing this. I know that was very much appreciated from them.
Thank you.
It's always good to see you. Keep coming.
Thank you.
Thank you, Dr. Brown. Ms. Diggs, equity?
It is still good evening. So I'm going to take you back just for a minute and think about those instructional plans that have been presented to you tonight. And you will notice that they were all designed to assess and meet the needs of our student, and that was purposeful. They also paid special attention in giving and meeting the needs of our students through their learning, social, emotional, and safety needs, so that we were intentional about including our vulnerable and special populations. So while we were intentional on addressing the needs of our students, we also recognized that our plans are not perfect and that we will need to continue using an equity lens to assess their needs. The Virginia Department of Education provided an equity audit as part of the Return to School Planning resources. The audit is a decision guide that helps us facilitate how we are going to center equity through reflection, strengthening relationships, mitigation, and offering supports to our students and staff. The audit is divided into 8 categories, and those categories include how we're going to develop our plans, cultural competency, meeting student needs, student and family engagement, communications and community engagement, as well as instruction and resource allocation. Our instructional teams use the audit to inform their decisions to make sure we are meeting the needs of all learners, especially those disproportionately impacted by school closures or learning loss. In addition, our division equity team stakeholders met to review the considerations that were provided in this document. And the document was attached to this page. So upon approval of this plan, once this our whole plan has been approved by the school board, the equity audit would then be completed. And any recommendations from the audit will be given to the school board for consideration so that the plan can be amended as needed. Do you all have any questions regarding the audit?
Any questions to Ms. Diggs?
So for me, equity has been something that I just don't believe can happen with remote learning. There's going to be a lot of children that fall through the cracks through this whole process. I think everybody recognizes that, and public education across the country is going to take several years, unfortunately, to catch things up. Just going to have a lot of work to do with this audit once we get.
It will be, no doubt. We've had a lot of discussions about it already. It's
And we'll continue to pay attention to the equity piece as we move through this.
correct.
Okay.
Yes.
All right. Thank you, Ms. Diggs.
Thank you, Ms. Diggs.
All right, Ms. Whitaker. It's been about 10 hours since we had you here. So,
Well,
yes.
good morning. I believe I was here at, or good evening, at 1 o'clock this afternoon, right about the same time.
I just want to warn us that in 15 minutes, we have to decide to
Extend the meeting.
extend the meeting.
Can't we just decide now? We have to wait till 11:30.
11:30.
11:30.
We can't decide now.
We can decide right now,
Ms.
or
Drake.
we have to
And
wait
there's
for
no way we're gonna be
11:30.
done by 11:30.
No, no.
Can they vote to extend before 11:30?
Or we have to do it at 11:30.
You can vote now. My request is that if you do move to extend, that we take a break. We are hitting the maximum amount of time we can live stream. And so we have to stop the live stream and restart it. It's going to take us 5 to 10 minutes to do that. So if you do move forward to extend, we'll need to adjust in the back as well and stop that live stream and restart it, just as an FYI.
So we will be able to continue to live stream.
We just have to start it. We have to stop it.
Start,
We have
stop.
to start a new video.
Yeah. What, you want to vote now to do that and then take a 5-minute break? Just a
5
quick,
to 10.
quick.
But yeah, they can absolutely vote whenever.
After 11:30, I'm just not, I don't want to be making these decisions that late. I mean, we've been here 10 hours.
I think these decisions have to get made tonight. I do not think we can wait.
I think only 14 and 15 have to get made tonight. The others can.
10 more questions.
I don't think the rest of the agenda needs to be done tonight. No.
Yeah. Well, actually, yes, some of it does.
Yeah, it
Some of
does.
them
That's,
does.
yeah, it really does. And
I
so-
don't think we can, there are people who sat for 10 hours listening to this live stream, waiting to hear these next few answers.
Yeah, I agree.
Okay,
Yes.
so,
You cannot, we have to do that.
so we need to
I agree.
identify what we need to do this evening and move to those items. And we need to figure out when we come back and finish the rest of it.
We have to at least
14
finish
and
up the
15.
plan and,
And then the other business on the agenda. The paying the bills, the consent, the grant.
14 and 15, obviously we have to do the other calendar decisions that can be made in at the August 4th meeting, if you'd like.
Yeah.
I'm fine with that. Because I think they're all adjustments that are after school starts, whenever that is.
but without those, can we approve the plan?
Um,
Overall plan, I mean.
yes,
Okay,
yes.
I just
We
wanna
can
make
make those
sure.
adjustments later in the school calendar.
Yeah.
okay.
So the next two questions, but then on the actual agenda itself, we looked at what had to be done tonight, and trust me, we took everything off that we could
Yeah.
for tonight because of timing of some things that have to get done with some grants.
So why don't we take a break to stop the video? Before that, we vote to extend the meeting until we finish 14, 15 and the rest of the business. And then questions
Yeah.
after that.
I'm fine with it.
Right. And
Sounds
then
good.
too, with the closed portion of the personnel agenda,
Mhm.
it's just the personnel, it's just a personnel report.
Right.
If no one has questions, we do not have to go into closed session. Is that correct? We don't, it's up to you guys. We don't have to go to closed session with the personnel
Okay.
report. There's nothing,
Yeah.
special to
Yeah.
report at that point.
So we can just approve the personnel report before.
If you all want to take a look at it, next
Yeah.
couple minutes, next few, see if you have any questions that need to be dealt with in closed session. We do not, if you do, that's fine, but if not, we do not have to go into closed session for the personnel report.
So I make a motion that we extend with the criteria I just mentioned.
Can I have that criteria repeated, please?
Sure, to answer 14 and 15. To get through those two questions with the rest of Ms. Whitaker's presentation. And then the remaining business. on
All right,
the agenda.
we can do, let's see. Yeah, no, we're good with 18. Yes, 18 was dealing with Labor Day. We can still do that August 4th, yeah. So yeah, 14, 15, and then.
What? What did you say there?
I said, Mr. Polly's asking about number 8, discussion point 18 regarding Labor Day on the calendar, but that's something that can still be done August 4th.
We still have it.
Yeah, it's a month,
yeah.
it's a month ahead of it, yeah.
So that is,
So we're going to answer, we're asking the board, one thing we have to do tonight is discussion points 14 and 15. The rest of it can remain and be answered on August 4th.
Right.
okay, so What is the issue around Labor Day?
It's just I mean, it's just one of the calendar questions. The rest of the
Yeah.
questions after 15 are calendar
They're all
questions
Right.
calendar
and
questions.
adjustments to the calendar based on what you decide as a board to do
Mhm.
in terms of opening school, not opening school, what's the
Right.
first day, what's not the first day, that kind of thing.
Right. So we
Yeah.
can do those August 4.
So to make sure it is clear that we're answering 14 and 15 and approving the plan
And the rest of the business.
and then doing rest of the business
And there's a
without
motion,
closed session.
right? There's a
we don't
motion
have
on the
questions.
table.
And
Okay.
Oh,
we're
sorry.
the
taking more
motion I
time to
have
discuss
also
what the
includes that,
Let's go.
that the other calendar questions will be brought back to the board on August 4th.
Correct.
That's
Yeah.
also included
Yeah.
as a component.
So there's a motion. I need a second.
Second.
Thank you. Now, all those in favor?
Aye.
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 Any opposed? Thank you. We'll continue. Let's continue at 11:30. 5 minute
Yes.
break.
Promptly 11:30 be great.
Promptly 11:30.
Power nap.
I may not be moving from my chair.